Good morning, everyone, and welcome to the third day of the Adhishtita National Seminar presentation. Today, we are excited to bring you a wide range of topics that are both informative and thought provoking. But before we dive into the presentations, let's take a moment to express our gratitude to the dedicated panel members whose tireless effort have made this event possible. Their hard work and commitment have truly been the driving force behind the successful of this seminar. With that said, I am confident that today's presentations will prove to be beneficial and insightful for all of us. So without further ado, let's proceed with today's lineup of presentations. First, I'd like to invite a paper presentation. I would like to invite Dr. Rombicherla Vishnupriya for the paper presentation on the topic Nidra, an imperative core of life.
Good evening, everyone. Myself, Dr. Vishnupriya, first year PG scholar, Department of Swasthagurta, Sri BMK Ayurved Mahavidyalaya, today to present the topic Nidra, an imperative core of life, under the guidance of Dr. Sandeep S. Sagare, Reader, Department of Swasthagurta and Yoga. These are the contents. Introduction. Nidra is one among most essential factors responsible for a healthy life. It is one of the Trayopastambhas. Nidra plays very important role in human life. It plays a role to give happiness or sadness, strength or weakness, knowledge or ignorance, life or death. It is said that Srishti is formed when Srishtikarta Lord Brahma is in awakened state and it will destroy by Pralaya when he goes to sleep. Nidra in Vedas. In Rig Veda, the oldest of Vedas, refers Nidra as divine power that provides rest and rejuvenation. Yajurveda discusses Nidra as rituals, highlighting its importance in spiritual practice. Samaveda explains it as a form of meditation, emphasizing its ability to quiet the mind and senses. Atharvanveda acknowledges the importance of rest and rejuvenation through sleep. In Upanishads, Mandukya Upanishad explains Nidra as one of the four states of consciousness, representing unconscious state of deep sleep. Taittiriya Upanishad discusses Nidra as means to attain self-knowledge and spiritual enlightenment. Katha Upanishad, Nidra is portrayed as a metaphor for illusion of physical world, which must be transcended. Objectives are to know the benefits of sleep, to know the physiology of sleep, and to know the effects of sleep. Trayopastambha, along with Nidra, Ashtanga explains Ahara and Abrahmacharya, and Charaka explains Ahara and Brahmacharya. Nidra Nirukti, Deham Vishramate Yasmat, Tasya Nidra Prakirtita. It is from two words, Ni and Dra. Ni means downward movement or into. Dra comes from root word Dhru, which means to hold or to sustain. The synonyms of Nidra are Shayanam, Swapnam, Tandra, Supti, and Vaishnavi. Nidra, Yada tu manasi klante, Karmatmana klamandita, Vishayebhyo nivartante, Tada swapati manava. The mind and soul, when gets exhausted, increases the tamoguna. The sense organs cannot conjugate with the objects, and this causes sleep. The types of sleep according to Charaka, Tamodbhava, Sleshma Samudbhava, Manashrama Bhava, Sharira Shrama Bhava, Agantuki, Vadanuvartini, Prakritika or Ratri Swabhava Janya Nidra. According to Sushruta, Vaishnavi, Tamasika and Vaikarika. According to Vagbhata, Kala Swabhava, Amaya, Chittakeda, Dehakeda, Kafaja, Agantuja and Tamodbhava. Benefits of Nidra according to Charaka are Nidra Ektam Sukam Dukam, Pushte Kashyam Balabalam, Rishita Klibata, Jnanam Ajnanam, Jivitam Nacha. Proper sleep causes nourishment, happiness, strength, virility, knowledge, increases the lifespan of individual. Improper sleep causes sadness, weakness, debility, absence of mind, and even death of the individual. According to Shushruta, Pushtivarna Balotsaham, Agni Deepti Matam Indriyam, Karoti Dhatu Satnyam, Cha Nidra Kale Nishevita. Proper sleep imparts Pushtivarna Bala Utsaha, Agni Vritti, Atindriya Jaya, mastery over senses, and Samyavastha of Dhatu. Bhav Prakasha explains as Nidra tu Sevita Kale, Dhatu Satnyam Tadindritam, Pushtita Varnanam Balotsaham, Vagni Deepti Karoticha. Bhav Mishra opines Nidra Nidra in proper time provides Dhatu Samya, absence of Tandra, Pushti Varna Bala, Utsaha, and Agni Deepti. According to Ashtanga Hridaya, Akale Ati Prasangasya, Nasha Nidra Nishevita, Sukhayushi Parakurya, Kala Ratri, Rivapara, untimely sleeping, oversleeping, and not at all sleeping, words of happiness and longevity like goddess Mahakali. The effects of sleep are Ratri Swabhava Prabhava, Mata Yatam Yusham, Bhutadatri Pravadanti Tagnya, normally occurring sleep at night is nourishing and refreshing and hence called as Bhutadatri. Basically, waking nights causes dryness, increasing vata, causes vata disorders. Sleeping in daytime causes anxiousness, increases kapha, causes kapha disorders. And sleeping, sitting in a chair is neither ruksha nor abhishyandi and may have a day nap. Divaswapna is indicated in Grishma Rutu. There is accumulation of vata. Here nights are shorter, so it is beneficial to sleep during the daytime. On Dhatu, on Rasadhatu, Pushti and Varnaprada, Rakta, Varna and Agnidipti, Mamsa, Pushti and Bala, Medha, attractiveness, Asti increases Bala, Majja, Varna and Utsaha, Shukra, Utsaha and Ojas, Vriddhi. The effects of Nidra Nasha are Angamardha, Shirogauravam, Jrumbika, Jhadya, Glani, Brahma, Apakti and Tandra. Nidra is one among the Adharanya Vegas. The suppression of Nidra Vega causes Jrumba, Angamardha, Tandra, Vibhanda, Angashula, Shirogaurava, Akshigaurava. It is advised to sleep for some time and conduct light body massage as a treatment for this. For Nidra Nasha, Ahara indicated are Kshira, Mamsarasa, Ghrita, Ikshurasa, Vihara, Angamardhana, Akshitarpana, Shukashaya, Dinacharya, Padhabhyanga, Shiroabhyanga, and Udvartana. The Agraushadis mentioned for Nidra are Mahishi Kshiram, Swapnajananam Shreshtam, Pushtihi, Swapnakarana, and Atiswapna is Tandrakarana. According to Modern, the sleep is a normal, reversible, recurrent state of reduced responsiveness to external stimulation accompanied by complex and predictable changes in physiology. These changes include coordinated, spontaneous, internally generated brain activity and fluctuations in hormone levels and relaxation of musculature. These are the different sleep needs of ages and conditions. There are 5 stages of sleep. The stage 1 includes 5 to 10 minutes drowsy state, transition between wakefulness and sleep. Stage 2 lasts for 20 minutes, light sleep stage. In this, body temperature decreases and heart rate slows down. The stage 3 lasts for 30 minutes, moderate sleep stage. Proper sleep occurs at this stage. The stage 4 lasts for 30 minutes, deep sleep stage. If prone to sleep, waking occurs at the end of this stage. The 5th stage lasts for 10 minutes, which is REM sleep stage. The muscles become more relaxed and while brain system becomes active. In this stage, the dreaming occurs. The circadian rhythm is the body's internal clock regulating the sleep-wake cycle and various physiological processes over a 24 hours period. It is influenced by environmental cues such as light and temperature. It has a role in sleep regulation, the circadian disruptions and nidra nasha. Its impacts on health are chronic circadian disruptions are associated with various health consequences, including increasing risk of obesity, diabetes, cardiovascular disease, and impaired cognitive function. Managing circadian rhythm disturbances is crucial for mitigating the risk of nidra nasha and associated health issues. Research study shows that Yoga Nidra practice can improve sleep in patients with chronic insomnia. A comparative study on Shirodhara and Shirobasti on primary insomnia with Kshirabala Taila proves that Shirodhara is more beneficial. Anidra can also be managed by following proper Ahara and Vihara. The conclusion is sleep is an important part of lifestyle. It is essential for good health, good quality, and performing well during the day. Inadequate sleep impairs ability to think, handle stress, maintain healthy immune system, and moderate emotions. All kinds of perception and connections with external world are blocked in sleep. Those who resort to proper sleep are free from diseases, have pleasant attitudes, endowed with strength, complexion, and virility. Thank you.
Thank you, Dr. Vishnupriya. Thank you for the remarkable presentation. Next, I would like to invite Dr. Sheetal Subhasravu Magre for the poster presentation. Dr. Sheetal, are you there?
Yes, sir.
Good evening, doctor.
Good. Sir, can you share the slides?
Sure, doctor. Just a moment.
Okay, sir.
Please start the session, doctor.
Yes, sir. Good evening, everyone. My name is Dr. Sheetal Subhash Ramagare. I am from GSC Nanded. and my department is Kriya Sharir. My poster presentation topic is importance of Koshta concept in Mutra Roga or urinary disorders. First is introduction. Koshta word is made from Kusha Dhatu. It means avarana. Koshta is a cavity found from avarana or wall, which consisting of different structures. That is, the definition of Koshta is Nabhistanantar Jantaho iti abhidhyate. That is all organs from breast or breast or sternum to umbilicus or navi are included in Koshta. So this is the overall broad set of Koshta. कोष्ठ पुनरुच्यते महास्रोत्र शरीर मध्य महानिम्नम आम पक्वाश्च इति. According to Acharya Charat, Amasya is the optional name for Koshta. So Koshta consists of all organs from umbilicus to breast, and Amasya is also optional name for Koshta. So this is the broad aspect of Koshta. All organs from umbilicus to breast are included in Koshta. That is, stomach and vrukka are all, or Amasya or Vrukka are also included in Koshta. Then next concept is Amashasta Sneha Vrukko Pushyati. That is, fat present around the kidney nourishes the GIT or GIT mucosa or Sneha of Amasya. That is the another aspect which correlate the Vrukka Vikar with the Amasya Vikar. It is also seen that modern medicine like
Dr. Sheetal. Dr. Sheetal, are you there?
yes sir.
Okay, doctor, please continue.
Between Amasya and Vrukka. Amasya is a kapha dosha pradhana sthana, and Vrukka utpatti is from kapha, rakta and meda. So there is a correlation between kapha dosha in Amasya and Vrukka as a kapha dosha pradhana vyadhi. Also, medovahanam strotasam medohana strotasam vakkamulam vapahanam cha is included. So meda and kapha also correlated. Then in Ayurvedic literature, in Brahatri, it is found that following are mentioned as a Mutra Roga. Mutra Roga mentioned in Ayurveda are Mutra Prucha, Mutra Ghata, Ashmari, Mutra Kshay, Vruddhi and Prameha. So based on all this concept, clinical utility is that Ashmari, which is included in Purva Rupa of Arsha, Kafaj Arsha. So it also indicates that the Kapha is a base for Ashmari Vyadhi, which is common in children also. So for this, Acharya Vagbhat mentioned Avapita Gruta. Avapita Gruta is mentioned in Mutra Roga by Acharya Vagbhat, which act from Amasya to Vrukka. So this indicates that the correlation between Amasya and Vrukka Vikar. Also, respected Nanaji or Prata Joshi sir mentioned dialysis dialysis patient how recovered from amla pitta problem or dialysis by giving woman based on this concept. That is, all organ from umbilicus to breast are considered in Amasya. Amasya is a kapha pradhana organ and woman is the treatment for Amasyagat Vyadhi. So based on this, they give woman, he give woman for dialysis patient and he fully recovered from this. Thus, there is importance to understand Koshta concept, especially in Mutra Roga. Thank you.
Thank you, Dr. Sheetal. Thank you for the presentation.
Thank you.
Next is a paper presentation. I would like to invite Dr. Nikita Lande for the paper presentation. on the topic a review on Ritu prevalence in various of India.
Namaskar everyone and a very good evening to all. My name is Dr. Nikita Lande. I am a PG scholar, Swasthavritta and Yoga department from Vidarbha Ayurved Mahavidyalaya, Amravati, Maharashtra. And my topic is a review study on Ritu prevalence in various states of India. We all Ayurveda people know that Ritu, that is season, and the Ritucharya, that is seasonal regimen, are widely described in almost all the Ayurvedic texts. And we all know a year is divided into 6 parts, marked by changes in the weather, ecology, and hours of daylight. So India is home to an extraordinary variety of climatic regions, ranging from tropical in the south to temperate and alpine in the Himalayan north, where elevated regions receive sustained winter, snowfall. The nation's climate is strongly influenced by the Himalayas and the Thar Desert. To study this diversity throughout the India, one should know the factors which are responsible for Ritu prevalence in various states of India according to Ayurveda as well as modern science. Ancient Ayurveda described Ritus according to geography of India, same like modern science. And every individual have to adopt changes in ahar vihara, vegetation and weather according to various ritus, and that is the motto of this study, that is Ritu prevalence in various states of India. The objectives of this study are to understand the concept of Ritu prevalence, to study the Ritu prevalence according to Ayurveda text, to study the factors that are responsible for different Ritu prevalence according to modern science. And the study is completely based on explanatory facts and literature review, and the data collection is totally based on secondary sources like Ayurveda text and research papers. In the methodology, first we have to look for the causes of seasons, that is there are 3 main causes of seasons as Kal, Vayu and movement of earth. In Charak Sutra 6 we have seen the Kala Lakshanas, that is the sun, the wind and the moon being governed by the time and the nature and the path they follow, constitutes the causes of time, season, taste in drugs and diets, vitiation of doshas and bodily strength. Same in that chapter, Charak has stated that the year is divided into 6 parts according to seasons, and the Uttarayan, that is northward movement of the sun, and it act as a dehydration, bring about the 3 seasons beginning from late winter to summer, and the southward movement of sun, that is Dakshinayan, and its act of hydration gives rise to the other 3 seasons beginning with the rainy to the early winter. We all know that Charak and Shushruta has mentioned Ritucharya in their 6th chapter of Sutrasthar. The difference is only Charak has mentioned the months for the Ritu in a different way and Shushruta in a different way. For Shishira Ritu fall under Magh and Falgun months, whereas Shushruta has stated Magh and Falguna as a Tapa and Tapasya. And likewise, in a slide you can look for the other names of months according to Charak and Shushruta. The reason for Pravrut Ritu. We all know that Pravrut Ritu is always confusing to us, and we always feel amazed about Pravrut Ritu and its description. Shushruta has mentioned Pravrut Ritu, also Kashyap has mentioned Pravrut Ritu. The Kashyap Sahita has mentioned Pravrut Ritu in a peculiar way that states us Gangayam Dakshine Ufale Varsha Bahu Bhavati Tena Tatra Pravrutadikramah Ganguttara Ufale Shitam Bahu Bhavati Tena Tatra Hemanta Shishur Bhavati. As you can see in a picture, I have shown the path of Ganga river. So the south portion of Vindhya, that is the below part of Ganga river, where more Varsha happens, and so Varsha Ritu divided into 2 Ritus, that is Pravruts and Varsha Ritu separately, where is less Shit, and so there will no Shishi Ritu, only Hemant Ritu will be there. So below the Ganga river, which is in south, we have a Pravrut Ritu, and in upper portion of Ganga river, that is north portion of Vindhya, more Shit, and so 2 Ritus are there, Shishira and Hemant Ritu separately, and so less Varsha, so there will be only 1 Ritu, that is Varsha, and no Pravrut Ritu will be there. Again, the second part or a second cause of season is Vayu. We all know that Charak has mentioned in Vata Kalakaliya Adhyaya the functions of Vata very well. That states the actions of the natural Vayu moving in the world outside the body, showering of rains, flowing of rivers, bringing about maturity of flowers, fruit, shooting forth plants, classification of seasons, as well as 5 Mahabhutas manifesting the shape and the size of the products of the 5 Mahabhutas. And this everything happening in the universe is Vayu is responsible for that. Also, moon rays will moisture the earth while sun rays absorb it. When air is in correlation with moon, it will nourish the individual. When it will correlation with sun, it will absorb the nourishment. Like this, all the rasas made according to Kala Prabhava. They nurtures whole human beings and other animals on the earth. Third one is movement of Earth. We are very well aware about rotation, revolution, and precession. Principal elements of weather: atmospheric pressure and height, temperature and density, radiation, sun rays and space rays, humidity, cloudiness, precipitation, snowfall, hailfall, rainfall, and wind. We all have studied in our geography and science about this modern concept of elements of weather. So it is we need to understand that climatic regions of India are divided into 4 divisions and 7 subdivisions. You can see that 4 divisions and 7 subdivisions in my slides. So the first division is tropical rainy group. Tropical rainy group where high temperature occurs normally do not go below 18 degree in even coolest months, and the sub groups of this division is tropical monsoon rainforest, which comes under coastal lowlands, western ghats, southern part of Assam, where high temperature throughout the year. Rainfall is seasonal but heavy. May to November is rainy there. December to March is dry there. Likewise, tropical wet and dry climate is second sub division. Then dry climate group is second main division, where more evaporation and less precipitation happens, whereas tropical semi-arid steppe climate and tropical and subtropical desert region, tropical and subtropical steppe, these are the 3 subtype of that, where these dry climate group regions are Karnataka, interior Tamil Nadu, western Andhra Pradesh, central Maharashtra, and etc. Then the third one is humid subtropical climate, humid subtropical with dry winter regions, where foothills of the Himalayas, Punjab, Haryana plain adjacent to Himalayas, Rajasthan east of Aravalli range, UP, Bihar, northern part of West Bengal, Assam. These are all the parts of humid subtropical climate group. And the fourth one is mountain climate, where Jammu and Kashmir, Uttarakhand, Himachal Pradesh placed. So conclusion is, it is not possible to have the knowledge of suitable diet and regimen for different seasons without having the knowledge of seasons themselves. So even though a season are to be taken as a separate entities, they taken together constitute the year in as much as the same seasons as repeated in rotation every year. Further researches further researches should be done on seasonal variations and their preventive aspects on the basis of Ayurvedic principles. Discussion: for the maintenance of health, it is necessary that a perfect equilibrium is established with regard to the various forces acting and counteracting on the body. If there is an excessive deficiency in any respect anywhere, so it has to be neutralized. And so in this way, I tried to make you all aware from my study that India has various ritus and various prevalence of ritus, and we need to change our vegetation, ahar vihara, and everything according to that, and that is the importance of this topic. And thank you so much. Thank you.
Thank you, Dr. Nikita. Thank you for the well-explained presentation. Next is a case study paper presentation. I would like to invite Dr. Pooja S. Yadav for the paper presentation. Dr. Pooja, are you there? Hello, Dr. Pooja, are you there? We can't hear your voice, doctor. Hello, Dr. Pooja, can you hear me?
Hello.
Good evening, doctor.
Am I audible, sir?
Audible, doctor.
So wait 1 minute.
Okay, doctor.
I'm audible, sir?
Yes, doctor, audible. Doctor, can you reduce the volume of another Zoom connected device, doctor?
Wait, sir, I'm disconnecting one. Now it is okay, sir?
No, doctor, can you reduce the volume of another Zoom connected device, doctor?
Wait, sir.
Okay.
Now is it okay, sir?
Yes, doctor. Okay, doctor.
Okay. Very good evening, all, one and all present here. Sir, this presentation is visible?
Yes, Doctor, visible. Please start the session, Doctor.
Yes. Very good evening, all. I am Dr. Pooja Swaminath Yadav, PG Scholar of Kaichikitsa Department from Sri Jayendra Saraswati Ayurveda College, Nazarpet, Chennai. Under the guidance of Surendu Raut, sir, I am presenting a case study which is titled as Ayurvedic Management of Element Type of Facial Palsy with respect to Ardhitam. Bell's palsy is an acute element type of seventh cranial nerve palsy which leads to the facial muscle paralysis. Most common cause of the unilateral facial paralysis. And its etiology in modern it is they are saying that the exact cause is unknown, but this is maybe due to the viral infection like herpes simplex and other viral infection that causes the swelling of the nerve within the facial canal, which leads to the compression of the nerve. And the compression of the side is especially oftenly present at the genicular ganglion, which leads to the clinical features like sudden unilateral facial paralysis like element type, which has saggy saggy muscles like a face is sagging downwards and inability to close the eyelids, which result into irritation in the eyes, and some asymmetrical facial tones are there, and it is progressive. That weakness is progressive over the hours and to the days, and it is also present in the facial phenomenon. The investigation of this facial Bell's palsy is the nerve conduction 30 and the EMG. And according to Ayurveda, this is mainly correlated as a Ardhitam. But in Ardhitam, in various Samhitas, it is mentioned as the in Charak Samhita, it is mentioned as Pakshaghat plus Mukha Vakrita is the Ardhitam. And but according to Charkadatta, it is the Charkadatta has mentioned that the Pakshagata and Mukha Vakrita is permanent disability. Apart from that, the Mukha Vakrita is
Hello,
only
Dr. Pooja. Hello, Dr. Pooja.
Yes, sir.
Doctor, your screen is not moving, Doctor.
Screen is not moving, sir.
Yes, Doctor,
Wait,
screen is not moving.
Sir, wait, I'm moving, sir, from here only.
Okay, Doctor, now it's moving, Doctor.
Okay. So, should I move like this only?
Yes, Doctor, now moving, Doctor.
Okay.
It is Bell's palsy screen is intact.
Okay, sir. Now that in according to Madhav Nidan, the Mukha Vakrita is mentioned as a Ardhita. This is the table of content which I am going to explain in another slide. This is the patient information that the 63-year female patient came to the OPD on September month. In last year, the patient keeps complaining around since 5 days, that is incomplete posture of the left eye, upper eyelid, sticky white discharge from the left eye, but watery discharge from the right eye, pain in left ear with the discharge, facial muscle weakness on the half left side of the faces. And this is the patient present illness. That patient was apparently good before the 5 days before, and that once in morning, that family found that her face seems like asymmetrical, especially on the left side, face is drooping. Then she noticed that she unable to close her left eye and completely gradually, and it is gradually progressing. Then she started with the sticky white discharge from the left eye and purulent discharge from the left ear, along with the pain in the left ear. Then this patient came to our hospital for the management. And this is the past medical history of this patient. Then since 2013, she has a diabetic patient and she is taking OHA drugs. And from 2017 to 2022, she has undergone for the anti-cancer medication for the left breast carcinoma. And then 2023, she took the brain MRI because she felt that she was unconscious for the 10 to 20 minutes. That family has reported to the allopathic hospital. Then they took the MRI. But at that time, she was diagnosed with the primary hypertension. At that time, she started with the anti-hypertensive drug. And she is not a known case of the dyslipidemia and thyroid dysfunction. And this is the medication she was taking from 2023. And this is the anti-hypertensive medication she is taking from since 8 months. And this is the brain MRI which she took on the 2023 when she collapsed for the 20 minutes. And this in that brain MRI, the signs of chronic small vessel ischemic changes were seen, and chronic lacunar infarct was seen, and bilateral basal ganglia. And this is the family history is not significant history found in family history. The personal history was normal, but except for that bowel, she is having the constipation and irregular bowel motion. And this is the general examination of that patient. And this is the Ashtavadya Pariksha, where her nadi was the Vata Kapha nadi, and Mala was a Shushka Durgandha and Shashul. And other Ashtavadya Pariksha was normal, and Jiva was with. And that her speech was also that slurred speech. That's what it is aspashta, and other things are normal. And while systemic examination, there was no any other deformity is found. And in systemic examination, we conducted CNS examination, where that higher mental function was all normal, but apart from that, speech was slightly slurred. And in cranial nerve examination, we have examined the all cranial nerve, where the optic nerve was found that the right eye was pseudophakia and watery discharge, and left eye was found as sticky white discharge, dusty appearance, and the cornea, and decreased visual accuracy of the both eye. And this is the main examination we have done. That is the seventh cranial nerve. That is the face asymmetry of the face was found. Forehead was a frowning, and wrinkles are absent on the left side. Eyebrow raising, which she can't unable to raise the left eyebrow, and improper closure of the left upper eyelid, and blowing of the cheek decrease on the right side. Nasolabial flow loss on the left side. Dribbling of the saliva through the angle of the mouth, and difficulty in chewing and drinking. And this was the other also examination was done, other cranial system. And motor system was there is a significant decrease in the muscle tone on the left side of the face, and others are normal. And she can the coordination was normal, that there is no asymmetry was there, and that grimace was asymmetry. And reflexes, we have checked that orbicularis reflexes, we have checked that is on reduced and delay on the left side, and she has a blurred vision and delay. Corneal reflex was delay, and it is unable to make a pout on the both sides. It is more than left side than the right side. In that patient, we found the Bell's phenomena is positive, that is four-side closure and delay upward movement of the left upper eyelid, and incomplete closure of the left eye is positive. This is the Rasavida Pariksha of the patient, that is Prakriti was a Vat Pitta, and Vikruti was a Vat Pitta Rasa Rapta, and Mukha Ardha Mounta Adhisthana. And the other things was normal. She has a Satme of the Vaya Mishra, and we have, when we took the history, she has a history of that she was sleeping on the that floor. That's why maybe that is the cause of the this Arbitam. That is one of the causes which is mentioned in the Shastras. And if we differentiate diagnose this can be differentiated with the infection, that is herpes simplex and bacterial otitis media, and mainly trauma like fracture of the bony canal, facial nerve laceration, penetrating trauma, ischemic stroke affecting vasculature and vasculature of the cranial, seven cranial nerves, atherosclerosis, seven nerve palsy, UMN type of seven cranial nerve palsy, and element type of seven cranial nerve palsy. And the diagnosis of this patient is mentioned as the element type of the seven cranial palsy and Bell's palsy. That is in our Ayurvedic, it is mentioned as the Adhishtita. In this patient, we have given the Dhanayadi Kashayam, Shirabala Avarti, Dhanamantram Gutam, and tablet Anuloma for the internal medication. And after that, when patient came for the follow-up, she had some that cough and cold cough symptom. That's why we have given the Dashmum Kadutrayam Kashayam. But this is not related with the that patient's main case. And we have external treatment we have given as a Stanik Abhyang and Stanik Svedan with the Shirabala Tailam and Shirapath we have given, that Shira Dhuma, where cow's milk we have used at a 500 ml, and water we have used a 250 ml water, and balamul kashaya 50 ml. We have mixed this, and we ask the patient to take a steam and make a massage of the face. Then it can be relieve that symptom, and facial she can relieve from the facial prolapse and other things, facial sagging and other things. And we have advised patya apatya in the patient, this patient, and this patya apatya I have mentioned in this slide. And after 4 months of treatment, for assessing, we have assessed this Hoffman's house Beckman's grading. You can see, sir. In this, after 4 months of the treatment, before treatment, that function level was severe, and after treatment, it was moderate. And the symmetry at the rest, it was asymmetry, but after treatment, was asymmetry. But she has some different, like eyelid closure. It was before treatment, it was incomplete closure, and after treatment, it was a easy and complete closure. And mouth was asymmetry with the efforts, and after treatment, it was a slight affected with the efforts. And before treatment, she has forehead on the slight movement, and after treatment, she can move the moderate movement in the forehead. And this discussion of this why we have given this treatment, that is that abhyangam, that we have given Unmardan type of we have advised that Unmardan type of the abhyangam, that performing the pressure massage on the upward direction of the superficial stroking massage after the application of the oil to the palm, and it is indicated in the disorders of muscle. And we have advised to do this Unmardan with the Shirabala Tailam, which provides the strength to the muscle in the facial palsy. And Shirabala, it acts at the Bruhan, which provides strength to the weak muscle. And this both Shira and Bala is Bhatashamak, Balya and Jivani action. And we have given this Nihan with the Shiradhuma. Shiradhuma is a type of Drava Seda, that is fermentation through the liquid medium, described in Ashtang Hridaya. And while describing sedation therapy, the Chira and Balamula is both drugs are Dhatu Vardhan, Balya, Patahara, and Rasayan property, which can provide the strength to the facial muscle and alleviates the Vata Kapha dosha. And this same action is I have mentioned in one article, which I have described in this slide also. And we have given also the Nasyam. And Nasyam, we have advised to the patient that the Pratimarsha Nasyam, that is, as we all know the Nasa Sithodwaram. That's why we have advised the Nasyam. And Nasyam we have given with the Shira Bala 101 Avarti Tailam, that is more efficient than the effective than the Shira Bala Tailam, because it can permeate into the minute channel of the head due to the piercing quality which obtained by the Shatapaki Tail Kantana. And Shirabala Avarti Tail also possesses the Balya and Dhatu Vardhan property, which imparts the strength and nourishment to the sense organ. And Thalam we have provided. Thalam we have given with the Rasnadi Churna and Shirabala Tailam. That Thalam is similarly similar to the Shirolepam. This Shirolepam is advised to the Brahma region, that is Adhipati Marma in Ayurveda types, where it is a law. In Brahma region, it has a lots of nerve ending. While applying medication powder in the region, it can stimulate the nerve ending, which helps in reducing the aggravated Vata dosha. That Thalam, especially indicated in Bala Chikitsa, that is strengthening therapy and the Udo Jatrugatra Vigara, and to provide the strength and mitigate the Vata. And Kandupuran is advised with the Vachalashanadi Tailam, because patient has a purulent discharge. That's why we have advised this. And sometimes it can, as we all know, that bacterial otitis media may be the cause of the this facial palsy. It can also be reduce that Bell's palsy symptoms. And internal medication, as we have given Nayanadi Kashayam, Dhanvantram Gutam, and tablet Anuloma. And the Nayanadi Kashaya, that it is mentioned in Sahasra Yoga with the in Kashaya Kalpana. It is mentioned while describing the Aditam and Akshepak treatment. According to Shushuta, it is a Vatsama property and Vata Shaman property, as it is Ardit in Vata dosha is the main. In Ardit, the Vata dosha is the main culprit of the disease formation. In this medication, the Vacha, Shunti, Rasna, Shigru, Marich, Lashan, Mushka, this medicine contains same quality as a Kuberact, which has a Lagu Ushna Virya property, and these drugs are possess Vikasi property, which may help in stimulating the nerves and helps in reducing the pathology. Dhanvantram Gutam is indicated in Vata disorder. Patient, as we know, this patient has uncontrolled diabetes, as it is one of the cause of the Bell's palsy. The Dhanvantram Gutam has a radical scavenging activity in body, which reduces the oxidative stress and induces induced by the diabetes. Tablet Anuloma DS is a patent drug, but it has a Ayurvedic medication which has a Swarnakshiri, which acts as a stimulant laxative stimulant laxative property and helps in relieving the constipation. And drugs like Ajmuda, Shunti, Jiraka, Haritagi, Shantava, Laman possess the action of Dipan Pachan, which stimulates the Jatha Agni of the patient and which ultimately helps in relieving the constipation and improving the digestive iron. And conclusion of this slide is in Bell's palsy, in this case, Shira and Bala is mainly used because Abhyangam and Chiruduma. For Abhyangam, Chirudumam, Talam, Nasam, and it possesses the Bruhan property, which may provide strength to the facial muscle weakness, which is afflicted by the facial nerve paralysis, which may lead into partial muscular recovery in the Bell's palsy. Thank you for the listening and attention.
Thank you,
Hello.
Doctor. Thank you for the wonderful presentation.
Thank you, sir.
Next, I would like to invite Dr. Aradi VS for the paper presentation on the topic gastroesophageal reflux disease with respect to Amlapitta.
Good afternoon, all the faculties present. I am Dr. Aradi VS, first year PG scholar from Department of Ayurapta under the guidance of Dr. Shukka Eskarusha. Here, today I am going to present the disease, gastroesophageal reflux disease with respect to Amlapitta. So, what is gastroesophageal reflux disease? It is defined as a backflow of contents of stomach and thereby causing acid regurgitations. The pool global prevalence of acid of GERD was 13.98% with significant regional and national variations. In Ayurveda, it can be compared with Amlapitta. Amla Guno Triktam Pittam Amlapitta. Here, Pitta is mainly vitiated by Amla Guna Vritti. Prakrita Pitta is Kadu Rasatmakam and Vidakta Pitta is Amla Rasatmakam. When Amla Guna of Vidakta Pitta gets vitiated, the disease Amla Pitta occurs. So, when Nidana, then consumption, Nidana causes Agni Mandyatvam, and thereby when the food is consumed, it causes Shukti Bhava of Amashya, thereby leading to Amla Udkara and thereby resulting in Amla Pitta. Reasons for GERD. Unhealthy food habits and unhealthy lifestyles. Unhealthy food habits include fast foods, spicy foods, skipping meals, alcohol consumption, and carbonated drinks. Unhealthy lifestyle includes altered sleep, weight cycle, lying down after meals, obesity, and mental factors. Samprapti Kadaga of Amlapitta, Dosha. Pitta Pradana Tridoshaja, where Pachaka Pitta is vitiated more and Samana and Udana Vayu is disturbed along with Kledaka Kava. Dosha is Dhatu, Rasa Dhatu, Twachya, Ubadadu, and Shariramala is Purisha, and Dhatu Mala is Kapha and Pitta. Agni is Jadragni and Dhatu Agni. Agni Dushti is Tikshnagni and Dhatu Agni. Srodhas is Rasavaha and Annavaha. Srodha Dushti is Sanka Vimarga Gamana, and Adhishtana is Amashya. Viktasthana is Amashya, Khanda, and Hridaya. Swabhava is Chiragari and Ashagari. According to that, presentation and the strength of the patient and according to the kala of the disease. Rogamarga is Abhyantara and Roga Veda is Urdhvaga and Adhoka. Clinical features of GERD is heartburn, which is felt behind the sternum and extend over to neck, throat, and face. Pain and inflammation increases when the patient lies down. Anorexia, pyrosis, as we said, heartburn. Abdominal discomforts and regurgitation. Samanya Lakshana mentioned in Amla Pitta is Avibhaga, Klema Utklesha, Amla Utkare, Garehi, Hritkandadaha, and loss of appetite. Treatment plan is first line of treatment should be Shodhana, Purvam tu Vamanam Karyam Paschat Ritu Virejana. Vamana should be with first we should do Vamana with Tikta Pradhana drugs that can be a decoction of Nimba and Padola Kashaya along with Madanavala, Madhu and Saindava. If possible, at least if this is not possible, at least Satyavamana can be done with Yashti Madhu Kashaya in acute phase. The patient will be consuming around 500 ml only, but we have to prepare at least 1 liter. Then Mridu Virejana, followed by Vamana, that is Kari Pashat Mridu Virejana. It should be done with Haridagi, Draksha, or Yashti Madhu, or it can be done with Avipati Churna or Trivala Churna. If possible, Vasti can be also done, it will be a good choice. And Tikta, we have to keep in mind is Tikta Pradhana drugs will be always best for choice for Amla Pitta. And if only Shamana treatment possible, Ama Pachana is done for Pitta along with Vadani Lomana and Madura is Nikta. Therefore, it is not selected in first phase. In first phase of Shamana treatment, Guruchiyadi Kashayam twice daily, Padola Nimbadika or Padola Nimbadika Kashayam morning and at night, along with 2 tablets of Avipatti tablet and Arakwada Adi Kashaya with Triphala. Any one of these can be taken. And after treatment with these for 2 days, 2 weeks, we can go for Grita, like Indugandha Grita, which is Kabahara and Kadu Tikta Rasa Pradhana, or Mahatikta Grita, which is Pitta Shamana and Tikta Rasa Pradhana, and Dadimadi Grita, which is Vadani Lomana and Amla Rasa Pradhana. So we should select according to the condition of the presentation. We should select these. Grita also, and other Shamana medicines that can be given is Pravala Panchamrita along with Dhatri Loham, ghee or honey, then Shankavasra, that is the best choice. Amla Pittandaka Loha with Shadaval Kashayam. In second phase, Kashayam it will be Drakshadi Kashayam or Murvati Kashayam or Vidari Adi Kashayam, and Lehya can be taken as Shadavari Adi Leham, Dashamola Haridaki or Submar Lehim with milk. And single drugs, preferably it will be Uduchi, Shadavari or Kiradapita. Drava Pradhana medicines should be avoided because it causes the utklesion of dosha. And Drava Gunatmaga medicines, it can only be that can only be used for Vamana. So, which is Grahi Gunatmaga should be taken here, that causes Shoshana due to the Ushtatva. And the examples for that is Shankavasma, Shundi, Pravala, Panchapata, to reduce the Vidaktada of Pitta. We said earlier that is what that causing lead to the Amla Pitta mainly. So, Kamadukta, Pravala, Basma, Sudhishegara Rasa, etc. can be used. And yogas, along with that, this also should be done. Yogas, Halasana or Setu Bandhasana, Vajrasana, Trigonasana. Apatya, avoid coffee, tea, fried foods, fast foods, chocolates, or very spicy foods and painkillers. While sleeping, we should always keep in mind to sleep on left side, because when we sleep on left side, the stomach and its gastric juices remain lower than the esophagus, reducing heartburn and digestive upsets. Reference. Thank you.
Thank you, Dr. Adhi. Thank you for the impressive presentation. Next is also a paper presentation. I would like to invite Dr. Archa Sharma for the paper presentation on the topic Janapatodhamsa with respect to water pollution.
Good evening, everyone. Myself, Dr. Archa Sharma, first year PG scholar from the Department of Agatantra from College Kayashi BMK Ayurvedic Mahavidyalaya, Belgavi, Karnataka. Hereby presenting my paper presentation on the topic Janpada Utvans with special reference to water pollution under the guidance of Dr. Mahadev Pulkle, Associate Professor of Department of Agatantra. These are the contents of my further slide. Introduction. Jeevanam Tarpanam Nrityam Hladam Buddhi Prabodhanam. It is influenced by a complex mixture of chemicals, solid waste, pathogens, insects, and other disease vectors. Eutrophication is also a major cause of water pollution. According to a study conducted by WHO in 2017, 159 million people depend on water from surface sources and 423 million people take water from the unprotected springs and wells. According to another study, water-related diseases account for 4.1% estimated cases of global disease burden. Causes of water pollution. Agricultural water pollution is caused by the agricultural stress due to escalated need to satisfy the rising population. Eutrophication, that is the algae bloom, which is due to the increased nutrients and oxygen depletion. Domestic water pollution, which is caused by septic tank discharge generated by a household, and many residents today spill their waste along with the plastics in the water bodies. Industrial water pollution. Manufacturing industries like fertilizers, oil refining, mines, and heavy metals excrete their waste in the water bodies. Categories of the water pollutants. Sediments. These include the organic and inorganic waste and turn the water bodies sluggish, thereby resulting in depletion of the water bodies. Nutrients. Through growing crops, the nitrogen leakage happens when the fertilizers are added into higher than those set by the solid particles. Chemical pollutants. The heavy metals hamper the aquatic ecosystem. Pesticides, fungicides, herbicides, etc. pollute the water with carcinogens. Biological pollutants. Virus like polio, hepatitis A, rotavirus, bacteria like E. coli, typhoid, cholera, protozoa like Giardia, and helminthes like Guinea worms create water pollution. Oil spillage. Oil spills into water bodies by disaster, leaks, or from the oil tanks. Offshore drilling also contribute in water pollution. Acid rain. When the acid particles caused by the air pollution get mixed up with the rain or water vapor, it affects the pH, causing water bodies to get polluted. Dushit Jala. In Charak Samhita Viman Sthan, Janpadya Utvansmi Adhyay is there, in which the properties of Dushit Jala is mentioned, which is said like Vikrit Gandha, Van Ras Parsh Klet Bahulam, Jalchar Vihangam, Upnishad Jaleshyam. That means that if the water is having a different smell, color, taste, or touch, then it is said to be Dushit Jala. He also mentions that Adharma is the mool karna for all these occurrences. In Sushruta Samhita Kalpasthan, Jangam Vishwagyani Adhyaya, Visharth Jala is mentioned as Pichila, Ugragandhi, Phenim, Rajibi, Mrityu of Manduk and Matsya, Brahma, and the animals consuming this will have Chaddi, Moh, Da, and Shok. In Sushruta Samhita Sutrasthan, 45th chapter, Jala Shodhan is mentioned, which can be done by Agni Kwatam, Surya Taprathanam, Nirvapana with Pind Ayasa, Rostra, and Sikta. The vessel for the potable water, which is made aromatic by adding flowers, and the vessel should be made with the material like gold, silver, copper, bronze, gemstone, or earthen material. Acharya Sushruta mentions about 7 purifiers for the water purification, that is Kattak, Gomed, Visraganti, Sheval Mula, Vastra, Mukta, and Mani. In Sushruta Samhita Kalpasthan, 3rd chapter, many more drugs are given for the Shodhana of water. These are Dhava, Ashwakarna, Paribhadra, Patla, Siddhak, Aragvat, Somvalkar. These are burnt, and when cooled, the ashes are taken and used for purification. For drinking water, 1 anjali of bhasma is infused with 1 drone of water in a pot. In Ashtang Hriday, water is filtered through Khanavastra to remove the Shutra Jantus. They also told 3 methods for water purification, that is boiled in fire, kept in sunlight, or hot iron balls are immersed. Parinam Mula, Visraganti, Mukta, Kattak seeds, and Gomeda can be used for the purification of water. For the bad smell, Patla, Karveer, and other Sugandhik Dravya are used. In Ashtang Sangrah, detoxification of water is mentioned, and the drug used are Patla, Paribhadra, Ashwakarna, Samyak, and Chitrak. There is a study conducted in our college by the Department of Agatantra only, in which Jal Nirvashikaran Yoga was made with few of the drugs that are Ajashringi, Indravaruni, Uttamarini, Guduchi, Panjaka, and Ativisha. The Prakshep Dravya used were Haridra, Daru Haridra, Brihat Ela, Manjishta, Bakuchi, Rasna, and Ushi. And with this addition of different herbs were also taken separately in different vessels. These were Kathak seeds, Tulsi leaves, and Neem leaves. The total dissolved solutes of the fresh water collected was at 482 parts per million. The TDS values of the water samples kept for 24 hours in different vessels, that is for silver is 372, for copper 429, for plastic 436, for steel 445, and for clay 628 parts per million respectively. With this study, they concluded that the silver vessel and the herb nimber shows its action best among the storage vessels. Bhagavatot oak Sharpak Vidhi was done. Microbial test cultures were inoculated into the soybean case in digest agar plates. These plates were incubated at 37 degrees Celsius for 24 hours and observed for the zone of inhibition. All the concentration of the Jal Nirvishikaran Yoga was found effective in inhibiting the growth organism, the ability to limit the growth of coliforms, Salmonella abenis, Staphylococcus aureus, and Candida albicans. Two more studies were done on this topic. First was done by Dr. Zilika, effect of Ayurveda water purification method on total dissolved solutes in water. The aim was to evaluate and compare the total dissolved solutes of water kept for 24 hours in different vessels infused with different herbs. Second was done by KP Sandanam, suggested a study on water purification explained in Ayurveda using Utpala, Naga, Chambaka, and Patla. Discussion. The drinking water at least must be purified in the house itself by boiling, filtration, herbal infusion, storing in copper or silver vessels, and sunlight exposure. Conclusion. In conclusion, water pollution poses a significant threat to ecosystem, human health, and biodiversity. Urgent action is required to address the sources of contamination, implement effective regulations, promote sustainable practices to safeguard our water resource for current and future generations. Effective method, as mentioned before, should be implemented as it is effective and feasible and easily done. These are the references for my study. Thank you.
Thank you, Dr. Archa Sharma. Thank you for the incredible presentation. Next is a paper and poster presentation. First, we go to the paper presentation on the topic Gokshira. I would like to invite Dr. Komal Papatrao Sanavane for the paper presentation. Dr. Komal Sanavane, are you there?
Yes, sir, I'm here.
Good evening, doctor. Your
If my
screen is
slide is
visible,
visible.
doctor. Visible, doctor. Please start the session.
Myself, Dr. Komal Sononi from PG Scholar from Kaichikitsa Department under guidance of the Dr. D.G. Dipankar at the Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Gokshura, it is a Latin name, is Tribulus lean. Family is a Zygophyllaceae family. It is a classical description and from the various Savitas. Vernacular names are the Gokuru. In English, it is cowhage. Telugu, it is the Paleru. Tamil is a Niringil. Kannada, there it is the Negalu. Malayalam, there it is the Nirinil. And Sanskrita, it is a Gokshura. Synonyms of the Gokshura, there is Gokantaka, Kantafala, Bhakshara, Swadhukantaka, Shwadanstraka, Valadanstra, Gokshura, Kshura, Shadanga, Stala Shrungata, Trikantak or Trikat. Classical categorization of the Gokshura from the Charak Sahita, it is the Shotahara, Mutra Virechaniya, Kramigna, Sushruta, there it is the Vidari Gandhi, Vatavyadhi, Lagu, that is the Vidari Gandhi. Charak identified it is the best drug for the Mutra Virechaniya and the Vata Rogas. It is one of the herbs which is a Mutrala as well as a Shotahara. The root is used in a Dashmula while the fruit is a Rusha. Both roots and fruits are to be used along with the whole plant in a Ashmari. Controversial studies there, it is the Trikantaka should possess 3 spines and spurs. Botanical description as a T terrestris, a small prostrate hair suit, a silky hair hubs, leaves, a stipulate opposite, usually unequal, abruptly pinnate, and a leaflets 4 to 7 pairs oblong, and a mucronate flowers. There is a soil, terry, axillary or the leaf oppose, yellow or white. Fruits there it is the globus, hairy, 5 angle spinous with the 2 long and 2 short spines on each cocky. Sits second, it is the major chemical constituents. There is a fruits, there it is a chlorogenin, a dioxygenin, and a getogenin routine of a chromosome. Roots there it is the campistrol. Aerial parts there it is the astragalin and a dicosin, etc. Properties there is a rasa, madhur rasa, shita virya, guru and snigdha guna, madhur vipaka, and its karma there it is a vata pitta hara, risha, mutrala, it's a rasayan. Indications, mutra virechiniya, there it is the prameha, rudrok, arsha, Shwasa, Kasa, Klebya, and is a therapeutic uses. There it is a Vajikarana. Powder of a gokshur fruit is boiled with the milk and we can consume. Amvat, that is we make some decoction of the shunti and gokshur root will be definite use. And there it is the kesavardhana, that is a gokshur and the flowers of the taila are applied externally by making them into the paste using honey. Doses for the decoction, it is the 50 to 100 ml powdered and 3 to 6 gram. It's important. Preparations, various preparations and the formulations of the gokshura. There it is the gokshuradi gugul. Um, गोक्षुरक रसायन गोक्षुरादि चूर्ण गोक्षुरादि अवलेह गोक्षुरादि क्वाथ and dashmularishta. Various research works we can already done on the gokshura. These are the following researches works are done. Thank you.
Thank you, doctor. Next is a poster presentation. Doctor, I will share for you, doctor. Doctor, I will share for you, doctor. Please start the session, doctor. Doctor, please unmute, doctor. We can't hear your voice.
Okay. Hey, can you hear me?
Yes, doctor.
Yes.
Please start the
Bell's
session.
palsy. Okay. Bell's. My poster presentation on a Bell's palsy, Ardhita. What means Bell's palsy? It is an unexplained episode of a facial muscle weakness on paralysis. This condition results more specifically on a seventh damage of the seventh cranial nerve. Pain and discomfort usually occur on the one side of the face and the head. Specifically, symptoms of the Bell's palsy are dropping of one side of the face, difficulty in smiling and frowning, loss of feeling in the face, loss of sense of the taste on the front of the two-third of the tongue, inability to close the eyes on the affected side of the face. Causes for the Bell's palsy are the myasthenia gravis, Guillain-Barré syndrome, injury, sarcoidosis, high blood pressures, and the diabetes. Complications are the eye may close when you smile, excessive dryness into the eye, which can lead to the eye infections, ulcers, or even blindness, damage to the seventh cranial nerve. And Ayurvedic treatment for the Bell's palsy are the Nasya. With the help of the Shadabindu Tail and the Anu Tail, we can do a Nasya, Nadi Swedhan. Upanaha, there it is the Erindapatra Upanaha, Murdha Tail application oil on the head, and with the help of a Murdha Tail, we can also apply as the Pichu of Murdha Tail on your head. We can also do a Sirobasti, Shirodhara, and a Kshirabara Taila Upnaha, and Akshitarpan with the Kshira Salpi Taila and the Vidya Karma. These are the specific treatment from Ayurvedic treatment for the Bell's palsy, Ardita. Thank you.
Thank you, Dr. Komal Sanwani, for the wonderful paper and poster presentation.
Thank you, sir.
Next, I would like to invite Dr. Rashmi Joshi for the poster presentation. Dr. Rashmi, are you there? No, Dr. Rashmi, can you hear me? Dr. Rashmi, we can't hear your voice, doctor. Hello, Dr. Rashmi. Doctor, please reconnect your headset, doctor. We can't hear your voice. Hello, Dr. Rashmi. No, doctor, we can't hear your voice, doctor. Please reconnect your headset, doctor. It's a system problem, doctor. Dr. Rashmi, can you hear me? Dr. Rashmi, can you hear me? Okay, next we go to the next presentation. I would like to invite Dr. Neha Saini for the paper presentation on the topic Murtani Dailam. Dr. Neha, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Sir, is my screen visible?
Yes, doctor, visible. Please start the session, doctor.
Good evening, everyone. So the topic of my paper presentation is Murdani Talam. Myself, Dr. Neha Sania, PG scholar from Dr. D.Y. Patil Ayurvedic College and Research Center, Pune. I am presenting this paper under the guidance of Dr. D.G. Dipankar sir. So, as we all know, head has a special importance among the body part as it is considered as Uttama. So, the oilation of the head, it is known as Murdani Tel or Murdani Chikitsa. There are 4 procedures which comes under Murdani Chikitsa. One is Shiro Abhyang, another one is Shiro Sek, that is Shiro Dhara. Third one is Shiro Pichu, and fourth one is Shiro Basti. So in this presentation, we are basically going to talk about Shiro Basti, Shiro Dhara or Shiro Sek. So by the end of this presentation, you all must have known that what is the reason, scientific reason behind using different materials, that is grit, medicated milk or decoction for Shiro Dhara, and what is the rational thought behind the mode of administration of the drugs we use in Shirodhara, or for which purpose we basically use Shirodhara. So Shirodhara, where a dhara of a suitable tail on a forehead is in a synchronized and rhythmic manner is used, which is known as Shiro Sek or Shirodhara. The duration which we use it for is approximately 45 minutes to 1 hour, and it is indicated for hair related problems, for example, early graying of hairs, dullness, thinning, and other diseases in which we can use it is it includes urinary tract disorder, joint disorder, heart diseases, and psoriasis, hypotension, loss of memory, neurological disorder, and some psychosomatic disorders like IBS. So there are three types of Shirodhara, which basically is divided on the basis of the dravya we use for the purpose of Shirodhara. First is Sneha Dhara. It uses, we use tel or ghee, which is infused with the herbal medicines. And Kshiradhara, where a milk is infused with the specific herbs, we use Kshiradhara. Milk for that purpose. And the third one is buttermilk when infused with specific drugs, that is known as Takradhara. So the probable mode of action or the hypothesis, there are some hypotheses which is mentioned in some articles on which Shirodhara basically acts, how Shirodhara basically acts. All we all know that what is law of conservation of energy, that one energy is converted into another energy. There is no loss of energy in between. So basically here, potential energy is converted into kinetic energy. So when a substance is situated at a certain height, so it possesses potential energy, and when that substance is released, that energy is converted into kinetic energy. So basically here potential energy is converted into kinetic energy. So potential energy depends upon two things. First is mass of the substance, and second one is the height of the substance. At a certain height, when a substance is placed at a certain height, that means the potential energy of the substance we use for the purpose of Shirodhara is constant. So the difference where it comes is on the mass of the substance. So energy is directly proportional to mass, and that mass is which defines the energy. Okay, for example, the air tail we use, it has different mass, or and the mass, and Kshir has different mass, and the Takra has different mass. So when when a substance, there is one more hypothesis which says that when a mass of a substance or moving substance collides with a resting substance, it generates some acceleration, that is the momentum. So the when mass is increased, it generates energy which also increase, and so on the momentum, and there is change in the voltage. Okay, voltage, and that further stimulates the nerve conduction. So this is the hypothesis which basically in what we see in the Shirodhara. So the pressure and temperature also plays an important role in Shirodhara. So constant pressure and vibration, which is amplified by a hollow sinus present in the frontal bone. So the vibration, it transmits to the fluid which is present in the brain, that is CSF. This the temperature, it also activates the thalamus and the basal forebrain. So these two things helps in the normalizing the amount of serotonin and catecholamines in the brain, so which further helps in the relaxation of the body, and if we can use it in the treatment of many psychosomatic diseases. So this pressure helps in the tranquility of mind and reduces the stress by modulating the nerve stimulation. By this nerve stimulation, the nerve endings of the ANS system, autonomic nervous system, is also stimulated. So acetylcholine will release, and it activates the further, it does its work. As we all know that if there is less amount of acetylcholine in the body, it results in the fall in the blood pressure, that further results in decreasing its of activity of CNS system, which resulting in tranquility of mind. And larger the amount of acetylcholine, it activates the central nervous system and increases the activity of body and mind. So this is by this we can understand that how Shirodhara act as an anti-stress effect, has an anti-stress effect. So Shirodhara normalizes two neurotransmitter. One is serotonin and the second one is norepinephrine. Serotonin has its effect on the lower amount of serotonin has results into stress and several other factors like depression, loss of appetite, and etc. So Shirodhara Shirodhara it is seen that Shirodhara increases the level of serotonin in the body. Now we will study the effects of the Shirodhara, that is tranquilizing effect. The same way, the modern science says that how ointment is absorbed and it comes to the blood vessels and shows its desirable effect on the target organ. The same way, the dravyas we use in the Shirodhara also shows its effect on the brain cortex and brain. Next one is autonomic nervous system. As we all seen that it affects the nerve ending, and that further results into the release of acetylcholine receptors, or it may block the alpha adrenergic receptors, which results in the blockage of the adrenaline and noradrenaline neurotransmitters. So the third one is effect on the endocrine system. The effect of Shirodhara or the hormone secretion can also be postulated considering its effect on the hypothalamus. Mainly, hypothalamus is the main controller of the endocrine system. So Shirodhara affects the hypothalamus, which further if it further result in the release of dopamine, noradrenaline, serotonin in the body. So it results in the responsive to stress and emotional disturbances. And just like that, also Shirodhara targets the limbic system with the hypothalamus regulation. Its effect is also seen on emotions and behavioral patterns. We can use it in ADHD patients also. This is a flow chart which summarize whatever we have studied in the paper. So we can conclude that Shirodhara works on the law of energy conservation, and it modulates the secretion of various neurotransmitters and hormones by adjusting the intensity of electromagnetic waves of the brain. Thank you.
Thank you, Dr. Neha, for the exquisite presentation.
Thank you, sir.
Next is a paper presentation. I'd like to invite Dr. Sheda Parve for the paper presentation. Dr. Sheda, are you there?
Yes, sir. Good evening, sir.
Good evening, doctor. Can you please share the screen, Dr. Sheda?
Yes, sir. Yes, sir. Just wait for 1 minute, sir, please.
Okay, doctor.
Good evening, sir.
Good evening,
Today I
doctor.
am going to present the management of bronchial asthma, that is stomach shwas, through Panchakarma procedure with Ishwaku Vaman, a case report. Next. The term Tamaka and Shwasa are combined to form the phrase. Tamaka is the term of sadness. It represents physiological and pathological respiration and is used to express the word. The disease is called Tamaka as an attack of the disease precipitates during the night, and the state of attack dyspnea becomes too severe that the patient feels like entering into the darkness. The primary contributing factors to the tamak shwasa are that causes vitiation of vata, which in turn causes vitiation of kapha, which in turn causes vitiation of rasa, which inhibits prana vata function. Vamana karma is specially indicated in kapha disorders. One such disease involving kapha is tamak shwasa. The act of respiration is the physiological function of pranavayu. When kapha obstructs this pranavayu, it gets pratilom gati. It moves upwards, impairing respiration, resulting in tamak shwasa. Minimal of it is known about the Ayurvedic treatment of tamak shwasa or bronchial asthma. In the modern world, especially in Vamana, Therefore, an effort was made to determine whether Shodhan Karma effectively treated patients with tamak shvasa. This is the patient information, age 21 years. He was a 21 years male patient from Wardha, and date of admission was 2nd December 22 and discharge date 12 December. This slide shows clinical presentation of the patient with chief complaints. Chief complaints was accumulation of sputum in the chest, frequent sneezing, cold and cough from 4 to 5 months, and associated complaints was breathlessness while walking and talking, and foul smell in the nose of food and other eatables from 4 months. Progression of disease. A 21-year-old male child who belongs to a lower middle class family, he complains of the Shvasakashtata significantly increases in the evening time and has frequent episodes of allergy due to dust. Patient took homeopathic treatment in 25 to 16 and complaint got allergy relief only. Then again, due to cold weather in the morning, there was frequent sneezing with shortness of breath and productive cough. With breathlessness symptoms with the history of being diagnosed as a child pneumonia in childhood and treatment at an allopathic hospital and relieved. Still, after some years, the patient has complaints mentioned in the table. No two patients took allopathic medicines for 1 month, tablet azithromycin 500 mg, cetirizine 500 mg, cough expectorant. Then after a few days, the patient suffered from a mild asthmatic attack with severe breathlessness in the morning time. Then he took some Ayurvedic medicines from a local Ayurvedic practitioner. After 1 month, he suffered a recurrence of the above symptoms. Therefore, he approached the outpatient department of Panchakarma, that is MGSC, RC, Wardha, Maharashtra for further treatment. This is the history of patient. There is no significant family history was found. History of pneumonia 3 to 4 times in childhood. In personal history, Ahar was vegetarian. Vihar was Jagran and Atishram. In Nidra, interrupted sleep at night due to aggravation of the symptoms. Vesana nil and Vam no Vam. Clinical findings that this slide.
Hello, Dr. Sheda, can you hear me? Hello, Dr. Sheda, can you hear me? We can't hear your voice, doctor. Okay, next I would like to invite Dr. Bhuvaneshwari G. Patil for the paper presentation on the topic stress management through yoga. Dr. Bhuvaneshwari, are you there? Dr. Bhuvaneshwari, are you there? Dr. Sheda, can you hear me, doctor?
Sorry, sir. Actually, it was disconnected. Sir.
It has some network problem, doctor.
Can I present from yes, yes. Yes, sir. Sir, can I present from
Sure, doctor. You can continue, doctor. You continue the presentation, doctor.
okay, sir. Okay, thank you.
Your screen is not visible, doctor.
Yes, sir. Yes, sir.
Is it
Sir,
visible?
please, 1 minute, sir.
Now the screen is visible, doctor.
Yes, sir. Sure. Samprapti Ghataka, that is pathophysiology, Ayurvedic pathophysiology. We found the pathophysiology in the condition, patient's condition. Dosha was a vata, kapha, and pitta. Dusha was a rasadhatu. Srotas was pranvaha, udakvaha, and annavaha. Agni, Jatharagni Mandya, and Rasagni Mandya. Srotadushti was Sanga in a pranam vaha due to kapha vimarga gamana of a prana sanga in amavaha due to ama and ati pravrutti in udakvaha. Udbhav sthana was Amashay, Rogamarga was Abhyantar, Vyadhi Sambhav was Chirkari, and Sadhya Asadhya Naveen was a Sadhya and Purana was Apta. Examination, the patient had a barrel chest, was nourished, was thin and did not show signs of icterus, cyanosis, clubbing, lymphadenopathy or edema. The patient was febrile oriented with alization, that is accessory muscles for respiration. The respiratory system exhibits equal bilateral chest movement and air entry as well as bilateral wheezing accompanied by retraction and an increase in respiratory rate, and it was 28 breaths per minute. Cardiovascular devices display tachycardia without any additional sounds being heard. The patient was awake, attentive, cooperative, and restless. There was no organomegaly, and the abdomen was soft and untendered. And PFT, that is pulmonary function test, indicates bronchial asthma. Routine investigations were done with ECG as the protocol of Vamana, which was within the standard limit. Specific investigations advised, that is PFT, we shown in figure 1 and figure 2. Diagnosis, Tamak Shwasa, therapeutic intervention, the treatment, Panchakarma purification of Shaman Chikitsa and Shodhan Chikitsa are given in table number 4 and 5 respectively. This is the line of treatment, that is Panchakarma. In 2nd, 3rd, and 4th December, we advise Dipana Pachana with Chitrakadi Vati and Sudh Shekhar Ras. This is the dose. and the duration was 3 days. Then 5th, 6th, and 7th December, we advised Nehapana, that is with the Kantakari Ghruta, started with 50 ml and increased by 50 ml daily for 3 days. On 8th December, we advised Abhyanga with Dashamula Tela in morning time for 2 days on the and before Vamana and on the day of Vamana. 9th December, Vamana was advised with Akanta Pan with Godugdha, and Yog was Ishwaku Churna 3.5 gram with Saindhava 1.75 gram, and Madhu was 50 ml, and Estimadhu Fanta and Saindhavjal was for Akanta Pana. And then Sansarjan Kram advice for 5 days. This is Shaman Chikitsa. After Vamana, we advise Shamana Chikitsa for the patient. Arogyavardhini 125 mg, 2 tablets BD after food with lukewarm water for 14 days. Then Kankasa 15 ml BD after food with lukewarm water for 14 days, and tablet Septilin 1 tablet BD after food with lukewarm water for 14 days. This is the this slide shows the therapeutic outcome. We use MRC dyspnea scale of was used for assessment, and this is the gradation. With Shwasa Kashtata we found 4 after, before treatment, and after treatment it was a 1. And then Kasa, that is cough duration and severity, was found throughout day. After treatment was found no cough. Ronchi, we found generalized ronchi, that is inspiration and during inspiration expiration before treatment, and after treatment was nil, that is no ronchi. Objective parameters, we use PFT, that is pulmonary function test, and this slide shows the sub-parameters of the pulmonary function test, that is the force vital capacity, force expiratory volume, volume for 1 second, force expiratory volume for 1 second, force vital capacity, peak expiratory flow rate, and peak expiratory flow rate, peak inspiratory flow rate. This slide shows the report before treatment and after treatment of the patients. Discussion: Tamakshwasa and bronchial asthma are associated in current times. The subject in this case had a condition related to severe asthma. Vamana, because of their virya, that is potency, dravya circulates fast in both the body's large and small capillaries, giving them the qualities of Vivai and Vikasi. In it permeates every part of the body due to Ushna Guna, dosha begun to melt in the body. Seen the patients sweat on their forehead or occasionally their entire body. Severe classical literary works, recurrent Vaman karma roles in Tamaka. The preferred method of treatment or process in Vegakalin Avastha is Vamana karma or Sadhya Vamana. Vegavastha doshas are at an aroused stage, which is prepared state to remove from the body or eliminate. Therefore, Abhyanga and Svedana, followed by Vaman Karma, clearing the Sangha, that is airway barrier, will be beneficial for the vilayan of this Grathita Kapha. The Kapha is ejected from the airways, then it returns to Amasha, where Vamana expel it. This slide shows role of Vamana in Tamakshwasa. Tamakshwasa are associated, sorry sir, these slides repeated sir. Then role of Vamana Dravya and Shamana Chikitsa. We use Ishwaku. It is indicated for Tamaka Shwasa. Routinely we use Madan Falasa. So it's a specific case with Ishwaku Vamana. Ishwaku is a Tikta Katu Rasatmak Dravya and have Shitavirya. It has Lagu Ruksha and Tikshna property and has Pittagna and Kafagna Prabhava, Samshodhan Bhedak and Kapha qualities of vitiated and sluggish. Ishwaku may cause kapha to be evaluated from the system, clearing the pathways of circulation and allowing vayu to travel freely. After the vitiated kapha is removed, the sufferer ultimately finds relief. Therefore, the Ishwaku appears more advantageous in Tamakshwasa. We use Chitrakadi Vati and Sud Shekhar for Dipan Pachan. Chitrakadi Vati, the main ingredients of Chitrakadi Vati are Chitraka, Yavakshara and Lavana, and remaining drugs
have Dipan Pachaniya property, so they are used before Vamana as Dipan Pachan. Sudshekar impaired digestion, so used for Dipana Pachana. And for Shaman Chikitsa, we use Septilin tablet Arogyavardhini and syrup Kankaso. The management of acute and recurring upper respiratory tract infections is said to benefit from the antibacterial and anti-inflammatory characteristics of tablet Septilin. It has reportedly been shown to reduce gram-negative and gram-positive bacterial growth and aid in the mucosa development to tolerance to certain situations. Tablet Arogyavardhini used as Sarvaroga Prashamani and syrup Kankaso acts as a bronchodilator and immunoregulator that's we use. Conclusion, based on the fundamentals of Ayurveda, this case study demonstrated that Tamakshwasa could be successfully handled with Shodhana and Shaman Chikitsa. Now this treatment plan is what cause is unintended adverse effect. Further clinical trials should be planned in a broad population using the same protocol. This slide shows the references. Thank you so much.
Thank you, Dr. Shweta. Thank you for providing such an well-explained presentation. Thank you so much.
Thank you, sir.
Next is a poster presentation. I would like to invite Dr. Rashmi Joshi for the poster presentation related to health. Dr. Rashmi, are you there?
Yes, sir. Can you hear me?
Good evening,
Am I
doctor.
audible?
Yes, doctor, you're audible.
Yes, sir. I asked sir to present the poster I sent him recently, ma'am, just now.
Start the session, doctor.
Could you please do that? Yes, sir. Yes, sir. This is my poster on 5 steps to maintain health. This is a very basic poster and a different one from the usual concepts that we talk to layman, like Trayopastamba and Ahara and other things. We keep talking to layman in those terms, but I felt these 5 steps can be very approaching to modern day times and relating. So I put these 5 in my poster that are Nidra. We see actually many people going to the night shift and having other shift duties in IT sector especially. They have a haywire sleep cycle. So how can we advise the sleep cycle like a normal person to those set of people? We can make modified changes in them as per the modern day cycle and as per the modern day needs. So we have to tell them as per their needs. And exercise also, the modern day needs are different from what is explained in Grantha. We can stick to Siddhanta like, hello?
You're audible, doctor.
Hello?
Please continue.
Yes, yes. We can stick to Siddhantas that Ardha Shaktya Nishevastu, but we have to modify it according to the present day requirement. So we can make them aware of the small procedures in gyms like crunches, trenches, etc. We have to know them first as Vaidyas, what are they, and make smaller changes in their routine in the gym itself. Otherwise, in the modern day requirement, it is difficult to tell them not to do this, not to do that. They will keep doing, but as a doctor, as a Vaidya, we can tell modifications as per Ayurveda, sticking on to the Siddhantas and not letting them go. Next is avoid Vishadravya, like not just tobacco, alcohol, and other smoking habits like that, but also nowadays there are many toxic habits like binge eating and binge watching also. So these also come under Vishadravyas, which indirectly pose a threat to human beings in the form of Dushi Visha, Varavisha, etc. in the long run. And balanced and Shadrasatmak diet is actually become a lost concept nowadays in layman because Tikta Rasatmak Dravya and Kashaya Rasatmak Dravya are not included in day-to-day culture. So we have to try inculcating that in terms of many modified recipes also, like modified coffees and herbal teas or something, some modifications in their daily routine. Lastly, regular checkups. This we have to include whenever we are taking a case also, in the OPD basis and IPD basis. Regular checkups have to be monitored. Somewhere in the mistakes in monitoring can also lead to bigger damages. So we have to check, we have to keep awareness among the people that monitoring yourself is a good habit. So these are 5 steps that modern day requirements are there, and we have to pose these 5 steps in the language that modern day man can understand according to his lifestyle needs. So without letting the Siddhantas go away, but approaching the contemporary set of people, we have to take these into consideration. Thank you.
Thank you, Dr. Rashmi Joshi. Thank you for the presentation. Next, we go to the paper presentation. I would like to invite Dr. Ruxana PK for the paper presentation on the topic Shidapita with respect to urticaria.
Myself, Dr. Ruxana PK, first year PG scholar from Department of Radhandra. Here I am going to present my PPT on the topic Shidapita with a special reference to urticaria. Urticaria. Urtica means nettle, urare means to burn. Commonly referred to as hives, is a kind of skin rash notable for a pale red raised itchy bumps. Incidence. Urticaria is a common problem and is estimated that up to 20% of the population or 1 in 5 people would have had hives at one point in their lives. It is a muscular reaction of the skin characterized by wheals surrounded by reddish color. A transient condition of the skin usually caused by allergic reaction. Characterized by pale or reddened irregular elevated patches and severe itching. Hives can be caused by an allergic reaction, but some hives can appear without any known reason. Urticaria, also known as hives, wheals, welts, nettle rash, is the raised itchy rash that appear on the skin. It may appear on one part of the body or be spread across large areas. Wheals means a central swelling surrounded by erythema with itching, burning sensation. It usually disappears 1 to 24 hours. Hives or urticaria, a skin rash triggered by a reaction to food, medicine, or other irritants. Welts, chronic hives are welts that last for more than 6 weeks and return often over months or years. Pathophysiology of urticaria, immunogenic or non-immunogenic or physical or chemical stimuli that cause release of histamine from mast cells. Then histamine causes localized vasodilation, which allows vascular fluid to leak between the cells through the vessel wall, and contributing tissue edema and wheal formation that lead to urticaria. The causes of urticaria: viral infection or illness, emotional stress, insect bite, animal dander, pollen, drug reaction, food allergies, and an autoimmune disorder, pressure or tight clothes, sweating, extreme cold or heat, water. Features: cardinal symptoms in pruritus. Cardinal symptom is pruritus, Urticaria is caused by swelling of upper layer of dermis, redness, swelling under the skin with clear edges, means angioedema, hives that grow or spread into larger areas, disappearing and reappearing swelling, skin writing or dermatographism. The classification, there are mainly two types, acute urticaria and chronic urticaria. The duration criteria of acute urticaria is less than 6 weeks and chronic urticaria greater than 6 weeks. Causes of acute urticaria, immunological reaction to medication, food, contact allergens, and insect venom, viral infection, or idiopathic. For chronic urticaria, the causes, physical factors, cold, pressure, dermatographic, heat, solar. The chronic spontaneous urticaria, spontaneous appearance of wheals or angioedema, or both greater than 6 weeks due to known or unknown causes. Chronic inducible urticaria, physical urticaria, symptomatic dermographism, cold urticaria, delayed pressure urticaria, solar or heat urticaria, cholinergic urticaria, contact urticaria, aquagenic urticaria. The physical urticaria are disorders in which urticaria are induced by environmental stimuli such as heat, cold, pressure applied to skin, exercise, water, vibration, sunlight. Angioedema. Angioedema is the swelling of deep dermis, subcutaneous, submucosal tissues, vascular leakage. Cause is same as that of urticaria, but the pathology in the deep dermis and subcutaneous tissue and swelling is the major manifestation. Angioedema commonly affect the face portion of an extremity, involvement of lips, cheeks, periorbital areas in the common, but angioedema also may affect the tongue, pharynx, larynx, and bowel. May be painful or burning but not pruritic. May last several days. These are the features of angioedema. Contact urticaria is a transient wheal and flare reaction that occur within 10 to 60 minutes at the site of contact of the offending agent and completely resolve within 24 hours. It is a form of acute urticaria as a symptom lasts for less than 6 weeks. Contact urticaria and contact dermatitis, some differences are there. Dermatographism, also known as dermographism urticaria, is the urticarial eruption upon pressure or trauma to the skin. Literal meaning is to write on the skin. Shida-pitta. When coming to the Ayurvedic perspective, the urticaria is similar as Shida-pitta. In our science condition called Shida-pitta bears similar symptoms of urticaria. There is no specific or satisfactory treatment in contemporary science for the condition of urticaria, but it can be effectively managed through our system of medicine. Shida-pitta comprises of two words, Shida and Pitta. Shida means cold, Pitta means warmth. Hence, it is condition caused due to dominance of cold and Pitta dosha. Hedu, Adilavana Kadu Sevana, Aranala, Sukta Sevana, Sarshapa Sevana, Shida Maril Samsparsha, Shida Pani Samsparsha, Diva Sapna, etc. The Samrapti of Shida Pitta is Shida Marada Samsparsha Pradushto Kafa Marado, Pittena Saha Samboya, Bahirandar Visarpadaha. Madhavanidana Shida Pitta chapter. Purvarupa of Shida Pitta is Pipasa, Aruchi, Hillasa, Dehasada, Anka Gaurava, Rekta Lojanata. Rupa Varadi Damstravada Shoda, bite of nettle sting, Kandu, Toda, Chardi, Hillasa, Jora, Vidaha. Line of treatment. Samshodhana and Shamana Aushadha are given. Nidana Parivarjana. According to dosha dominance, Vamana, Virejana, and Rektamokshana are carried with suitable medicaments. Taila application. Sarshapa Taila can be applied over the body. Yavakshara and Saindava Lavana mixed with the Sarshapa Taila is applied. Taila prepared with Eladikana Dravyas are also applied. The Ayurvedic formulations like Amradadi Kashayam, Amrada Rajanyadi Kashayam, Trifala, Churna, Haridra, Ganda, Arthraga is very effective in Shida-pitta. A single drug like Udoji, Nimba, Haridra, Ajamoda also used. Thank you.
Thank you, Dr. Ruxana. Thank you for the wonderful presentation. Next, we go to the paper and poster presentation. I would like to invite Dr. Madhavi Darne for the paper presentation. Dr. Madhavi, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Sir, am I audible?
Yes, Dr. Audible. Please start the session,
Uh,
doctor.
Good evening, sir. Myself, Madhvi Dharme, from Department of Kai Chikitsa, Dr. D.Y. Patil Medical College. So the topic of my presentation is Ayurvedic Management of Shit Pitta with special reference to urticaria, a case report. Moving towards introduction, Shit Pitta is a disease caused when a human being is exposed to cold breeze. Due to this, there will be a variation of kapha and vata. These two combine with pitta and circulate all over the body, producing the signs and symptoms over the skin. Causative factors are mainly excess intake of salty, pungent food, mustard, consumption of large amount of sour gruels, exposure to cold wind, cold substances, day sleep, and also improper MSCs, altered feature in winter and rainy season, insect bite, and creamy sansarga. Symptoms are Varti Danshta Sanstana Shotha, it means inflammation like insect bite, Kandu, Tod Bahulya, Chardi, Jvara, and Vidaha. Case presentation. A 41-year-old married female with no comorbidities came to our hospital. She was a non-vegetarian and taking excessive intake of salty, spicy food and doing diva swap. She was present with the complaints of irregular erythematic patches on whole body, severe itching from 6 months, excessive pain like pricking, and moderate burning sensation from 5 months, and insomnia due to severe itching at night from 4 months. On examination, Nadi was 76 per minute, Mal and Mutra was Samyak, Jiva was Sam, Shabda Prakruta, Sparsha Ushna, Drika Prakrut, Akruti Madhyama. In Shaman Chikitsa, we have given Kamduda Ras 250 mg twice BD before food with lukewarm water, Chandraprabhavati 250 mg twice BD after food with lukewarm water, Haridra Khanda 3 gram TDS after food, Panchatikta Ghrut 2 tablespoon twice a day before food, and for Savahan we have used Karanj Tel at daytime for local application. In Shodhan Chikitsa, we have done Sarvanga Snehan with Chandan Bala Lakshadi Tel for 7 days, Sarvanga Nadi Se Swedan for 7 days, Tiktak Shira Basti 280 ml for 7 days, and we have done Sira with cuboidal fossa on 7th and 21 day. For assessment, we have used this criteria. Depending on this, these were the observation. On first day, inflammation like insect bite, that is shotha, is present all over the body, and on 14th day it was present only on some part of the body. Mandolotpatti was on first day was severe, that is more than 50 wheels per 2 to 4 hours, and on 14th day it was less than 20 wheels in 24 hours. Talking about pricking pain, it was moderate, that is occasionally disturbing daily routine on first day, but on 14th day there was no pricking pain. On first day, severe affecting daily routine itching was present. On 14th day, it was mild, present but not annoying. On first day, frequency of appearance was severe, that is, it was present daily. On 14th day, it was mild, that is, once a week. These were the pictures before and after the treatment. Discussion. Chandraprabhavati helps to balance all three doshas, especially aggravated pitta. It is known for its detoxifying and blood purifying properties, which can be benefit individuals suffering from various skin conditions such as acne, eczema, and psoriasis. It helps remove toxins from the blood and promotes clear and healthy skin. Haridra Khandi is very famous and highly effective Ayurvedic medicine for allergy. It is used widely in the treatment of allergic skin disease, itching skin diseases. It improves skin quality and complexion. Its key ingredient is Haridra. Kamdudaras, it is renowned for its cooling and soothing property, making it particularly beneficial for condition associated with excess heat in the body. Panchatikta Ghrith, it is used for the treatment of non-healing ulcers, skin disease, eczema, worm infestation, hemorrhoids, and cough. Karanja Tel, it is detoxifying tonic that help flush out toxins to cleanse and purify the blood. It helps to control the itching and burning sensation of the skin and may aid in improving skin health. Thank you.
Thank you, Dr.
Hello.
Madhavi.
Sir, can I continue with my poster presentation?
Sure, doctor.
So the topic of my poster presentation is a review of Rasayan Chikitsa according to the Srotas in geriatric disorder. Ayurveda has focused branch of medicine called Rasayan, rejuvenation, which exclusively deals with the problem related to aging and the method to counter the same. Geriatric or Jara Chikitsa or Rasayan Chikitsa in Ayurveda is the method to control or to slow down the aging process in the human being during the degenerative phase of one's life. Aim of our poster is review on Rasayan Chikitsa according to Srotas in geriatric disorder. Objectives are to study Rasayan Chikitsa in various geriatric disorder according to Srotas. So moving forward, प्राणवह स्रोतस दुष्टि हेतु are वेग विधारण वृक्ष आहार सेवन excessive langan which will cause हिक्का श्वास धातु क्षय in geriatric disorder. We can use पिंपली भल्लातक आमलकी मरीच and कस्तूरी as a rasayan. Bhaya, Trushna, Veg Vidharan, Chinta are some of the causes of Udakvaha Strotas Dushti, which will cause Trushna, and we can give all fruit juices as a rasayan. In Annavaha Strotas, Aniyamit Ahar Sevan Kal, Ahitkar Ahar Sevan, Mukhapak, Annabhilasha, and Aruchi are some of the geriatric disorder. We can use Panchakul, specially Marich, Kapardik, Shankha Bhasma, Parpatikalpa, Hinga, and Nakeshar. In Rasvah Strotas, Guru Shit Ahar Sevan, Atisnigdha Ahar Sevan are Dushti Hetu, which will cause Pandu, wrinkle, Karsha, Agnimandya, and weakness as a geriatric disorder. We can give Khazur Mantha, Laja Manda, Guduchi, Yashti Madhu, Manjishta, and Shunthi. Vidahi Ahar Sevan, Snigdha Ushna Ahar, Dravya Ahar Sevan are some of the Dushti Hetu of Raktavah Strotas, which will cause Gudapak, Mukhapak, Vyanga, Pipliv, Tilkalak, and Charmadal. We can use Loha Bhasma, Gorochan, Guduchi, Bhringraj, Sariva, Manjishtha, Amalki as a rasayan. In Mansavah Strotas, Abhishandi Ahar, Guru Ahar, and Divaswap are some of the Dushti Hetu which will cause Adhimansar and Arbut as geriatric disorder, and we can use Suvarna Bhasma and Shuddha Karaskar as a rasayan. In Medovah Strotas, Avyayam, Divaswap, Snigdha, Guru, Shita Ahar Sevan are some of the Dushti Hetu which will cause Thaulya, excessive sweating, Madhumeha. We can use Gugul, Shilajatu, Patol, Musta, Guduchi, and Kumbha as a rasayan. In Asthivah Strotas, excessive exercise, Aghat, Vatakar Ahar Vihar, and Ati Chankraman are some of the Dushti Hetu which will cause arthritis, toothache, dental problems. We can use Abha, Asthi Shrunkhala, Shallaki, Shankha Bhasma, Kukkutandatvaka Bhasma as a rasayan in Asthivah Strotas. In Majjavah Strotas, Abhishandi Ahar Sevana, Viruddha Ahar Sevana, Abhighata, Prapidana are Dushti Hetu which will cause Brahma, Tama Pravesh, Murcha, Sandhi Pradeshi, Shula, Shotha as geriatric disorder, and we can use Raupya Bhasma, Bhringraj, Vacha, Brahmi, Shankha Pushpi, and Jatavansi. In Purishvah Strotas, Purishvek Dharan, Ajirnashan, Adyashan, Agnimandya, Ati Krushta are some of the Dushti Hetu which will cause Sakashta Malapravruti, Sashul Malapravruti, that is constipation. We can use Kutaj Bilva, Swarnapatri, Goghruta, Haritaki as a rasayan. Talking about Mutravah Strotas, Mutravek Dharan, excessive water intake, less water intake can cause Mutravah Strotas Dushti and Bahumutrata, Varavar Pravruti, and Mutrakrusha are some of the geriatric disorder. We can use Shilajut Gokshur, Punarnava, Varun, and Pashanbhed as a Rasaya. Svedvaha Strotas. In Svedvaha Strotas, excessive walking, bhaya, chinta, excessive exercise can cause Svedvaha Strotas Dushti, which will lead to dryness of skin or excessive sweating, in which we can use Vatsanap Kalpa and Nagavanga Bhasma. So the discussion is, as per the Ayurvedic principle, the aging is natural phenomena of life. Charak Samhita mentioned that functional diminution of dhatu, ojas, strength of sense organ, power of cognition, strength of body gradually decreasing during old age. So because of rasayan drug and therapeutic measure act on dhatus, agni, strotas and produce healthy tissue development in the body, and in turn it provide a person longevity, immunity, resistance against disease, strength, happiness and intellect promotion in the mind. So conclusion is, hence it can be concluded that Strotas Parikshan plays an important role while treating patient with Rasayan Chikitsa. Thank you.
Thank you, Dr. Madhavi, for the well-explained paper and poster presentation.
Thank you so much, sir.
Next, I would like to invite Dr. Venkatesh Perumal for the paper presentation on the topic Comprehensive Management of Krimi and Control.
Nidana Parivarjanam Eva Chikitsa. Here we are going to see a disease where Nidana Parivarjana is the treatment principle. Good evening all. Myself Dr. Venkatesh Perumal, first year PG Scholar, Department of Ayurveda. Here I am going to present my PPT. My title is Comprehensive Management of Krimi and its Control. Nidana, Ajirna Boji, Madhura Amla Nitya, Dravapriya, Prishtam, Gudo Upayokta, Vyayama Varji, Divaswapna, Viruddha. These are the Nidana for Krimi. Based on types, Masa Pishta Amla Lavana Guda Bojitehi, Purishaja, and Mamsa Matsya Guda Kshira Dadi, they will create Kafaja Krimi. Viruddha Ajirna Shaka Bojan will create Shonita Krimi. Types. Krimi is of two types, Bahya and Abhyantara Krimi. Bahya Krimi, that is external Krimi, is Tila Pramana in Varna and Samstha. They are Keshaja and Ambara, means they are Bahupadascha, Sukshmascha, they are Yuka and Liksha. Here is the types of Krimi. Bahyaja Krimi, Yuka and Liksha. Kafaja Krimi, according to Sushruta, 6 in number. Dharma Pushpa, Mahapushpa, Parluna, Chipita, Pipilika and Dharmaka. According to Madhavanidana, Raktaja Krimi are 6. Keshada, Romadepa, Romaja, Audambara, Saushura and Matara. Purisaja Krimi are Kakerika, Makerika, Sausurada and Chorava. Features: Sthana, Kafaja Krimi Amashayaja, Raktaja Krimi, Raktavahini Sira, Purishaja Krimi Pakwashaya. Common symptoms according to Sushruta: Jwara, Vivernata, Shula, Hridrogam, Chardana Brahmaha, Bhaktadvesha, Adhisarascha, Sanjata Krimi Lakshana. Fever, discoloration, pain, vomiting, faints, loss of appetite, diarrhea. These are the symptoms. Parasitic infestation, that which receives nourishment and shelter from the host, is called parasite. Common sites include intestines and blood. Classified mainly into protozoa and helminths. Helminthic infestation, major disease burden in developing countries, mainly classified into 3: nematodes, cestodes, trematodes. Nematodes contains roundworms, that is intestinal and tissue. These are the worms. Mode of transmission: contaminated food, contaminated water through skin piercing, that is hookworm, habitat like pica. Predisposition, malnutrition, improper hygiene, improperly cooked meals, unsanitary environment, vulnerable groups of preschool and school-going children, adolescent girls. Common symptoms, loss of appetite, stomach pain, discomfort, irritation and sleeplessness, unexplained weight loss, absence of weight gain, worms in stools, anemia, nausea and vomiting, rash, UTI, dysentery. Intestinal nematodes, Ascaris lumbricoides, intravenous vermicularis, and hookworm, that is hookworm, whipworm. These are the nematodes. Diagnosis, fecal examination. In enterobiosis, eggs are present in the perianal skin from which they can lifted using scope and tape method. Blood examination. In roundworm, USG, contrasted A of GIT. Modern treatment, albendazole, mebendazole are indicated in helminthiasis. Chikitsa. Here, apakarshana, prakriti vikada, nidana parivarjana. These are the treatment principles. Apakarshana, either by hand, instruments. In case of initial krimi, vamana virechana, astapana vasti, shiro virechana are indicated. Prakriti vikada, mainly done by internal medications. Nidana parivarjana, mainly by taking care of personal hygiene and avoiding the nidana. Vidanga kashaya should be taken internally in place of water as well as externally. Anuvasana basti with Vidanga Taila for 2 or 3 times on alternate days after Vamana and Virechana has been mentioned. Krimikna Gana, that they are Akshiva, Maricha, Gandhira, Kevuka, Vidanga, Nergundi, Kinihi, Swadamstra, Vrishaparnika, Akuparnika. These are very effective in Krimi. According to Ashtanga Hridaya, Chikitsa Sthana, Snehana, Swedana done for 6 to 7 days as a Purva Karma. Before the day before Shodhana, diet consistent Shira Guda, that is Utlesha Agara is taken. Shodhana, Vamana paste of Kana and Sarchakshara, Niruka, Surasadi Gana in Gomutra, Virechana, Tribrit Kalka, Madanapana Pipali Kashaya, Shiro Virechana, Traksin Apamarka Tanduliya Kana, Samsarjana Karma, Peya, Vilepi, boiled with Panchakola. External, Tikta Kadu Kashaya, Dravya Kashayam for bathing. Other types of located in head, heart, nose, ear, and eye with Anjana Nasya, Avapidana Nasya, Churna Nasya, horse dung processed with Vidanga Rashaya, dried in powder. In Krimija Shiro Roga Raktaja Nasya is mentioned. Romada Krimi, Indralupta Chikitsa, that is, in another point of view, Avalekana Visha Chikitsa can be adopted. Dantaja Krimi, Mukaroga Chikitsa can be adopted. Raktaja Krimi, Kushta Chikitsa can be adopted. According to Acharya Sushruta, for Purishaja and Kapachakrimi, Snehana with Krita prepared with Surasadikana, Vamana, Tikshna Virejana, Narugavasti with Yavakola Kulata can be done. Krimigna Bojana, Pana, Sirish, Apamarga Surasamadu, Kebuka Surasamadu, these kind of things can be taken. According to Kashyapa, Snehana and Swedana, Tikta Ushnakadu, Ruksha Dravya, Mutra Lavana, Prayoga. Bahi Krimi, bathing using Kashaya, drugs from Jivarini Adhyaya. In child, very young, both mother and child should be treated. After Shodhana, Patya Aushadha should be done. Application of Sarshapa Taila and Saindava Ingruda can be done. List of common Krimikna Dravyas: Vidanga, Palasha Bija, Ingudi, Tulasi Shudru, Mahanimba, Parshikevani, Haritiki, Ajaganda, Ajamoda, Kambillaka Kayada Tikta Kanchanaratok, Neeli, Karanja, these kind of things can be used. Yogas, Vidangadi Kashayam, Nirgundyadi Kashayam, Vidangakshara Kashayam, Krimikra Ras, Krimikudaravadi, Vilvadi Gudiga, Mustarishta, Kadirarishta, Palasha Bija Churna, Hingashta Churna can be taken. Patya Apatya, Rasa, Tikta Kashaya Rasa, Dravya, Tila Taila Takra, Tushodaka Gomutra can be taken. Shaka, snake gourd, ridge gourd, ash gourd, cucumber, ground ginger and garlic can be taken. Regular practice of Abhyanga Shodhana, Kafatna Duma is helpful. Kshirani Mamshani Kudam, that is milk, meat, ghee, jaggery, curd, leafy vegetable, sour and sweet foods should be avoided. Prevention, clean hygiene and sanitation, properly cooked food, cooked during drinking water. Drinking water should be boiled. Footwear while stepping out. If one person is affected, then treatment for all in the house. Red meat and unpasteurized milk should be avoided. By following these kind of prevention methods, we can control Krimi. Thank you.
Thank you, Dr. Venkatesh. Thank you for the magnificent presentation.
Thank you, sir.
Next, I would like to invite Dr. Bhuvaneshwari G. Patil for the paper presentation on the topic stress management through yoga. Dr. Bhuvaneshwari, are you there?
Yes, sir.
Good evening, doctor.
Very good evening, sir. Sir, is this visible?
Yes, Dr. Visible. Please start the session, doctor.
Okay, sir. Thank you. Myself, Dr. Bhuvaneshwari, working as Associate Professor, Department of Ayurapta at BLD AV Ayurveda Mahavidyalaya, Jaipur, Karnataka. Stress is a general word. Stress is a general word term to various mental and as well as the bodily pressures experienced by the people throughout their life. It can be alter health and as well as the emotions. It can affect the cognitive functions, increase the concentration, attention, decision-making ability, and as well as the creativity too. In a medical or a biological context, stress is a physical, mental, or the emotional factor that causes the bodily or the mental tension. Stresses can be external, that may be from the environmental factors or from the physiological factors or from the social situations, or it may be internal, that is from the illness or from the medical procedures. Stress can be initiate the fight or the flight response, a complex reaction of neurological and the endocrine systems. Types of stress. There are two types of stress. One is the eustress and the distress. Eustress is nothing but the positive stress that will be the challenges to the adaptant as well as it will be helps to grow the growth for the person. Distress is one that is the negative stress that can deplete or the destroy the energy for the energy of the life. Causes for the stress mainly one is the work or the organizing causes that may be related to the workplace or the wherever the environment related to the work or the outside the work, that is it may be related to the personal life or the family life or the social causes. Symptoms of the stress maybe it is divided into three ways, that is the physical, emotional, and as well as the behavioral. At the physical level, when the person is stressed, mainly having the symptoms like the muscle tension, rising voice, irritation, inability to sleep, excessive tiredness, dry mouth, breathing difficulty, sweaty palms, and the cold hands, and as well as even it leads to the stomach upset also. And emotional as well as the mental symptoms are nothing but those are the anxiety, worry, guilt, nervousness, anger, frustration, moodiness, depression, and even sometimes it may lead to suicidal thinking, appetite varies, loneliness, nightmares, and as well as the diminished concentration and impaired memory or the forgetfulness. Behavioral changes are the change in the productivity, sleep disorders, change in the eating habits, serious appearance, nervous behavior, and increased frustration, and even sometimes overreacting to the things. Health problems with excessive stress, it may lead to the like some of the non-communicable diseases like CHT and stroke, and gastrointestinal problems such as ulcers and IBS, and impaired immune system, and sometimes insomnia, headache, backache. So management of the stress, the mainly thing is here we can be managed, that is through the practicing of the yoga. Along with the practicing the yoga, if you have been adopted the proper nutrition, adequate sleep, positive attitude, and some of the relaxation techniques, and as well as the meditation, that will be definitely helpful for the management of the stress. So steps for the stress management. First and foremost, we have to identify the cause and the symptoms of the stress, then use the measures to reduce the stress, then seek solutions for avoiding the stressors and maintain the fitness and as well as the health. So yoga is one of the best tool to reduce the stress. So according to Yoga Sutra of the Patanjali, it has been explained as yoga is the restraint of the activities of the mind, or the what we call as the yoga chittarutti nirodha. According to Bhagavad Gita, it has been explained as evenness of the mind is nothing but the yoga, and as well as yoga is a skillful is in action. Series of the yoga.
So mainly yoga is according to Patanjali, it has been explained to 8 stages, that is Ashtanga Yoga, Yama, Yama, Asana, Pranayama, Pratyahara, Dharana, Dhyana and Samadhi. So these are nothing but the 8 limbs of the yoga. So from the Yama, again it is Yama, it consists of the Ahimsa, Satya, Asteya, Brahmacharya and the Aparigraha. In the Niyama, again it is of Saucha, Santosha, Tapas, Swadhyaya and the Ishvara Pranidhana. So those will be initially we have to come across all these like Yama and Niyama when we will follow these rules and regulations for our life. When we follow the like Yamas like Ahimsa, Satya, Asteya, Brahmacharya, then we have to go for the Niyamas. That is again the like these are nothing but the external as well as the internal cleaning of our body. Then we have to go for the adaptation of the asana. Before directly, we should not go for the asana. So before that, we have to adopt the yama and niyama. Then comes the asanas. Okay. So then asana here, the many asanas are there, but some asana will be helpful for to reduce the stress. That is the sukhasana is there, then Shashankasana, Setubandhasana, Swastikasana, Shavasana, and as well as the Makarasana. So along with this, some of the relaxation techniques has been explained. Those relaxation techniques are nothing but the so these are the processes or the procedures or the activity that will be helps the person to relax or to attain a state of the increased calmness, or mainly it will be reduce the levels of the anxiety, anger, and as well as stress. Mainly there are two types of relaxation techniques are there. One is the QRT, one more is the DRT. QRT means the quick relaxation techniques. DRT is the deep relaxation techniques. So next comes the pranayama. So pranayama means does not mean that just the breathing or the breathing exercise. It also means the establishing the control on the entire breathing process and maintaining the mental equilibrium and as well as the concentration of the mind. The insufficient functioning of the lungs affects the process of the blood purification. It is for this reason that the importance of the pranayama has come to the recognized for a healthy long life. Important pranayamas which will be helpful to relieve our stress are the Vastrika pranayama, Brahmari pranayama, Kapalabhati, Ujjayi pranayama, and as well as the Anuloma Viloma pranayama. So meditation, this is also one of the tool as in explained in the Ashtanga Yoga. Meditation is a practice in which an individual focusing the mind on a particular object or the thought or an activity to train attention and to achieve the mentally clear and emotionally calm and as well as the stability of the state of the mind. So how yoga will mainly works in the stress means in yoga, breathing use the diaphragm. So using the diaphragm as you breathe can stimulate the vagus nerve and helps to reduce the stress. The vagus nerve is the main nerve of the parasympathetic nerve system, extends from the medulla throughout the diaphragm to abdomen and responsible for the slowing the respiration rate, reducing the heart rate, lowering the blood pressure and as well as the stimulating the digestive capacity. So conclusion, here we can conclude that yoga appears to blunt the harmful effects of the highlighting stress by influencing the body's response to stress. There is also evidence that yoga helps to increase the heart rate variability, an indicator of the body's flexibility in responding to stress. Yoga helps to relax and as well as decrease the anxiety and the stress. The way we breathe reflects the quality of the mind. There is a connection between the mental, emotional, as well as the psychological states and the quickness of the breath. So the mental state influences our breathing pattern. Therefore, one can choose to change the breathing pattern and thus change mental state. So when we relax and slow the pace of our breath, the pace of mind is also calmed and quieted. Thank you.
Thank you, Dr. Bhuvaneshwari. Thank you for providing such an interesting and well-explained presentation. Thank you so much, Doctor. Next, I would like to invite Dr. Deni Sevak for the poster presentation. Dr. Deni Sevak, are you there? Dr. Deni Sevak, are you there? Next, I would like to invite Dr. Rishma for the paper presentation on the topic Effective Shodhana and Shamana Chikitsa in lichen planus pigmentosus, a case study.
Hi all, I am Dr. Ishma, first year PG scholar, Department of Ayurveda, Kaheshri PMK Ayurveda Mahavidyalaya, Belgaum. Here we are presenting on the topic Effect of Shodhana and Shamana Chikitsa in lichen planus pigmentosus, a case report. These are the contents of my presentation. Introduction. Lichen planus is a chronic inflammatory condition affecting the skin and mucosa surfaces. It affects approximately 1% of the population worldwide and is a T-cell mediated autoimmune disorder in which inflammatory cells attack an unknown protein within the skin and mucosal keratinocytes. Contributing factors to lichen planus may include genetic predisposition, physical and emotional stress injury to the skin. Lichen planus often appears where the skin has been scratched or after surgery. Localized skin diseases such as herpes zoster, systemic viral infections such as hepatitis C, which might modify self-antigens on the surface of basal keratinocytes. Contact allergy such as to metal fillings in oral lichen planus, and color photographic developers. Drugs, gall, quinine, quinidine, and others can cause a lichen rash. This is characterized by ill-defined oval, grayish-brown marks over the neck or trunk and limbs without an inflammatory phase. It is a form of acquired dermal-macular hyperpigmentation, can be provoked by sun exposure, but it can also arise in sun-protected sites such as armpits in diffuse, reticulate, and diffuse patterns. Rarely affects lip, resulting in a patchy dark pigmentation on upper and lower lips. In Ayurvedic perspective, this can be understood as Kapha-Pitta dominant Tridoshta Kushta. In this case report, Shodhana and Shamana treatments of general Kushta Chikitsa were adopted as a line of management to prove that such immune-mediated disease can be treated without any side effects with Ayurveda. Case report. A 24-year-old female patient complains of grayish-black colored, irregularly distributed lesions on the front of the neck and dorsal side of left hand since 8 years. The condition was associated with itching and redness. The lesions first appeared on the neck and later on the dorsum of hand. There was aggravation of symptoms on intake of milk, curd, and other salt food. The patient didn't seek any medical intervention for the first 2 years. Later, she noted increase in pigmentation and spreading of the lesions, and then she was taken to allopathy hospital and underwent punch biopsy and was then diagnosed with lichen planus pigmentosus. She was prescribed with steroids internally and sunscreen lotions externally. She noted a severe increase in the symptoms after intake of steroids, so she stopped the allopathic medication and consulted an Ayurvedic physician. She underwent different Shodhana Chikitsa and was also prescribed with some Ayurvedic medications as Shamana, where she had a significant change in spread and color of the lesions. Clinical findings: itching on front of neck, itching on dorsum of left upper arm, redness on front of neck and dorsum of hand, irregular blackish brown lesions on front of neck and dorsum of left upper arm, lesions spread to nearby areas. This is the case timeline. On 2014, appearance of first lesions in the front of neck associated with redness and itching. 2015, appearance of lesions over dorsum of hand associated with redness and itching. 2016, similar symptoms only, no treatments was done. 2017, biopsy was done on September and was diagnosed as lichen planus pigmentosus. She was under steroid medication for next 2 months, but the condition worsened. 2018 March came to our OPD with hyperpigmented lesions over the front of neck and dorsum of both hands. First course of Vamana Karma was done. Advised Shamana Aushadhis and Pathya diet. Patient had complete relief from itching and redness and arrested in the spread of lesions. 2019 September, first course of Vireshna was done. Noticeable change in the pigmentation of lesions. Advised to continue Shamana Aushadhis and follow Pathya. 2020 March, second course of Vamana was done. Further reduction in the pigmentation of lesions. Advised to continue Shamana Aushadhis and follow Pathya. 2021 March, second course of Vireshna was done, followed by Shamana Aushadhis and Pathya. Significant change in pigmentation. 2021 September, third course of Vireshna was done, reduction in pigmentation of lesions. Advised to continue Shamana Aushadhis and follow Pathya. 2022 May, third course of Vamana, some lesions disappeared, reduction in pigmentation and spread of lesions. No new lesions were noted further. Diagnosis was done by punch biopsy. Punch biopsy is considered as a confirmatory test. She was diagnosed with lichen planus pigmentosus. Therapeutic intervention. The patient was properly counseled regarding the nature of disease and its prognosis. Patient was recommended to avoid any exacerbating factors and was advised for Shodhana treatments and Shamana Chikitsa. The patient was advised to have Vamana and Vireshna in regular intervals after doing proper Pachana, Devan and Snehapana. After Shodhana, the patient was advised with medicines like Arapudari Kashaya, Gadirarishta, Arogyavardhini Vadi and external application of Manjishtadi Taila. The course of Vamana treatment is like this. Like first course of Vamana was done on 2018. Dipana Pajana with Trikatu Churna, Snehapana with Indugandha Gridam in the following dosages of 30, 45, 60, 90 and 120 ml for 5 days. There was Avarashuddhi and Avarashuddhi Samsarjana was done. Second course of Vamana was done in 2020. Dipana Pajana with Trikatu Churna, Snehapana with Indugandha Gridam, dosage of 30, 60, 90, 120 and 180 ml for 5 days respectively. Avarashuddhi and Avarashuddhi Samsarjana was done. Third course of Vamana was done in 2022 with Dipana Pachana with Chitragadi Vadi, Snehapana with Murchida Gridam, 30, 60, 80, 60, 120 and 120 ml was done for 5 days respectively. There was Pravarashuddhi and Pravarashuddhi Samsarjana was done. The first course of Vireshana was done in 2019. Debana Bhajana with Trigger to Churna, Snehapana with Indugandha Vidam in the dosage of 30, 60, 90, 120 and 180 ml respectively for 5 days. The Virejana Aushadhi was Gandhavastadi Eranda Taila plus Tripla Kashayam. Avarashuddhi and Avarashuddhi Samsarjana was done. Second course of Virejana was on 20-21 March. Debana Bhajana with Trigger to Churna. And the Snehapana was done with Indugandha Vidam on the dosage of 30, 60, 120, 180 and 220 ml for 5 days respectively. Aushadhi was Trivitleya. Shuddhi was Avarashuddhi and Avarashuddhi Samsarjana was done. Third course of Virejana was in 2021 September with Depana Bhajana with Trikadu Churna, Snehapana with Murchadakrita on the dosage of 30, 60, 120, 180, 180 ml. The Virejana Aushadhi was Abhyadi Vadi and Avarashuddhi Samsarjana was done. Shamana Aushadhi was Aravadadi Kashayam 20 ml BD with 60 ml lukewarm water before food. Gadirarishtam 15 ml BD after food. Arogyavadini Vadi 1 tablet per day. Manjushtha for external application. The changes was before treatment, the redness was seen in front of neck and dorsum of hand, especially in the upper arm. After treatment, there was no complaints of redness. And also itching, there was present on the affected part. After treatment, there was no complaints of itching. Pigmentation, dark pigmented lesions on neck, no dorsum of upper hand. But after treatment, the pigmentation was reduced and very slight pigmentation were noted. Size of the lesion was large, irregular, oval lesions. The size of lesion reduced after treatment. Spread of lesion, the lesions was spreaded on to the nearby areas. After treatment, there were no new lesions noted. This was the before and after treatment images. Discussion. According to Ayurveda, the dosha predominance can be understood as Pitta Kapha. The treatment done are predominantly Kapahara and Pittahara. Snehapana was administered as Gridha is having the Yogavahi property, so the medicated Gridha is easily absorbed and reaches the target organ. Vamanakama is the best treatment modality for morbid and increased Kapha as well as Apakha Pitta. Due to Vireshana, mainly vitiated Pitta dosha and secondary Kapha dosha and Vada dosha are being expelled. Shamana Aushadhi is elevating Pitta and Kapha was also given. Ingredients in Ayurvedic Kashayam reduce Kapha dosha and most of them act on the skin. It has antibacterial, antimicrobial, antiparasitic, anti-inflammatory properties. So it is found helpful in clearing skin diseases like Kushta. Haritaki in Gatirarishta helps in improving skin tone and it has anti-inflammatory and antioxidant property which promote health of skin. Arogyavadini Vadi is Depana Bhajata, Kafatna and Pittakna. Manjishta is Rakta Prasadaka and Varmya. Conclusion. The case report has demonstrated the effect of Shodhan and Shaman and Chikitsa in lichen planus pigmentosus. Identification of dosha involved and the treatment accordingly to a particular dosha is mandatory for the proper cure. This study has also shown the importance of Snehapana, Vamana, Vireshana and the management with Shaman Aushadhis in Kushta. The same treatment modalities can be incorporated in other skin diseases considering the dosha, kala and bala of Rogi. These are the references. Thank you.
Thank you, Dr. Rishma. Thank you for the remarkable presentation. Next, I would like to invite Dr. Anuja Jain for the paper and poster presentation. Dr. Anuja, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Good afternoon, everyone. Myself, Dr. Anuja Jain. Sir, can I start?
Sure, doctor. Please start, doctor.
Okay. So, Raktamokshan as Adhishtitha. Introduction. Introduction. Synonym of Raktamokshan is Ashravishwati, Shonit Mokshan, Rakta Nirharan, Rakta Shravan, etc. Inclusion of Raktamokshan in Panchkarma has been principally considered by Shushruta. In Charak Samhita also, Raktamokshan is considered as foremost and significant treatment in various diseases. Classification of Raktamokshan. There are mainly two types, Shastra Visarvan and Anusastra Visarvan. Prachan and Shiraved is Sast by Sas and Anusastra Shrink, Jaloka and Alabu. Raktamokshan in Visarv. If the visarp is caused with Sam dosha and is located in Pittisthana, Rakta Mokshan and Virechan are especially indicated. Importance of Rakta Mokshan in visarp. If all the therapeutic measures described here as curative of visarp be put on one side and Rakta Mokshan on other side, they will be found equal. Sakhagat Visharp. In Sakhagat Visharp, Dushti, Rakta Mokshan should be administered at first. In Vat dominance condition, Shing, Pitta dominant condition, Jalaku, Jaloka, and Kapha dominant condition, Alabu should be used. Or physician should be performed Shiraved promotely from the adjacent vein to the affected part. In Granthi Visharp, Rakta Mokshan by Shiraved or Jaloka is beneficial. In Vata Rakt, treatment principle was in Ruja, Daha, Shul, Jaloka should be used, Shupti, Kandu, tingling sensation, Shrink and Alabu should be used and not localized to a specific part, rather are fleeting nature. Shiraved and puncturing Prachan should be used. In Gulm, if Gulm does not subside even after proper treatment of Vat, etc., it should be pacified by bloodletting. Bloodletting in Pitta dominant Gulm. If the patient of Pitta Gulm is having thirst, fever, burning sensation, pain, perspiration, impaired digestion, and anorexia, is treated with bloodletting. Provoked Rakt is responsible for inflammation, which is removed by bloodletting. Thus, when root cause is removed, then there will be no inflammation resulting in vanishing the swelling and pain. Diet after bloodletting. The patient may become weak due to the elimination of vitiated Vat. Hence, he should be nourished by the diet comprising by meat soup and wild animal. To specify the remaining complaints, he should be prescribed the medicated ghee. In the Gulm, if Gulm does not subside even after proper treatment of, in Vatarak, in Kusht, management of Kusht. In Pittaj Kusht, Virechan along with Rakta Mokshan should be the first line of treatment. Prachan Karm, when Dushti is less, and Shiraved, when Dushti is strong. In Unmad, in Pitta dominant type of Unmad, the physician should perform bloodletting from the vein situated in the joining place of temple and the end of hairline. Indication in Unmad, fever and epilepsy. In Udard, treatment of Pliha Rakt Mokshan, bloodletting by the vein located in the left arm. In Arsh, if the disease is not relieved by the application of cold, hot, uncutaneous type of treatment, then such disease is likely to be caused by the vitiation of Rakt. In such condition, Rakt Mokshan procedure should be administered. Bloodletting with the help of application of leech and sharp instrument or needle should be done if blood does not come out on its own. Venusection of the vein situated between medially situated tendon and gulf. Shiraved Vidhi, puncturing of procedure of puncturing the vein. Shiravedhan Kal. Varsha Ritu in clear sky, Grishma Ritu in Sheet Kal, Hemant Ritu in Ushna Kal. Quantity of flow. In person who are strong, who have great accumulation of dosh and who are suitable age, burn trust. It means 640 ml of blood be allowed to flow out after venous puncturing. Adhishtitha. In Gradasi, 4 angul, it means 8 centimeter either above or below the knee joint. Vishwachi, same as Gradasi. Koshtuk shows Khanj, Pangu, pain caused by Vat. Janga Pradeshi, 4 angul above the ankle joint. In Abbahuk and Bahu shows in between two shoulder. Padda, Padharsh, Visharp, Vatrakt, Vatkantak, Vicharchika, Paddari, 2 angul above the Shiprumar, ascites or the Kodar, below the umbilicus, 4 angul at the left side of the abdomen. Apasmar in the made of Hanusandhi. Method and indication of Rakta Mokshan, dosh avastha anusar. Shing, which is Ushna, Snigd and Madhur in nature, used in Vat Vyadi, Vat Dosh Dushti, Jaloka, which is Sheet Madhur and born in water, which is used in Pitta Dosha Dushti, Alabu, Katu, Ruksh, and Tikshna, used in Kaf Dosh Dushti. Indication according to Rakt Sthan Anusar, Rakt Avastha Anusar, Shing and Alabu, Twak Sthit Rakt, Jalaku, Jaloka, Avgad, Prachan, Pindit Rakt, and Shiravid, Sarvang Vyapt Rakt. Thank you. Sir, should I continue with paper presentation?
Sure, doctor. Please, doctor.
Ayurvedic perspective of trigeminal neuralgia. What is trigeminal neuralgia? Trigeminal neuralgia is considered to be the one of the most painful affiliation known to the medical practice. TN is a disorder of the fifth cranial nerve. The typical or classical form of the disorder called TN1 caused extreme, sporadic, sudden, burning, and shocking like facial pain in the area of the face where the branch of the nerve are distributed: lip, eyes, nose, scalp, forehead, upper jaw, and the lower jaw. The pain episode lasts from a few seconds as long as 2 minutes. The typical form of the disorder called TN2 is characterized by the constant itching, burning, stabbing pain. Am I audible?
Yes, doctor, you're audible. Please continue, doctor.
Okay. Thanks. Causes of trigeminal neuralgia. Similarity of the cases according to Ayurveda while explaining the dosh causing the symptom, abhighat, injury, or the pressure directly lead to the increasing in the vat dosh, leading to an important vata vyadi lakshan like stool. Evidence suggested that in up to the 95% of case, trigeminal neuralgia is caused by the pressure on the trigeminal nerve close to where it enter the brainstem, the lowest part of the brain that merges with the spinal cord. In most cases, the pressure is caused by an artery or vein squeezing or compressing the trigeminal nerve. Modern scientific explanation: neuralgic pain may develop when the PNS has become damaged or abhighat directly or indirectly by chewing the ruksh ahar, aticharan, vyavai, vegdharan, like control the sneezing, causing the pain fibers to transmit pain impulse repeatedly and become increasingly sensitive to the stimuli. Neuroplasticity may also develop, and it characterized by abnormal neuronal sprouting in the PNS and within the dorsal horn of the spinal cord. The sprouting may be result in additional generation and increased transmission of pain impulses, resulting to the burning, dull, aching, tingling, like an electrical shock shooting. Transduction begins when the free nerve ending of C fibers and A delta fibers are primarily adherent neurons response to the noxious stimuli. Non-receptors are exposed to the noxious stimuli when the tissue damage and inflammation occur as a result of, or for the example, trauma, surgery, inflammation, infection, and ischemia. Here, noxious stimuli are similar. Modern science say that TN occur most often in people over age 50. This is the age of Vat predominance, although it can occur at any age. Sign and objectives. The find similarity of Vata anxious stimuli is causing facial nerve in the trigeminal neuralgia to give awareness about the disease TN. Sign and symptom of trigeminal neuralgia. Severe pricking pain is experienced at temporal region, back of the mouth, frontal region, and the root of the nose. The pain will affect the daily routine of the person. Intermittent twitching of delicate pain, severe episode of searing, shooting, and gesture pain that desire electrical shock. Pain from TN is frequent, very isolating and depressing from the individual. Thus, there are individual, family, and societal cost of TN. Diagnosis in modern diagnosis of is difficult. Differential diagnosis in Ayurveda in between Ardha Vedak, Vataj Shirashul, and Anantvat. Discussion. Ardha Vedak cause symptom can be correlated with trigeminal neuralgia. People are not aware about the disease. The treatment done in modern is surgery. Is in severe cases, the treatment of TN is focused on the relieving the pain first, as well as root cause is destroying by decreasing the Vata element in dosh. By proper diagnosis and early management, we can protest against the suicidal disease. Thank you.
Thank you, Dr. Anuja Jain. Thank you for the wonderful paper and poster presentation.
Okay, sir. Thank you.
Next is also a paper and poster presentation. I'd like to invite Dr. Prashant Rao Sahib Nagade for the paper and poster presentation. Dr. Prashant, are you there? Dr. Prashant Nagade, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir.
Dr. Prashant, can you
Yes,
please
sir.
share the screen, doctor?
Yes, sir. एक minute.
Doctor, if
Screen.
you have any problem with screen sharing, we will share for you, doctor.
Yes, sir. There is problem.
Okay, doctor, just a moment. Please start the session, doctor.
Uh, Paper presentation. The role of Ayurvedic management in Vipadika, that is palmoplantar psoriasis. Okay, study. Introduction. Vipadika is one of the type of Kushta dermatological disorder. It is found in 3 to 4% of all psoriatic cases. Its WHO prevalence is 0.44 to 2.88%. In modern medical science, it is commonly treated with UVA, corticosteroid, and immunomodulator, but recurrence is common. These cases is chronic in nature and treated by multiple modalities. So it was a challenge for us to treat it completely. In Vipadika, there is involvement of Vata Kapha dosh dominant. Objectives. The role of Ayurvedic management in Vipadika, that is palmoplantar psoriasis. Methodology. A 40-year female patient came to our Panchakarma OPD with complaints of crack on both palm and sole, with burning sensation and mild pain. Since last 1 year, she has taken treatment of modern medicine and was getting temporary relief. Due to recurrence of symptoms, she came to our OPD for further treatment. After clinical examination, multiple fissures were present on both palms and soles. She was admitted in CSMS Ayurveda Mahavidyalaya, Chhatrapati Sambhajinagar for 21 days and was managed with Vaman and Jalopacharan. Results there, a case report. The 40-year female patient was there. 40-year female patient had cracks on both palms and soles with burning sensation and mild pain since 1 year. History reveals that patient is non-diabetic, non-hypertensive. Family history was ill. There are ahara hetu like akalash bhojan, virodashan, vihar, ratri jagran. Medical history patient was taking allopathic treatment but doesn't get relief, so she came to our hospital for Ayurvedic treatment. Prakriti was Vat Kapaj, Dosha, Kapavata dominance. Dosha was Ras Rakta, Rakta and Rasa Pit Mas Dushti. Agni Jatra Agni Mandya, Sattva Madhyam. Diagnosis was Vipadi. Treatment protocol given. Argar Vardini Vati, 2 BD. With Koshnajal, Rumikuta Ras 2 BD, Rasapachak Kada 20 ml BD, Tandakarasa and 2 BD, and Chandanmala Lakshit Tel for Pratisaran. After that, Woman was done after that, that is Shodhan. From day 1, 2, 3, and 4, we do Snapan of Pitta Gruta, 30 ml, 60 ml, 90 ml, and 120 ml. After that, 1 day given for rest, and after Snan Swedan, Sarvanga Snan Swedan, woman was given. Woman was given by Yashtimadu Kada with certain of Sendov Pimpri and Vacha. So then Chikisa was woman. Jalokacharan, after woman, after 10 days of woman, we give Jalokacharan from Ubhay Hasta Padatal. Raktamokshan by Sira Ved after 15 days. That was collected 100 ml. That are the images before treatment, after, during treatment, and after treatment. Mode of action. Acharya Charak has clearly mentioned that the drug used in Vamana Karma get absorbed due to their virya reach to Hridaya, where from though circulation and then via stool and sukshma srotas, the virya of the drug reaches at the site of lesion, which may be in the form of dosha sangar. Discussion. Vipadika is Pradhan Tridoshaj Vyadhi. Progression of this disease is rapid, so management should be taken in proper time to arrest pathogenesis. Conclusion. Vipadika is a Vata Kapaj Shudra Kushta Roga. Vrukshaguna of Vata causes pain, severe dryness, which leads to formation of crack. Kandu is caused by Kapha dosha. Da is due to Pitta dosha, and Dharana of Mamsa and Swak leads to Raktasravan and Sputan. As it lies above Mamsadhara Kala, Mansik Chikisa and Nidan Parivarjan plays important role in the treatment as it stops further progression of the disease by restricting dosha vacation. In the present case, the patient followed Pushta Nidan like Virudhar 7, Adhyashan, and Mount 7. This case study shows that Vipadika can be managed through Ayurvedic treatment. Woman as a Shodhan therapy followed by Raktamokshan and Shaman Aushadhi are effective in the treatment of Vipadika like skin disorder. References are given. Thank you. Sir, can I do a poster presentation?
Sure, doctor. Thank you, Dr. Prashant.
Sir, can you please share the poster?
Okay, doctor, just a moment.
Yes.
Please start the session, doctor.
Yes, sir. My poster presentation is on role of Phaltrika Diquat in liver disorder. Aim to study the role of Phaltrika Diquat as liver tonic. Objectives to study the pharmacological characters of Phaltrika Diquat. Introduction. Nowadays, maintenance of diet style and lifestyle are irregular, may lead to indigestion, anorexia, weakness, may cause of liver disorder. In Ayurvedic classics, a number of single drug and formulation have been mentioned for treatment of liver disorder. Phaltrika Diquat is formulation having properties like Pitta Kapha Shaman, Yakrutotejak, Shothar, Panduroghar, Rechan Deepan contains 8 drugs. Formulations of Phaltrika Diquat has been mentioned in the context as referred in the Yogaratnakar Sharangar Samhita. Conclusion should be avoided over medication while treating the patient of liver disorder. Ayurvedic herbal preparation have advantages like shortening the disease period, early regeneration of liver parenchymal cells, avoid post-hepatitis residual symptoms, and avoid complications such as cirrhosis and hepatocellular carcinomas. And Rasvirya of all the contents of Phaltrika Diquat are given in the slide. Thank you, sir.
Thank you, Dr. Prashant Nagade. Thank you for the paper and poster presentation.
Yes, thank you, sir.
Next, we go to the case study. I would like to invite Dr. Dhanasri Ravegar for the paper presentation. Dr. Dhanasri, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Is it visible, sir?
It is sharing, doctor. Now it's visible,
Yes.
doctor. Screen is visible. Please start the session, doctor.
Good evening, everyone. Myself, Dr. Dhanasri Ravekar, working as assistant professor in Mahatma Gandhi Ayurved College, Wardha. My today's topic for presentation is a case study on Janu Sandhigatvat, that is osteoarthritis, and its management with Navaprasrutik Basti. Introduction. Due to lack of proper nutrients and due to old age dhatukshay, emaciation occurs, which leads to many degenerative conditions. One of such degenerative condition is osteoarthritis, which can be compared in Ayurveda with Sandhigatva. Shotha, that is swelling, Akunchan Prasaran, Vedana, that means pain during movement of joints, and Vatpurna Dhriti Sparsha means feeling of roughness during movements, were some of the signs that Acharya Charaka used to diagnose the condition. Asti Dhatukshay means emaciation of bone tissue is the important reason in old age for physical disability. So the case report was a female patient of 39 years old came to Ayurved in our hospital at Wardha. She was having chief complaints. That means she was having right knee joint pain in the last 2 months, from last 2 months duration. She was having known case. She was known case of hypertension and diabetes mellitus also. General examination done where in the form of gait, faces, pallor, icterus, cyanosis, and edema, all well normal. In the Ashtavit Pariksha, Nadi was Vatpitta, pulse was 78 per minute, Mutra 3 to 4 times per day, Mala only 1 time per day, touch, netra, and tongue were normal. Tongue was Niram. Pathology reports were showing as hemoglobin 12.4%, RBS 123 mg per dl, platelet counts were adequate, urine routine was whitish yellow, pH 6.2, specific gravity 1.031, and radiology findings in X-ray she was having changes of osteoarthritis for grade 2. Treatment she was prescribed as Abhyanga, that is massage in Nabhi, Parshva, Prishtha, Ubhaypat with Murchit Tiltel for 15 minutes. After that, Nadi Sweda for 3 minutes, and then Anuvasan Basti with Murchit Tiltel, that is medicated oil 80 ml, and then Navaprasrutik Basti as per the schedule. Contents of Navaprasrutik Basti are given as Brihat Panchamalkwat was taken 500 ml, Murchit Tildev was taken 210 ml, Madhu 100 ml, Gogruta 100 ml, and total amount, that means the quantity of the dravya was 910 ml. Method of administration in the form of Anuvasan Basti and then Navaprasrutik Basti. Dose was 80 ml. Kal once in a day was given in the duration of days. Observations were found as while doing knee examination before treatment she was having plus and after treatment was having no pain. Before treatment crepitus present and after treatment crepitus was reduced. Before swelling was present and after treatment it was not present. Tenderness was not present and after the treatment, and temperature it was present before treatment and after treatment it was absent.
Dr. Dhanashree.
Visible?
No, doctor, it is not visible.
Just 1 minute, sir.
Okay, doctor. Now it's visible, doctor.
Yes, sir. 1 minute. Patient got significant relief as a result of Snigdha and Ushna Guna of Navaprasrutik Basti and Murchit Tiltel Anvasan Basti at the same time. Vatahar Ahar and Vihar, which was advised to the patient at the time of treatment, Ushna and Bruhan nourishment, Dravyas reduced the patient's symptoms and provided comfort to her. Substantial positive changes in signs and symptoms were observed. Thank you, sir.
Thank you, Dr. Dhanashree. Thank you for providing such an interesting presentation. Thank you so much, doctor.
Thank you.
Next, I would like to invite Dr. Shivam Pramod Phobse for the paper presentation.
Am I audible, sir?
Yes, doctor, you're audible. Good evening, doctor.
Yes, can you share a screen for me?
Sure, doctor. Just a moment. Doctor, please start the session, doctor.
Okay. Thank you, sir. Good evening, everyone. Respected panel members. My name is Dr. Shivam Pramod Phobse. I am a PG scholar, Department of Ayurveda, YSC, Kodoli College, District, Kolhapur. My topic is management of inflammatory bowel disease and by Ayurvedic perspective. Please change this, right? So, inflammatory bowel disease. Inflammatory bowel disease is a term that describes disorder involving long-standing inflammation of tissue in your digestive tract.
Types of IBD includes ulcerative colitis. This condition involves inflammation and sores along the lining of your large intestine and rectum. Crohn's disease is the another one. This type of IBD is characterized by inflammation of the lining of your digestive tract, which often can involve the deeper layers of digestive tract. Crohn's disease most commonly affects the small intestine. However, it can also affect the large intestines and uncommonly the upper gastrointestinal tract. Both ulcerative colitis and Crohn's disease usually are characterized by diarrhea, rectal bleeding, abdominal pain, fatigue, and weight loss. For some people, IBD is only mild illness. For others, it is debilitating and condition that can lead to life-threatening complications. रक्तजातीसार संप्राप्ति. First, Nidan Sevan. Pitta dosha gets vitiated. Agni Mandya due to its Dravya Guna. Purish was Strotas and Udak was Strotodustri. Brick stool due to fluidity, hotness, laxativeness properties. Pitta Atisar. Intake of Pitta vitiated food and drinks. Rakta Dhatu gets vitiated. Rakta Atisar. So this is the Samprapti of Rakta Atisar. Samprapti Gatak, Dosh, Pitta dominant 3 dosha, Dusha Rasa and Rakta. स्त्रोतस पुरुषव उदकः and अन्नवः स्रोतदृष्टि अति प्रवृत्ति अग्नि जात्रा अग्नि धातु अग्नि उद्भव स्थान पक्वाशय. Signs and symptoms of IBD. The major symptoms of ulcerative colitis is bloody diarrhea with passage of mucus. In severe case, anorexia, tenesmus, malaise, weight loss, abdominal pain occurs. The first attack is usually the most severe. Thereafter, the disease is followed by relapse of and remissions. According to Acharya Charak, in Pitta Jatisar, the patient passes stool are yellow, green, blue, black, associated with Rakta Pitta and exceedingly folate. At the same time, patient also has general symptoms like thirst, burning sensations, sweating, fainting, pain in abdomen, inflammation, and suppuration in anal region. While Rakta Atisara, the bloody diarrhea along with thirst, pain, and burning sensation in abdomen and inflammation of anorectum is present. Treatment. So this is a generalized theoretical treatment. Treatment is focused in healing the ulcers and restoring the normal function of colon and maintains the overall health of digestive system. Shaman Chikitsa includes Agni Dipan, Ampachan, Grahi Chikitsa, Stambhana, Vranaropan are very good with Ayurvedic line of treatment. Ulcerative colitis is disease which cannot be cured completely in all the patients but can be managed by adopting various modalities of Ayurvedic treatment which provides better quality of life for the patient. Various oral medicines has been proved useful in elevating the symptoms and to reduce the condition. A case study. So there is a 55 years male patient. He is auto driver. He complains about hard stool with bad smell while defecation, pain in abdomen, abdominal distension, pain and swelling at anal region, loss of appetite since 2 months. History of present illness. The patient was apparently well before 1 year and gradually he developed with loose motion, with blood, abdominal pain and low back pain. He consulted doctor after all examination. It is diagnosed as IBD. Recently, since 6 months, he complains of smelly sticky discharge while defecation associated with pain in abdomen, gaseous distension, pain and swelling at anal region and loss of appetite. Past history, known case of IBD since 3 years, no other comorbidities, no other any surgical or relevant family history. First history, he is actually vegetarian plus non-vegetarian. Agni, Manda, Koshta, Krur, Nidra, Alpa, Vesan, none. He is not habitual to anything. Medicinal history, the tablet Asacol 400 twice a day for food after food since 1 year. Samanya Pariksha general examination, pulse was 80, respiration rate was 70, BP was 130 by 80, weight 61, height 168, built, poorly built, cyanosis no, pallor no, icterus no, edema no. Local abdominal tenderness with when palpated, no blood seen on rectal examination. Treatment. Bhunimbadi churna, half teaspoon twice a day with Godambo. Indrayo churna 3 gram, go grista at night with Manda. Langhana with Mugda Yusha, Yashtimodukvat, good for anal region prakshanan. After that, patient observed lightness in body, reduced blood in stool. After 7 days, Nagar he was asked to follow after 7 days. So Nagarati Churna 1 teaspoon twice a day with Tandulambu. Shatavari Gruta 2 teaspoon twice a day with Godugda. Shadanga Paniya 50 ml twice a day before meal. Yashti Madhupat for Prakshalan. Nagaradi Churna with Tandulok. Erandamul Churna 1 teaspoon boil with Godugda at bedtime. Changiri Gruta half teaspoon once a day with warm water before food. Takrapan. The patient was happy with this Ayurvedic treatment. As reported by patient, he is feeling better. Gases distension is reduced. Pain is also reduced. No bloody stool and mucus. Thank you, panel members and everyone. Thank you, sir, for the opportunity.
Thank you, Dr. Shivam Popse. Thank you for the magnificent presentation. Next, I would like to invite Dr. Bhavya Khurane for the paper presentation. Dr. Bhavya, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Shall I start, sir?
Sure, doctor. Please start, doctor.
A very warm welcome to one and all present here. I am Dr. Bhavya Khurana, PG scholar from the Department of Kai Chikitsa from Dr. D.Y. Patil College of Ayurveda and Research Center. And my topic of the presentation today is Marm Chikitsa, Precision Healing through Ayurvedic Expertise under the guidance of Dr. D.J. Dipankar. So marmas are the site of pran and chikitsa refers to therapy. Marma chikitsa is the understanding of the therapeutic use of marma. Before going into the chikitsa portion, I would like to tell that one should know about the name, number, and location of each and every marma. So there are 107 marmas. We should know about the classification, that is the Anga Bhed, the Sankhya Bhed, the numerical classification, the classification based on Sanrachna, whether it is a Mans marm, Sira marm, Snayu marm, their classification based on Parinam, whether it is a Sandhya Pranhar marm or it's a Kalantar Pranhar marm, then their dimensions, their Panchabhautik correlations, their tissues and anatomical structures. I would like to explain this with an example. Say, for instance, Shipramarm. The word Shipra means quick because of its immediate effect. They are 4 in number. It's a Snayu marm and a Kalantar Pranhar marm, and its measurement is half angul. Coming to the tissues involved, in hands, there are flexor pollicis brevis, branches of median nerve, there's plantar arch, and in feet, there is adductor hallucis brevis, tibial nerve, and in case it is injured, there would be bleeding or impairment of movement. So in this way, we have to know about each of the 107 marmas. Coming to the main topic, that is the marma chikitsa. So we should know 3 important points. First, how to stimulate the marma. Second, the duration and frequency. And third, which marma needs to be stimulated in which condition. So how to stimulate the marma? These can be classified in 2 categories, pharmacological and non-pharmacological. Pharmacological includes Abhyang, Udvartan, Lep, Dhara, aromatherapy, and non-pharmacological includes Mardan and Pranic healing. Marma Abhyang, it could be either Sarvang or Sthanik, and based on the direction, it could be Anuloman. It is helpful. Anuloman massage is done to strengthen the tissue. So we'll do in atrophy patients. And Pratilom massage, it helps to open the obstruction. So in case of vascular diseases or obstruction, lymphatic obstructions, we can go for Marma Abhyang. Coming to Udvartan, the principle remains the same. Just here, the material changes to powder. Lepan, Marma Lepan is utmost important in sports injuries. It has analgesic action and reduces the swelling and promotes wound healing. Marma Dhara, Dhara refers to pouring of hot liquids over the marma sites. A classic example, Shirodhara, is stimulation by Dhara. It stimulates Thapani, Uchep, Avar, Shank, etc. marmas of the head region. Aromatherapy. So aromatherapy basically makes use of essential oils. So we can use it with our herbal oils. It has olfactory benefits along with the local benefits. So we can use spicy or pungent oils in case of Vata Kapha disorders and sweet oils in case of Pitta Vata disorders. Coming to Mardana. Mardana is applying controlled pressure over the marma sites. For back and limb marmas, we have to apply more pressure, whereas in abdomen and chest marmas, we usually stimulate with fist or index fingers. But we have to remember, in case of Sadhya Pranhar marma, we should either avoid gentle pressure or avoid it completely because it would be otherwise fatal. Duration and frequency. Each marma should be stimulated for around 18 to 25 times for 0.8 seconds, and pressure should be like applied during each inspiration. In case we are going for marma abhyang, it could be done for 2 to 5 minutes at each marma. Coming to the therapeutic importance. So as I have discussed the details of Shipra marma, in lower limbs, it would help to control Rasavaya Pranavaya Avlambak Kapha. It helps to stimulate the heart-lung axis. Other than this, Shipramarm in hand is very important that it is used to treat complications of improper manipulation of marmas. These are some of the photographs. There are 107 marmas. It's not possible for me to cover each and every one of them. I'll be focusing on the lower limb marmas. So Talhridaya marma is used for regulation of blood pressure. For hypertension, we'll stimulate the right side marma. For hypotension, we'll stimulate the left side marma. Kurch marma, it controls alochak paste. As we all know that Charaka mentions Padabhyang at Chakshusha. It is because of this Kurch marma. Kurchshir marma for painful conditions of feet. Then Gulf marma, it is one of the most tender and potent marmas of the body. It controls Medhovaya, Astivaya and Shukravaya srutas. Indrapasti marma, posterior tibial artery is present over here, so it has to be stimulated very carefully, otherwise there would be severe bleeding. It controls Anavaya strotus. It is useful in treating urinary and lymphatic diseases. Janumarm, as we all know, in degenerative conditions. But other than this, right Janumarm helps to improve the functioning of the liver, and left Janumarm helps to improve the functioning of the spleen. But in case there is injury, as I have already discussed, we should go for Marma Lepana. We would avoid Mardana. Animan, it stimulates Udagvaya strotus and it helps to reduce the muscles of in the fatigue of the thigh muscles. Squatting helps to stimulate Animarma. Urvi marma, it controls Udagvaya and Rasvaya strotus. It is beneficial in circulatory disorders, and Vrikshasana help to stimulate this marma. Lohitaksh marm, it is a very dangerous marm, and if it is stimulated wrongly, it will cause paralysis of the lower limb. So we have to apply very gentle pressure over the same. Vitapmarm, it helps to control Shukravaya and Artavaya strotus. So any reproductive and sexual disorders, we have to stimulate this marma. Padmasana help to stimulate both Vitap and Lohitakshmarm. Now, after knowing the therapeutic importance of 107 marmas, we should know how to plan marma chikitsa. So first we need to know is the objective, whether it is preventive, curative, etc. We should know regarding the indications and contraindications of the marma. And then we have to decide the marma based on the region, the diagnosis, the doshas, the srotas, the samprapti, which mode, medium we have to use, whether we have to go for abhyang, whether we have to go for advartan, the duration, the frequency, etc. And whether any shaman aushadhi or shodhana is needed, whether we can plan for self-marm chikitsa, marm shaya, etc. Other than this, marma chikitsa is linked with various other sciences, be it yoga. I have discussed some of the example, acupressure, acupuncture, reflexology, etc. So at the end, I would say that marma chikitsa help to address the root cause of the imbalance, and it offers sustainable solution in achieving the optimal health in modern age. Thank you so much.
Thank you, Dr. Bhavya. Thank you for the wonderful presentation.
Thank you, sir.
Next, we go to the poster presentation. Next, I would like to invite Dr. Bhavarkar Prasad Ramesh for the poster presentation on the topic concept of Viruddhahara.
Hello everyone, myself Dr. Bhavarkar Prasad Ramesh, first year PG Scholar Department of Kai Chikitsa, Kahir State BM Kankanwadi Ayurveda Mahavidyalaya, Belgavi. I am presenting poster presentation under the guidance of Dr. Sukita Kumari ma'am. Topic concept of Viruddhahara. As per Acharya Charaka, Viruddhahara is defined as Yata Kinchita Dosho Asravya Na Nirharati Kayata Ahara Jata Tata Sarva Ahita Yogpadyate. That means the food or drug that provoke the doshas but does not eliminate it from the body, then it is called as Viruddhahara. As per Acharya Bhagbhata, Viruddhapi Ahara Vidya Dvisha Rog Garopamam Yata Kinchita Dosha Klesha Naharita Tata Samasata Viruddha. That means certain diet and its combination which interrupt the metabolism of tissue, which inhibits the process of formation of tissue, and which have opposite property to the tissue. Opposite property to the tissue. The food which is wrong in the combination has undergone wrong processing, or consumed in incorrect dose, or consumed in incorrect time of the day and in wrong season can lead to viruddhahara. This is what the definition of viruddhahara as per acharyas. Now, the mode of action of viruddhahara. Firstly, concept of Yachini, that is mode of action through Yachini. Reheating of all oil create more oxidation, and if consume may create more oxidative stress, creating more free radicals. That is, when fruits or vegetables pieces are boiled inside oil get fried, then oil molecules that penetrated into the fried food gets converted into the molecule called 4-hydroxy trans 2 nonenal HNE. That is, while getting cooled in room temperature, this molecule will again convert into toxic HNE. This is what the mechanism of viruddhahara. Second mechanism is through AGs, that is, high temperature cooking can also lead to samskara viruddha. Foods typically cooked at the high temperature, like meats, may contribute to the risk and exacerbation of chronic diseases linked with inflammation. When proteins are cooked with the sugar, in the absence of water, AGs advanced glycosylated end products are formed. And third mechanism through zinc and antioxidant properties. Fast food is high in energy density and low in essential micronutrient density, especially zinc, of which antioxidant processes are dependent. It has been tested that frequent fast food consumption could induce oxidative stress, that is damage associated with inflammation in wandering male rats in the levels to zinc deprivation, which could adversely affect testis function. That this is what the mechanism of action of viruddhahara is through through HNE, then AGs, and then antioxidant properties. That is hampering the body's mechanism, antioxidant mechanism. Commonly practiced viruddhahara infers that commonly practiced krama viruddha. That means not following the proper sequence of ahara. Intake of, with example, intake of sweets after having a meals or food. It is known as krama viruddha. Second mostly practice is virya viruddha. That means antagonism due to potency. That is ushna and shita, or mixture of ushna and shita. Some commonly practiced examples are biryani with raita, or fish with milk. Again, most commonly practiced is samskara viruddha. Improper processing of food can lead to samskara viruddha, and through HNE mechanism of action, it can lead to further hamper the pathology of normal pathology of body. That is improper processing. Some examples of samskara viruddha are hitting honey. Most commonly samskara viruddha hitting honey along with seasoning of curd rice. These are all are the examples of samskara viruddha. Apart from there are many viruddhahara, but most commonly use the karma, virya, and samskara, and mode of action, that is concept of viruddhara through HNE, concept through AGs, and concept through antioxidant properties. This all leads to the diseases like Pilasa, Kushta, Grahani, Shotha, Amlapitta, Jwara, Pinasa, Stanya dosha. These are the diseases caused by viruddhahara. And how it caused, that is through mechanism, that is concept of HNE and AG. Thank you.
Thank you, Dr. Bhavatkar Prasad Ramesh. Thank you for the session. Next is also a paper presentation. Next, I would like to invite Dr. Saujanya for the paper presentation.
Good evening all. Myself Dr. Saujanya J, Assistant Professor, Department of Kaya Chikitsa from SDM IIH Bengaluru, also pursuing my PhD from Ayurveda Mahavidyalaya, Hubli, is here to present a case study on Tamakashvasa, that is bronchial asthma. Moving into the introduction, the Pranavaha Sroto Vikaras, which has been emphasized in our classics, are Kasa, Shwasa, Hikka, Rajayakshma. Among them, Shwasa plays a vital role for the clinicians. Among the Shwasa, Tamakashvasa is the one which we encounter in our daily clinical basis. So based on the similar clinical features such as breathlessness, cough with thick mucus sputum, tightness of chest, aggravation of the symptoms during night, early morning, consumption of cold substances, exposure to cold breeze, rainy and winter season, along with the other features such as cold, throat irritation, and a subject faints due to excessive breathlessness, difficulty in speaking due to excessive breathlessness, sleeplessness, sweating on the forehead. Discomfort usually increases when a person lies down and gets comfort in sitting posture and one spits the adate sputum. With this basic knowledge regarding Tamakashvasa and its interpretation with bronchial asthma, moving directly into my case study. So, a male subject aged 40 years, not known case of diabetes mellitus or hypertension or any thyroid dysfunction, approached my OPD with the complaints of recurrent breathing difficulty since 3 months, associated with running nose since 3 months. On examination, nasal cavity, there was no deviated nasal septum or no mass or polyps. Trachea was centrally placed with no deviation. On auscultation, I could hear bilateral V's in all the lobes, more in right than left, that too more in right upper lobe. So on thorough examination, for a period of 1 week, I had given him Caprinagra 2 TID after food along with Shwasamritan 10 ml TID with 20 ml warm water after food and advised for a plan of Virechana. So a patient after a week approached the OPD back and there was no running nose at all, but breathing difficulty was still persisted but reduced than before. Got admitted, and on the first day of admission, as a protocol for Deepana Pachanartha, Chitrakadi Vati has been given 2 TID before food and advised Sarvanga Dashamula, Vata Parisheka, which is Vata Kafahara and also indicated in Tamakashvasa. And for Anulomanartha, Snehapana has been given for 5 days and Uttara Sneha Vriddhi of Sukumara Grita up to 200 ml. And after that, 3 days of Vishnamakala, Sarvanga Abhyanga with Dhanvantara Taila and Nadi Sweda has been adopted. And Trivrit Lehya 60 grams with Trifala Kashaya, 100 ml as Anupana has been given. And the Vegas were 12. So considering the Madhyama Shuddhi, he was advised Samsarjana Krama for 5 days. And after the Samsarjana Krama, review back for OPD visit. So on auscultation, after Virechana, V's was only present in bilateral upper lobe, more in right and left, whereas middle lobe and lower lobe was completely clear. So after Samsarjana Krama, patient approached back to OPD and he was on regular follow-up every month from 5th November to 1st July 2023. With this follow-up medication such as Swasamritam 20 ml TAD with 40 ml warm water, a combination of Sitopaladi Churna, Madhyashti Churna and Shringyadi Churna with 50 grams and 25 grams with 5 grams each in combination, 1 teaspoon with honey after food, and Avipattikara Churna Anulomanartha at night, 1 teaspoon. Along with that, Bruhat Saindavadi Taila for Sthanika Abhyanga to chest region followed by Ushna Jala Snana. And the patient was having usually acute exacerbations when there was extreme cold. So on that time, I had advised Cap Nielsen 2 TID after food and Afloocel 2 BD after food. So on every visit, there was mild wheeze noticed in right upper limb, whereas all the other lobes were absolutely clear. So after this period of time, again, since the symptoms were on and off, and he also used to experience occasional recurrent episodes of exacerbation. So second set of Shodhana, the importance of Shodhana or repeated Shodhana plays a role here. So Virechana has been adopted, whereas Sarvanga Dashamula Parisheka Kvata Day 1 and for Deepana Pachanartha Chitrakadi Vati 2 TID has been given, and same Sukumara Grita. Along with that, Panchatiktaka Gugulu Grita has been added because he also had little skin related issues of mild pustules. So Abhyanga was been planned with Dhanvantara Taila and Bashpasveda during Vishrama Kala, and Trivrit Lehya 80 grams has been given along with Triphala Kashaya. The total number of Vegas were 12. Considering the Madhyama Shuddhi, 5 days of Samsarjana Krama was advised. So after Varechana, in this time, on auscultation, bilateral NVBS was heard without any added sounds. That is the beauty of repeated Shodhana. So after that, follow-ups has been advised with Dashamula Katutrayadi Kashaya, 15 ml BD with 30 ml warm water, Agastya Haritaki Rasayana, that is Rasayana Prayoga, and along with Sitopaladi Churna, Madhuyashti Churna and Shringyadi Churna, 1/4 teaspoon thrice a day with honey, along with Shvasamritam 20 ml, only during the exacerbation of symptoms, if any. And the follow-up, there was no any added sounds again. So repeated follow-up has been told to him, and this is the chest X-ray before the second Varechana and after the second Varechana, where exactly it shows the difference here. It is luminar thinning along with the thickening of the bronchial wall. Here it is absolutely normal, and even the finding shows right-sided bronchial wall thickening with bronchial luminal narrowing, whereas after Virechana Karma, both lung fields were absolutely clear. This is a clinical evidence-based study on Tamakashvasa based on only Ayurvedic treatment where none of the modern medicines has been given to the patient. So after this, he was on regular follow-up up to March 2024, where only Rasayana Prayoga, that is Agastya Haritaki Rasayana 1 teaspoon morning has been given. And recent visit, he has been instructed to stop the Rasayana and only to follow the Patya, which has been explained based on the Shwasa Chikitsa Adhyaya. And on recent visit, that is April, there was no symptoms even after the leaving Rasayana Prayoga, and his all the parameters were absolutely normal, including the lung fields. So moving into discussion and conclusion, treating Tamakashvasa is not that easy. We have to always assess the avastha, always assess the face of person when they comes here. In this specific case, it is very recent in origin, so the condition has become sadhya, and management always should be planned by means of 5 aspects. Nidana Parivarjana, in this case Rajo and Dhuma was the Nidana, with Parivarjana has been adopted by patient, followed by Shodhana Chikitsa, which is relevant based on the dosha predominance, then Shamana, Rasayana and Patya. So based on this clinical study, I would like to conclude that cases of bronchial asthma, which is interpreted as Tamakashvasa, are not that easy to clinicians, and it is really a challenge when we sit in OPD. Always we have to plan the treatment based on avasthanusara, and always the avastha chikitsa, whether it is an acute phase or chronic phase, and when the person approaches us, whether it is recent in origin and chronic in origin, always we end up being a clinicians, we end up the Tamakashvasa cases where they'll be on modern medicines, where they'll be on inhalers, even on nebulization for many years, and at last they'll approach us. So that time we have to surely tell the patient and educate them. This is not magic or miracle which is going to happen within 1 or 2 months, and it takes recently a long period of time to work out. And once it is chronic, as said in our classics, it is yap. So treating Tamakashvasa, being a Kaya Chikitsa person is easy as well as not easy, as I said, and always we have to plan the treatment based on Avasthanusara Chikitsa. Thank you.
Thank you, Dr. Saujanya. Thank you for the wonderful and well explained session. Next, I would like to invite Dr. Aishwarya Uday Bhosale for the paper presentation. Dr. Aishwarya, are you there? Dr. Aishwarya Bhosale, are you there?
Yes.
Good evening, doctor.
Good evening. Hello.
Can you please share screen?
Hello.
Hello, doctor.
Hello.
Yes, doctor. Can you please share the screen, doctor?
Okay. Hello.
Hello, you are audible,
Can you
doctor.
please share my screen?
Okay, doctor, just a moment. Please start the session, doctor.
Okay, thank you. Good evening, everyone. I'm Dr. Aishwarya Bhosle, PG Scholar, Department of Kaya Chikitsa, Yashwant Ayurved College, Postgraduate Training and Research Center, Kodali. My topic is management of Shita Pitta through Shodhana and Shamana. Next. Shita Pitta comprises of two words, Shita, that means cold, and Pitta refers to warmth. The condition occurs due to dominance of cold existing in Kapha and Vata dosha over Pitta dosha. Shita Pitta can be clinically correlated to urticaria of modern science, characterized by a red itchy rash caused by vasodilation, increased blood flow, and increased vascular permeability due to activation of H1 histamine receptor and H2 histamine receptor. Next. Samprapti, Nidan 7, then Kapha and Vata dosha prakop, then combined with Pitta dosha, then Prasara in throat.
मावशी मावशी तिकडे जाऊ ना ओ मावशी बोला इथे प्रेझेंटेशन चालू आहे आमचं नेक्स्ट
स्थान संशय in त्वक and स्थान संशय in रक्तादि धातु, then Shotha and Mandala Utpatti and causes Shita Pitta. Next. Samprapti Ghatak, Dosha Tridosha, Dushya Rasa and Rakta, Agni Manda, Srotasa Rasavah Srotas, Raktavah Srotas, Strota Dushti Prakara Vimarga Gaman, Udbhavstan Amashay, Vyaktastan Twak, Swabhav Ashukari. Next. Nidana. In Madhukosha Tika Sangraha, Pitta, which is increased because of its own reasons, when comes in contact with Shita Maruta, causes the disease Shita Pitta. Hence, the Nidana explained by Acharya for Shita Pitta is a Vyanjak Hetu triggering factors. Next. Aharaj Nidan, Amla, Lavana, Katu Rasa, in Tikshna Rasa, Masha, Kulatta, Dadhi, and Viruddhahar. Viharaj Nidan, Shita Maruta, Divaswap, Atyatak. Anya Nidan, Chardi Vek Vidharan, Vaman Ayog, Kitadamsha, Sharadritu. Next. Purvarupa, Pipasa Aruchi Rallasa, Deha Sadanga Gauravam, Rakta Lochanata Tesham, Purvarupasya Lakshana, Madhav Nidan. Next. Lakshana, Varati Damshta Samsthana, Shota Sanjayate Bahihi, Kandu Stoda Bahulash, Chardi Jvara Vidahavan, Madhav Nidan. Bahya Lakshan, Varati Damsha, sting of wasp, Shotha, swelling, Kandu Bahula, severe itching, Toda Bahula, severe pricking pain, Abhyantara Lakshana, Chardi, vomiting, Jwara, fever, Vidaha, burning sensation. Next. Sapeksha Nidan, Udarda, Udarda Miti Tam Vidyad, Shita Pitta Mathapare, Vatadikam Shita Pitta, Udardastu Kafadika, Madhav Nidan. Vata dominance in Shita Pitta and Kapha dominance in Udarda. स उत्संगे स रागश्च स कंडुभिश्च मंडले शैशिरे कफजो व्याधि उदर्द इति कीर्तितः माधव निदान. Utsanga, that is elevated rashes. Next. Raga, that is reddish in color. Kandu, itching. Mandala, round patches. Shaishira, increase in Shishirutu. Then Kotha, Asamyak Vamana, Udirna Pitta Sleshma, Anna Nigrahe, Mandalani Sakanduni, Ragavanti Bahunicha, Utkotaha Sa Anubandascha, Kotha iti Abhidiyate. Causes Asamyak Vamana, incomplete emesis, Udirna Pitta Sleshma, Anna Nigraha, suppression of Udirna Pitta Sleshma and Anna. Next. Symptoms Bahumandala, innumerable rashes, Bahukandu, severe itching, Bahuraga, redness, Kotha aggravates in Varsha Ritu, according to Yoga Ratnakar. If Kotha repeats again and again many times, it's called Utkotha. Shita-pitta, Tridoshaji Vyadhi, according to Madhukosha Tika, Vata-pradhan Vyadhi, main symptom Toda, Kinchit Mandalotpatti, aggravates in Sharad Ritu, and this is Ashukari condition. Then Udarda, Vinshati Kapha Nanatmaj Vikar, according to Charak, Kashyap, and Vruddha Vagbhat, Kapha-pradhan Vyadhi, main symptom Kandu and Vaman, elevated Mandalotpatti, aggravates in Shishira Ritu, and subacute condition. Kotha, Rakta Pradoshaj Vyadhi, according to Vagbhat. Kapha Rakta Pradhan Vyadhi, main symptom excessive Kandu. Raktach Mandalotpatti, aggravates in Varsha Ritu, and chronic condition. Next. Sadhya Sadhyata. Shita Pitta is Bhaya Rogamargashrita. Hence, it can be considered as Sukha Sadhya Vyadhi. Next. Chikitsa, Nidan Parivarjan. Then various classic explain Shodhana, Shamana, and Bahir Parimarjana Chikitsa for Shita Pitta. According to Chakradatta, Abhyanga Katu Tailena, Seka च उष्ण अंबुभिस्ततः उदर्दे वमनम कार्यम पटोल अरिष्ट वारिणा अभ्यंगवित सर्षप तैल सेकवित उष्ण जल वमनवित पटोल निंब कषाय. नेक्स्ट. कुष्ठोक्त च क्रमम कुर्यात अम्लपित्तघ्नमेव च उदर्दोक्त च क्रिया चापि कोठरोग समासतः सर्पिषित्वा महातिक्तम कार्य शोणित मोक्षणम. We can do कुष्ठ चिकित्सा, अम्लपित्त चिकित्सा, उदर्द and कोष्ठ चिकित्सा, and specific chikitsa mahatikta grita followed by rakta mokshan. Next. A case study. Patient 19 years old, sex male, occupation student, complaints of reddish slightly elevated rash on trunk, face and hand, itching and burning sensation over rash. History of present illness. A 19 years old male patient along with his parents came with above said complaint to Kaya Chikitsa OPD of our institute. Next. The patient took allopathic medications and got temporary relief. But the condition relapsed on discontinuing the medication. Past history, nil. No other comorbidities noted. No other medical and surgical history. Family history, no relevant family history. Personal history, ahar, fast food, spicy food, curd. Bihar, traveling for the college, early morning. Next. अग्नि मंद, कौष्ठ क्रूर, निद्रा अल्प, व्यसनन, अष्टविध परीक्षा, नाड़ी पित्तवात, मल कॉन्स्टिपेटेड, मूत्र प्राकृत, जिह्वा लिप्त. नेक्स्ट. दृक् प्राकृत, शब्द स्पष्ट, स्पर्श उष्ण, आकृति मध्यम. लोकल एग्जामिनेशन. ऑन एग्जामिनेशन, lesion are reddish in color, maculopapular in nature, irregular shape, no discharge. Size varies from 1 centimeter to 6 centimeter. Next. Treatment. Avipattikar churna 3 gram twice a day, half hour before meal with Koshna Jala for Dipan Pachan Rechan. After getting Niram Lakshana, observe Prakrut Mala Pravrutti, Shuddha Pravrutti, Sharir Laguta. Then Sarvanga Abhyanga, Sarshap Tela followed by Bashpasveda. Very next day, Sadhyo Vamana with Lavan Jala, which is Pittanta, and 4 to 5 weeks. Observe reduce itching and burning sensation and lightness in body. Next. Shamana, Shaman Chikitsa, Kam Dudhavati, 2 tablets of 250 mg twice a day before meal with Koshna Jala. Lagusip Chekhar Vati, 2 tablets of 250 mg twice a day before meal with Koshna Jala. Haridra Khanda Churna, 5 gram at bedtime with Godugdha. And for local application, Narikel Taila with Bhimseni Kapoor and Shuddha Gairik Churna. The patient was very happy with the result he got from Ayurvedic treatment in a short duration of time. Since 1 year, his parents visited many allopathic clinics for him with no significant relief. As reported by the patient, he is asymptomatic since last 1 year after treatment. Next. Thank you.
Thank you, Dr. Aishwarya. Thank you for the wonderful session.
Okay, thank you.
Next, I would like to invite Dr. Vaibhav Subhash for the poster presentation. Dr. Vaibhav, are you there? Dr. Vaibhav, are you there? Next, I would like to invite Dr. Manju Yadav for the paper and poster presentation. Dr. Manju Yadav, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Good evening, one and all present over here. My name is Dr. Manju Yadav, PG scholar from the Department of Kaya Chikitsa. Title of today's presentation is An Effective Ayurvedic Approach to Prameya, a Case Report, under the guidance of Dr. Gunvanti Yola. Prameya is a Santarpan Janya Vyadhi, which literally means increase in the quantity of urine with turbidity in it, complete aversion towards physical exercise, excessive sleeping during day and night, sedentary lifestyles are causative factors for Prameya. According to Ayurveda, Prameya is a Tridoshaj Vyadhi and is among a group of urinary disorders in which there is an increase in frequency of micturition and output. Coming to the case study, a 50-year-old married male patient visited for consultation in Kaya Chikitsa OPD of our institute with complaints of Ati Sweda Pravritti, Nakta Mutrata, Alasya, Shuddha Ati Vriddhi, Trishna, Padatal Daha. No history of DM or STN or any major illness were noted. Hetu, Kafakar Ahar Sevan, Madhur and Snigdh Ahar, stale food, curds, use of white sugar, sedentary lifestyle. Here are the clinical findings that were observed on his first visit with the symptoms, gradation, and duration. Gradation given to the Shuddha Ati Sweda Pravritti, Shuddha Ati Vriddhi, and Padatal Daha were +2. Trishna and Alasya were +1. Nakta Mutrata was 5 to 6 times. Clinical examination done on the patient are as follows. Ashtavid Pariksha, Nadi 78 per minute, Mal was Bad, Jiva was Sam, and others were normal. Dashvid Pariksha, Prakriti of the patient was Vata Kapaj, Sar Samhanan and Sattva were heen, and others rest were normal. The patient was assessed on the subjective and objective parameters. Subjective parameters were Ati Sweda Pravritti, Nakta Mutrata, Alasya, Shuddha Ati Vriddhi, Trishna, and Padatal Daha. Objective parameters were fasting and postprandial blood sugar levels before and after 23 days of treatment regimen. Here is the Shaman Chikitsa that was given to the patient. Decoction of Vijay Saradi Kadha, each 4 gram of Vijay Sar, Misha Shringi, Haridra, Daru Haridra, Tripla, Musta, and Karvelak was given 40 ml twice a day at 7 a.m. and 7 p.m. on empty stomach. Chandraprabhavati 250 mg 2 tab twice a day at 7 a.m. and 7 p.m. before food was given with lukewarm water. Gandharv Haritki 250 mg 2 tablet once at night at bedtime was given with lukewarm water for the duration of 23 days. Here are the drugs and their mode of action. Vijay Sar regulates insulin production and prevents overeating, regenerates insulin-producing cells. Misha Shringi is Meduhar and Kapashamak. Haridra is Shothar and Deepan. Daru Haridra is anti-diabetic agent and has antioxidant and anti-inflammatory properties. Tripla shows anti-hyperglycemic and Rasayan effect. Musta plays important role in hyperlipidemia and has hypoglycemic action. Karvelak is Medhar, helps to treat hyperlipidemia and preservation of islet beta cells and their function. Chandraprabhavati improves blood sugar levels, decreases frequency of urination, and helps in improving metabolism. Sarakpati acts as laxative. Here are the observations. Ati Sweda Pravritti was reduced on 23rd day from +2 to +1. Naktamutrata was mild at 23rd day. Alasya that was +1 on day 0 was reduced to 0 at 23rd day. Shuddha Ativriddhi Padatalda, which was +2 on day 0, was reduced to 0 at 23rd day. Trishna was +1, which reduced to 0 at day 60. Results of objective parameters. Fasting blood sugar, which was 384 at day 0, was reduced to 112 mg per dl at 23rd day. Postprandial blood sugar, which was 544 at day 0, was reduced to 279 at 23rd day. Here are the lab reports of the patient. Coming to the discussion, plants have always been an important source for finding new remedies for human diseases. Therefore, it seems that physician can rely on single drug as well as formulation to manage patient with Pramehi Rog. Amapachak Kafhar Deepan effect of Aushadhi Kalp shows good result in both subjective and objective parameters of Pramehi without any complication and side effects. Conclusion. The observed result may be helpful in planning further scientific studies about the efficacy of these drugs on prevention as well as management of Pramehi. On the basis of this case study, we can consider this approach for further treatment and research work of Pramehi. Thank you.
Thank you, Doctor. Next is a poster presentation.
Yes, sir. Topic of today's poster presentation is decoding the treatment principles of Gridhrasi. Starting with the introduction, Gridhrasi is derived from the Sanskrit word grid, that means vulture. In this disease, the gait of the person resembles to that of a vulture. Aim is to study the literary review of treatment principles of Gridhrasi according to various acharyas. Material and methods. A thorough review of Brihatrai, Lagutrai, and article has been done. So I'll now be discussing the Shodhan Chikitsa according to various acharyas. Charak Samhita mentioned Niruh Vasti, Anuvasan Vasti, Siravedan and Agnikarn, whereas Acharya Sushruta mentioned Siravedan 4 angul above and below Janusandhi. Coming to Ashtang Hriday, Anuvasan, Siravedan, Agnikarn was mentioned for Gridhrasi. Further on, Vangasen has mentioned all the treatment protocols. Chakradat excluded Niruh Vasti for the treatment of Gridhrasi. Going forward to the Shaman Chikitsa, Acharya Sushruta mentioned Nidan Parivarjan, that is to avoid the causative factors of the disease. Second is Deepan Pachan. Aushadhis like Sudshekar Ras, Lagu Sudshekar, Agni Tundi Vati, Chitrakadi Vati, Praval Panchamrit can be given for Deepan and Pachan. Talking about Vat Shamak Aushadhi, Quat like Rasna Sapta Quat, Dashmuladi Rasna Quat, Shefali Patra Quat can be given to the patient. Abhyanta Snehan with Erentil can be done for Vat Shaman. Going to the discussion, Gridhrasi is Vat Nanatmach Vyadhi. It involves Shaman Chikitsa, which aims to balance the body's dosha. In cases of severe dosha accumulation, Shodhan therapies are recommended to detoxify the body. Dietary recommendation emphasizes warm, easily digestible foods to pacify Vat and Kapha dosha. Concluding everything, Gridhrasi is a debilitating condition that disrupts a person's ability to sit and walk comfortably, significantly impacting their daily routines. With the help of Ayurvedic principles, one can effectively manage the disease. Furthermore, it also prevents recurrence by addressing the root. Thank you.
Thank you, Dr. Manju Yadav. Thank you for the wonderful paper and poster presentation. Next, I would like to invite Dr. Dule Prajakta for the paper presentation on the topic Arogyavardhani.
Namaste. My name is Dr. Prajakta Dhure, first year PG scholar, Department of Rashashastra and Vaisheshya Kalpana, presenting my paper presentation under the guidance of Dr. Rajeshwari Kamath, Professor, PG, Department of Rashashastra and Vaisheshya Kalpana. Today, my topic is a formulation called as Arogya Vardhini. These are my contents. Introduction. Arogya Vardhini is a potent herbo-mineral formulation told in the context of Visarpa Rogadikara and Rogadikar and Yakrut Rogadikar. It is formulated by 13 drugs. In the six are the rasadravyas and remaining are the herbal drugs. As Rasavagbata mentioned that it cures all the diseases and increases the health of the patient. So, because of this, it is called as Arogya Vardhini Vati. This formulation is formulated by Siddha Nagarjuna. References. The first reference is mentioned in Rasaratna Samuchaya contest under the Visarpa Chikitsa Adhyaya, and second is Vaisheshya Ratnavali in the context of Yakrut Rogatikar. AFI Part 1 Rasa Preparations. Rasaratna Samuchaya Shlok goes with Rasagandha Loha Shubhra Bhasma Samakanjam Trifala Dviguna Yojya Triguna tu Shilajatu Chaturguna Paramshuddha Chitrak Mula Tatasmam Tikta Sarva Samaneya Sarva Sanchurna Tannatam Nimba Vruksha Dadhablo Mardaya Dvinavadi Tatasya Vatika Karya Rajakola Falopamam Mandala Sevita Sauchahanti Kustanmaya Sheshatam Vatapitta Kafa Udbala Jwaranna Prakasharajana Deya Panchadine Jate Jware Rogyavati Shubha Pachani Deepani Pathya Rudo Medo Vinashini Malashuddhikara Nitya Dudharda Shutta Pravartini Bahunatra Ki Muktena Sarve Rogeshu Shashyate Arogyavardhini Namagutika Prakirtita Sarvaroga Prasheni Prashamani Sri Nagarjuna Yoginam. These are the ingredients: Shuddha Parad, Gandhak, Abrak Bhasma, Loha Bhasma, Tamra Bhasma, Trifala, Shuddha Shilajatu, Chitrak Mula, Gugula, Nimbapatra Swarasa, and Katuki. These are the Rasapanchaka of ingredients. Rasapanchaka of the formulation goes with Rasam, Katu, Tikta Kashaya, Guna, Laghu, Ruksha, Virya, Ushna, Vipaka, Katu, Doshagnata, Kafapitta Hara, Karma, Kushtagna, Deepan, Pachan, Jwaragna, Medohar, Bhedana, etc. Pharmacological action of the drug Parad goes with disinfectant, diuretic, Gandhak, antibacterial, antifungal, Abrak, hepatoprotector, Loha, antipyretic, Tamra, hepatoprotector, Trifala, hepatoprotector and cardioprotector, Shilajatu, antifungal, Chitramula, anti-hyperlipidemic, Gugulu, hyperlipidemic activities, Katuki, antipyretic, Nimbapatra, antifungal, antioxidant, antibacterial. These are the drug images. Purva Karma. All the genuine drugs were mentioned and taken weighted. Rasadravyas should be taken shodhita. Herbal drugs are made into fine powder separately. Bhavna Dravya, Nimbapatra is made into swaras. This is the Pradhan Karma. Shuddha Parak Gandhak is taken. Then from it is a Kajali made. Kajali, in it Abrak Bhasma, Tamra, Loha, Trifala, Shuddha Shila Jatu, Chitrak Mula, Shuddha Gugula, Katuki Churna has been added, and Nimbapatra Swaras Bhavna is given for 2 days. When it attains the Shubhavati Lakshana, and then it is made in Rajakol Pramanavati. Paschat Karma. The prepared vati are dried in shade, and after complete drying, it is stored in clean airtight container. Shelf life. According to Sharangdara Acharya and Yog Ratnakara, it is 1 year for vati. As per Drug and Cosmetic Act, it is 3 years. Dose. As per Rasaratna Samuchaya, it is 1 Rajakola, that is 6 gram. According to EFI, 250 to 500 mg. Anupana is Nimbaswaras Madhu. Indication: Kushta, for one mandal, that is 42 days, in Jwara after 5th day. Vat, Pitta, Kapha and other types of Jwara. Deepana, Pachana, Rudroga, Medohara, Malabandhata. Thank you.
Thank you, Dr. Dule Prajakta, for the remarkable presentation. Next, I would like to invite Dr. Rajani Angadi for the paper presentation. Dr. Rajani, are you there? Dr. Rajani, are you there? Dr. Rajani, are you there? Okay, next I invite Dr. B.S. Murthy for the paper presentation on the topic Adravyabhuta Chikitsa in Manasa Roga.
Namaste to all. Myself Dr. B.S. Murthy from the Department of Research and Biosciences, KLE Ayurvedic Mahavidyalaya, Belgavi. I have chosen the topic Adravya Bhuta, especially Mantra Chikitsa in Manasa Roga, guided by Dr. P.G. Chatterjee. These are the contents. Introduction. Adravya Bhuta or Mantra Chikitsa specially deals with non-dimensional things. Chikitsa includes all those treatments where no drug or pharmacological approach is involved. Means no. Dravya drug or pharmacological dependent. Chikitsa means treatment. So Dravya Chikitsa means non-drug or non-pharmacological treatments or therapy. Then look into the concept of health. According to Sushruta Samhita Sutrasthana, Samadosha Samagnisha Samadhatu Malakriya Prasannatmendriya Manaha Swastha Ityavidhiyate. The mind, spirit, body, spirit means Atma, together considered as a triad of life. Ayurveda defines the health as a balanced state of, that is Samadosha Samagnisha Samadhatu Malakriya Prasanna Atma Indriya Mana Swastha Ityavidhiyate. Concept of Mana. In Charaka Sutra Sthana, Manasastu Chintyam Artha Tatra Manaso Manobuddhescha Ta Eva Samana Atihina Mithya Yoga Prakriti Vikriti Hetavu Bhavanti Atindriyam Punarmana Sattva Samyakam Cheta. Second one, Chakshu Pashyati Rupani Manasa na cha Chakshusha Manasi Vyakule Chakshu Pashyannavi na Pashyati. This shloka took from Mahabharata Shanti Parva. So all these things may not happen without the presence of mana. Here they are telling importance of mana and Atma. Our ancient legend of health Ayurveda, which defines Ayu as the combined state of Sharira, Sharira, Indriya, Sattva, Atma. In this way, mana is very responsible for perceiving good healthy life. Relation between Sharira and Mansarupa. The body and mind have a separate set of ethiopathological agents, and hence all are categorized under two basic groups, that is somatic and psychological. Psych and soma are always interrelated. They interact and influence each other and manifest in a large group of disorders known as psychosomatic disorders. These are the classification of Mansaroga. Vija and Agantuja, we can classify that. And Nidana, following three factors are responsible for all physical and mental disease. We all know this: Prajna, Paradha, Parinama, Asatmendriyartha Samyoga. Look into the Samprapti of Mansarupa. The persons with high rajas and tamas are prone to get mental disturbances. Or the person with weak sattva and high rajas, the raja tamo guna, comes in contact with the nidana, then raja and tamo guna will be aggravated. Manovaha sroto vaigunyata will take place. Sthana samshaya in the hridaya. Why hridaya means is the place of buddhi. So this leads to recollection of negative memories, fearful memories, false perception, wrong analysis, irrelevant thinking, wrong judgment, wrong decisions, etc. This sequence of events it repeats leads to Manovaha Sroto Dusti, result into Manasa Roga. Coming to the important part, that is Chikitsa, Acharya Charaka explains three types of therapies of physical and mental disorders: Daiva Vipashraya, Yukti Vipashraya, Sattva Vijaya. Daiva Vipashraya and Sattva Vijaya comes under Adravibhuta Chikitsa. Yukti Vipashraya means Dravibhuta, that is physical therapy, Shamanaushti, Sodhana, etc. Daiva Vipashraya means spiritual therapy, Sattva Vijaya means mental therapy. So, Adravibhuta Chikitsa and mental disorders. Acharya Charaka has advised the below mentioned to be followed in the treatment of psychological therapy. Charaka Sutra Sthana. Manaso Jnana Vijnana Dhairya Smriti Samadhi. The cause-effect theory, that is Karya-Karana Siddhanta, behind effects of mantra chanting as per Ayurveda concerns the Hridaya, which is the base for mind. That is Manas. Its vitiation is responsible for the formation of Manas Vikara, and use of mantra is advised for treatment to purify the heart. As heart gets purified, the patient becomes normal. Importance of mantra chikitsa or derivation of mantra. Mantra is derived from man plus tra. Man is equal to mana. Just by thinking, and tra is release, we can protect ourselves. Means that just by thinking, one can save himself in the universe. That is, saved from the onset of disturbances. Mantras are the words loaded with power and sounds capable of penetrating our body into deep levels. Mantrocharana, a mantra, a word or sound repeated to aid concentration in meditation. Every mantra has 6 elements. There is Rishi, Raga, Devata, Bija, Shakti, Kilaka. In Ayurveda, apart from herbal remedies for diseases, an emphasis is laid on mantra recitation also to enhance the healing power. All over again, to understand the above subject in Ayurveda point of view, the knowledge about the concept of Pancha Mahabhuta is also very vital. For example, Akasha Mahabhuta is the space without which matter cannot exist. So its main sense attribute is Shabda. Shabda and non-resistance, that's apratighatatva, is its main property. It can be similar, something similar to space. Hence, the sound energies that have always existed in the universe, they cannot be created or destroyed and command the power to heal physically and spiritually. Together, many Shabda constitute a mantra, which is a repetition of group of Shabda or a specific energy field. Sound is the basic source of energy and motion existing in the universe. Mantra is the science of the subconscious as well as cosmic powers of sound. Here are some examples of mantra, that is Omkara. Everything in the universe is pulsating and vibrating. Nothing is really standing still. Om is said to be the original primordial tone of the universe, the original sound of creation. Many research articles, research works already done regarding Omkara or this Gayatri mantra. Gayatri mantra goes like this: Om Bhur Swaha Tatsavitarpareni Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat. It's interesting to note that Dr. Howard, an American scientist, has established that recitation of Gayatri Mantra produces a frequency of more than 20 kilohertz. The patterns of chanting of mantras are so designed that they latently contain the essence of the music, life-sustaining energies emanating from cosmic energy, center of the corresponding mantras. Then comes to Mahamrityunjaya mantra. Om Triambakam Mijamahe Sugandhim Pushtivardhanam Urvarukameva Bandhanat Mrityurmukshayamamritat. This is a mantra that bestows longevity and protection from death. It can help you overcome fear, grief, and suffering. It can also heal your physical and mental ailments and bring peace and harmony. Then again, last Shanti mantra. Om Sahana Bhavatu Sahano Bhunaktu Sahaviryam Karavavahe Tejasvinavadhitamastu Ma Vidvishavahe. Om Shanti Shanti Shanti. This is a mantra that invokes peace and harmony in oneself and the world. It can help you calm your emotions, reduce stress, and promote well-being. It can also foster positive relationships and cooperation among people. Then coming to how mantras will work. According to research, the combined effect of sound vibration on physical plane can be observed, especially on brain or on EEG, electroencephalogram. One can see the brainwave emission patterns affected with Omkara chanting or Gayatri mantra chanting. An alpha activity in brain can be seen during mantra chanting. The neuro-linguistic effect, that's NLE, possible even if the meaning of the mantra is not known. So hence knowing the meaning of every mantra is not compulsory. At the same time, if the meaning is known, it has got an additional effect which is known as neuro-linguistic plus psycholinguistic effect, PLE. The NLE and PLE effects are due to the production and spreading of curative chemicals in the brain. These curative chemicals give smoothing and curing effect in the body, probably first in psyche and ultimately in body, as both are interconnected. Different sounds have different effects on human psyche. Soft sound soothes nerves, the musical note and enchants heart, but the sound of thunders may cause fear. Even chanting the kirtanas, melodious bhajanas, songs, etc. have the good effect almost similar to the NLE and PLE. Here are the primary types of brain waves, how they relate to altered states of consciousness. Beta waves, normal waking consciousness. Alpha waves, relaxed calm state. Theta waves, deep relaxation and meditation. Delta waves, deep sleep and healing. Gamma waves, heightened perception and consciousness. Additionally, some studies have explored the effects of chanting specific mantras on brainwave patterns. For instance, certain Sanskrit mantras are believed to have specific vibrational frequencies that may influence brainwave activity. First one, synchronization of brain hemisphere. We all know this left and right hemispheres of the brain, so which are responsible for different cognitive functions, may become more harmonized in their activity after chanting of mantra. Second one, hemisphere lateralization. Some studies have suggested that specific mantras may influence hemispheric lateralization, meaning they may promote greater activity in one hemisphere over the other. For example, certain mantras may enhance right brain activity, which is associated with creativity, intuition, and holistic thinking. Others may enhance the left brain activity, which is linked to logical thinking and analytical processes. Third one, increasing alpha brain waves. Mantra meditation has been shown to increase the alpha brainwaves, which are associated with relaxation, creativity, and positive mood. Alpha brainwaves also helps to synchronize the left and right hemispheres of the brain, which can enhance the cognitive functions. Then last one is changing brain structures. Studies have shown that meditation can lead to changes in the brain structure, such as increased gray matter density and cortical thickness. These changes can improve memory, attention, learning, and emotional regulation. So here comes levels of sound of mantras. The Vedas recognize 4 stages of the manifestation of sound. That is, Vaikhari is normal audible sound, including speech. Madhyama, a whispered sound with no audible effect. Pashyanti, mental sounds such as songs in the head or a dream. Also the silent repetition of a mantra. Para or transcendental sound, pre-manifest sound in its subtlest state as light or pure silence. This is the root or potential of all sounds. Vaikhari, Madhyama, Pashyanti, Para. And some mantras will ending with Anuswara, Makara. So this boosts the production of nitric oxide in the body. Why nitric oxide is an important regulator and mediator of numerous processes in the nervous, immune, and cardiovascular system. These include vascular smooth muscle relaxation, resulting in the atrial vasodilation and increasing the blood flow. These are the few research articles on positive effect of mantra in Manasa Roga. When listed few research articles, and these are the pictures of MRI brain after the effect of chanting of mantra. This is the results. A study on mantra meditation and its effects on stress and anxiety. They have quoted some articles. They have done a randomized control trial of 60 female patients with anxiety participants, very randomly assigned to a mantra meditation group, yoga nidra group, waitlist control group also they made. Conclusion: Mantras are Sanskrit words loaded with power and capable of penetrating the body into deep levels of consciousness by their unique sounds and the vibrations they create. The sacred utterances or chanting of Sanskrit mantras provide with the power to attain goals and lift from the ordinary to the higher levels of consciousness. They give the power to cure diseases. It is crystal clear that mantra therapy, which is mentioned in various places in classical Ayurveda texts, is one of very potent area of management of various mental as well as physical disorders. Mantra therapy is not a superstition, however, it is incredibly scientific and based on fundamental principles of Ayurveda. Hence, mantra is a divine instrument with the uncommon potential of arousing hidden consciousness. These are the references. Thank you.
Thank you, Dr. Gurumurthy. Thank you for the wonderful explanation. Before next presentation, as per the instruction from the panel side, once again, I will show you the slides explained by Dr. Gurumurthy. So the introduction slide explained by Dr. Gurumurthy, and these are the concept of health, the Samdosha Samaknishcha Samadada Malakriya, Prasannatmendriya Manasastiti Vidiyade. Sloga has been already explained. Then these are the concept of mana. And these are the relation between Sharira and Manasa Roga explained by Doctor. And these are the classification of Manasa Roga, that is the Nicha and Agantu. Then these are the Nidana of these are the Nidana, and these are the Samprapti of mental disorders. And these are the Chikitsa slide explained by Dr. Gurumurthy. And these are the Adrevibhuta Chikitsa in mental disorders. Then the Mantra Chikitsa already explained by Dr. Gurumurthy. And these are the some example of mantras. And these are the level of sound of mantras explained by Dr. Gurumurthy. And these are some pictures. These are the conclusion slide explained by Dr. Virumurthy. Thank you, doctor. Thank you so much. Thank you for the presentation. Next, I would like to invite Dr. Payal Isho Mandalkar for the paper presentation. Dr. Payal, are you there?
Yes.
Good evening, doctor.
Good evening. Sir, can you please share my screen?
Okay, doctor. Just a moment.
Hi.
Please start the session, doctor.
Good evening. This is Dr. Payal Mandhalkar, PG Scholar, Department of Stree Rog Prasuti Tantra, Yashwant Ayurvedic College, and Postgraduate and Training and Research Center, Kodoli. My topic for today is Contribution of Yonipichu Chikitsa. Definition of Yonipichu. Karpas Pichu Siddha Sneha Yuktam Apathe Garbhashaya Mukhaparyante Stapayate. Pichu Tailam Pichuna तूलकेन तैलः वातहर द्रव्य क्वातः सिद्ध योनिषु धारयेत्. शुश्रूषयिता उत्तर स्थान 37-20 दलहन टिक्का. Mode of procedure: placing a tampon soaked in medical oil or ghee. Instruments required: examination table with leg rest, good light source, pair of gloves, cotton swab, gauze, sponge holding forceps. Materials required: vaginal tampon made of cotton and gauze, Taylor Grutha or Quath. Indication: gynecological indications, first degree and second degree uterine prolapse, cystocele, that is bladder prolapse, rectocele, that is rectum prolapse, postmenstrual vaginal dryness, dyspareunia, that is painful coitus, obstetrical indications in 9 months of pregnancy, in threatened abortion. Contraindications in CA cervix, in unmarried patients, presence of active pelvic or vaginal infections, presence of heavy vaginal bleeding, in vesico-vaginal fistula, in viral and bacterial genital infections. Time of administration: after total cessation of menstrual bleeding from day 5 to day 10 of menses. Duration of treatment is 7 days. Duration of tampon to be kept 2 hours or up to the next urge of micturition. Shapes of tampon: circular 1 inch length and breadth, elongated 1 finger breadth and 4 fingers long. Site of placing of tampon: at the site of cervix, elongated placing of tampon, cervix, circular placing of tampon. Preparation of tampon: tampon is made up of cotton swab which is wrapped with gauze piece and tied. Prerequisites of procedure protocol: informed written consent, autoclave tampon, and the media, oil, grit, or quath should be used. Patient should be asked to evacuate the bladder completely. Patient should be given lithotomy position. Routine gynecological, per speculum, and per vaginal examination should be done. Before procedure, vaginal pH should be measured. Patient is advised for abstinence during treatment. Main procedure protocol: the sterile tampon soaked in medicated media, that is oil, gruth, or quath, is inserted into the vagina with index finger, and the thread of the tampon is kept out for easy removal. Post-procedure protocol: patient lies on bed in the supine position for 10 minutes. After total completion of procedure, vaginal pH is measured again. Patient is advised for abstinence after procedure. Mode of action: the Tail, Grutha, or Kashai are the vehicles through which the action of drugs takes place. The medication remains for a long time in the vagina. This facilitates easy and better absorption of sneha, as lipid-soluble media easily diffuses across the cervical epithelium. It moistens and softens dry vagina like in postmenopausal state. The drugs used have antimicrobial properties and cleansing properties, thus arrest discharges. The medication restores the pH of vagina and maintains vaginal flora. Yoni Pichu used in 9 months of pregnancy facilitates effacement and dilation of cervix for the natural labor. Complications: pain, burning sensation, vulvovaginal itching, ulceration or excoriation, abnormal discharge, infection. Expectant management: if the above complication occurs, Yoni Dhawan with Rifilacquat is suggested. Thank you.
Thank you, Dr. Payal. Thank you for the remarkable presentation.
Thank you.
Presentation. Next, I would like to invite Dr. Jyoti Lekran for the paper presentation. Dr. Jyoti, are you there? Dr. Jyoti Lekran, are you there? Next, I invite Dr. Shubham Gajanan Yadav for the paper presentation on the topic Padya. Dr. Shubham Gajanan, are you there? Dr. Shubham Yadav, are you there? Dr. Shubham Gajanan Yadav, are you there? Next, I invite Dr. Eshraj Yugmandar Doshi for the paper presentation.
Hello. Hello.
Hello, Dr. Shubham.
Yes, sir.
Good evening, doctor.
Good evening, sir.
Please share the screen, doctor.
Yes, sir. Good evening, everyone. Good evening, everyone. Myself, Dr. Shubham Yadav, from the Department of Kaya Chikitsa, from Dr. D.Y. Patil Ayurveda and Research Center, Pimpri, Pune. The topic of my presentation is Patthapatya. As we all know, in order to clear. Hello.
You are audible, doctor. Please continue. Hello, Dr. Shubham. Hello, Dr. Shubham Yadav. Can you hear me? Please unmute, doctor. We can't hear your voice. Dr. Shubham Yadav, can you hear me? Doctor, please unmute, doctor. We can't hear your voice, doctor. Dr. Shubham Yadav, can you hear me, doctor? Hello, Dr. Shubham Yadav, can you hear me? Okay, next I would like to invite Dr. Eshraj Doshi for the paper presentation on the topic Pathophysiology of Amavada in Ayurveda.
ऐसे यशराज दोषी फर्स्ट ईयर पीजी स्कॉलर डिपार्टमेंट ऑफ पंचकर्म कायस श्री BMK कंकणवाडी आयुर्वेद महाविद्यालय बेलगावी. My paper presentation under the guidance of the Dr. Rajshekar V. Sanpeti sir, Professor and HOD Department of Panchakarma Kaya Sri BMK Kankanwadi Ayurved Mahavidyalaya Belgavi Karnataka. My top paper presentation topic is pathophysiology of Amvat in Ayurveda. Introduction. Amvat is produced due to the Ama invitation of the Vat dosha. Madhavakara was the first to describe the picture of Amvat in Madhav Nidan. It is a disease of Astiva and Rasavasotas. Amvat is a disease of Madhyam Marga, and it is said to be a creature Sadhya or Yapya, and the arm is carried by aggravated Vata and deposited in Shleshmasthana, producing the feature like Angamarda, Ruchi, Alasya, and Sandishota. Two and Vat are predominant pathogenic factor, but disease represents a tridoshic mutation. The affliction of the sandhis by Vata dosha in association with Am reflects the equal role of both dosha and dosha in causation of disease. What described in Ayurvedic classic is similar to the rheumatoid arthritis. Various means RA is a chronic inflammatory disease with multi-system involvement, and it has been more common and resisting among the all joint problems. About 0.8% of the world population is affected by the RA. Females are 3 times more affected than males. Infection causes a genetic predisposition, and the autoimmune response are all the factors that contribute to the rheumatoid arthritis. Initiates incidence onset with tiredness, anorexia, and weakness, as well as abrupt onset with fast development of polyarthritis, and symptoms such as a fever, splenomegaly, lymphadenopathy with the involvement of the joints is generally symmetrical. Modern medicine relies on demand steroids and NSAIDs, which provides only short relief. And Nidan. Various acharyas mentioned the different views on production of the Amin Amwat. Separate Nidan according to the Madhukara is mentioned. Viruddhahara, Viruddha Chesta, Mandagni, Nichala, Snigdhahara followed by immediate exercise. Formation of Amwat. Ama. And Nidana Sevana. दोष प्रकोप अग्निमांद्य धात्वाग्नि दौर्बल्य रस धातु दृष्टि and production of amwat. Samprapti of amwat. Sanjaya, due to the Viruddhahara, Snigdhahara, Guruahara, Vihara, Divaswapa, Nichalat, Mansik, Chinta, Shoka, Bhaya, Krodha, then Prokop of Agnimandya, then production of Amvisha, then production of Samvata, they go to the Sleshmasthana, Dhamni, Tridosh, and Rasavastrotas, Dorbalya of Sandhi, Shota, and Shula, and then production of then produce the Amvat. Then Sandhi, Stabdata, and Trikasandhi Pravesha. Trikasandhi Pravesha, Sandhi, Stabdata, and production of Amvat. Samprapti Ghataka, Dosha, Tridosh, धातु रस मांस अस्थि मज्जा उपधातु स्नायु कंडरा स्रोतस अन्नव रसव अस्ति व मज्जवा स्रोत दृष्टि संग विमाग गमन उद्भवस्थान आमस्य ची प्रोडक्शन ऑफ आम एंड पक्वाशय मूल स्थान ऑफ वात व्यक्त स्थान होल बॉडी रोग मार्ग मध्यम रोग मार्ग अव्यय संधि एंड व्याधि संभव मेनली इन चिरकारी स्टेजेस ऑफ आमवात एंड इट्स सिम्टम्स नव आमवात अरुचि आलस्य गौरव ज्वर रिल्लास अपक्ति प्रवृद्ध आमवात इन्वॉल्वमेंट ऑफ हस्तपाद शिरो गुल्प त्रिक जानुसंधि शोथ स्तब्धता रुचिकोत वेदना प्रसेक अरुचि हृदय गौरव हृदग्रह छर्दी भ्रम मूर्छा अनाम जीर्णामवात डिस्ट्रक्शन ऑफ आर्टिकुलर कार्टिलेज ऑस्टियोपोरोसिस डिफॉर्मिटीज एंड पॉलीआर्थराइटिस चिकित्सा संप्राप्ति विघटनमेव चिकित्सा आचार्य चक्रपाणि was the first acharya who described the basic principles of the line of treatment of amvata langanam swedanam tikta katu deepanam virechanam snehapanam bhakti treatment and their reasons. Langan upvasa, a first line of treatment of amashyastyavadi and research vikara. Upvas will be stop the production of am and helps the digestion of the am. Along with upvas, the use of drugs having the langana properties and beneficial for the pachana of am and correct the mandagni. Swedana ruksha swed like valuka swed is beneficial because the ushna gun that does the pachana of the am and also dilate the channels. Tikta katu deepana tikta dravyas are the am and pitta pachak and Struttomukha Vishuddhana. Virechana after the doshas comes in Niram stage, Virechana removes the Kledaka from the Pitta Sthana. Erantail is the drug of choice because it removes the Avaran of Vat by Kapha and Medha Rakta and Pitta. It is the best Vrisha and Vatahara drug. Snapana in Nilam stage Shamana and Brahmana type of snake is indicated Basti as the disease attends the chronicity Vata because more Pravritta Basti eliminate the dosh which are brought to the coastal. Chakrapani recommended Sandhavadi Telanvasan Basti and Kshar Vaitaran Basti for Astapana. Conclusion: what occurs in all over the world in all races, gender, age, and all climates. Which is an important factor for the pathogenesis of most of the disease. What occurred by the combination of the and Prokopita Vata dosha due to the Nidan Sevan and Agnimandya. The stages of mutation of and aggravation of what should be properly analyzed. We should know the presence of absence of before commencing the treatment because in Sam and Niram Avastha line of treatment is totally different. Thank you.
Thank you, Dr. Ashraf Doshi. Thank you for the wonderful presentation. Next, I invite Dr. Vaishali Jain for the paper and poster presentation. Dr. Vaishali, are you there? Dr. Vaishali Jain, are you there? Dr. Vaishali Jain, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir.
Please share the screen, doctor.
Good evening, everyone. Myself, Dr. Vaishali. My topic is Marma, a bone in Ayurveda. I've said the beautiful science of Ayurveda has a rich heritage of literature. The knowledge of Marma is inseparable part of Ayurvedic thinking and treatment. Marma science can be explained as way to stimulate the vital points of the body to enhance the panic energy. It can be defined as the techniques to stimulate the specific vital points of the body in a certain way that at a critical moment of a time for a purpose of healing. They help in removing blockages at mental level and combat the negative emotions. One stimulate provides healing through power of therapeutic touch. The vital force of the physician in the vital energy of the sufferer. Man Chikitsa is a very important tool to Introduction. Merm is defined as an anatomical site where the muscles, vein, ligaments, bone, and joints meet together. There are 107 mermas, out of which 11 are present in each limb, 26 in trunk, and 37 in head and neck region. There are also sites where not only tridos are present, but there's still forms of prana, ojas, and tejas are also present in a sattva, raja, tama. Bhagavad defined that marm is the meeting point of marmas, asti, sira, snayu, dhamni, and sandhi. And it is also where the prana is present. Bhagavad also states the marmas is a place where the unusual pulsations can be felt and where there is a tenderness no on applied pressures. Should define marmas as the collection or point of meeting of above the mentioned dhatus expect dhamni. Marma points are specific areas on the body which has a relation through pranic channels to various internal organs. Dosa and Srotas. These points are being used during Abhyang along with the application of different kind of medicated and aromatic oils to stimulate the internal organs. Stimulating marma points by applying pressure in the management of disease is called marma chikitsa, and it's an inherent power of human to heal itself by stimulating these points. Number and nomenclatures. Total 107 months are expected, universal by Ayurvedic physician by Innaras. Sushru Samhita described these 107 marma in details and same is followed by Ashtang Sangrah and Ashtang Hridaya. Charak Samhita has given prime importance of three major marma and includes these pranatma. These three marmas are Hridaya, Basti and Sira. Classification of marma according to location. Srogat marma 37, Coastgat marma 26, and Sakagat marma 44. According to composition, to different acharyas. Acharya Shushruta, Acharya Astangirda, and Astang Saranga. Method to stimulate the marm according to the location, marm, vulnerability, available time for therapy, anatomical, consisting of marm, etc. For an intense limbs and marmani are normal, stimulate, stimulated by pressure or massage, whereas the internal marm like to stimulate through Nasha Karma and Goda Karma stimulated by through Basti. This amount of pressure also varies more on muscular areas and less on vessels. Pressure application defines among the different marm stimulation. Example, Shirapa marm is pressed by thumb and Gulf marm is stimulated click method by using index fingers. Method of marmotherapy, pharmacological and non-pharmacological. Pharmacological, abhyang, udvartan, and aromatherapy and local application. First, lepa, parishek, and dhara. Non-pharmacological, mardan, energy healing, and marmovedan. Doshas. Site of Vata dosa also have many major marma associated with them. According to Sushruta, every 5 types of Vata, some marma associated with them. Subtypes Prana, Udana, Samana, Vyana, Apana. Pitta dosha, subtypes are Pachak, Ranjak, Shadak, Alochak, and Bhrajak. Kapha dosha, subtypes are Kledak, Avlambak, Bodak, Tarpak, and Sleshmak. How does Marma Chikitsa work? Marma Chikitsa help in removing the mental blockage, living the negative emotions, and relax the body and mind. It helps in increasing the self belief amazingly and enhance the healing process. It directly affects the nervous system and influence the psyche of the aligned person. Proper stimulation of Marma points help in keep check to stress level and stimulation maintaining the optional functional HP axis as well as controlling the cortisol level of the body. Some are especially helpful in regulating HPA axis like Adipati, Apang, and Sandhi. Conclusion. Marm are vital point centers of the marm of the prana. They are can be used specifically for the diagnosis and treatment of disease or general for promoting health and longevity. Human body when exposed to trauma show various signs and symptoms depending on severity and types of trauma. Acharya Sushrut mentioned 107 deep or superficial point of on surface when we get a traumatized procedure, various signs and symptoms, not only the basic of type of injury, but on the basis of its constant or our physics comprise of vessels, muscles, bones, joints, nerves, ligaments, etc. Everywhere is more or less proportion. According to Acharya Shushruta, the point where all the above structures meet and its site of prana is nothing but marm agni Soma Bayu are basics of components of Marma Ayurveda emphasized anatomical knowledge as part of the diagnosis and treatment. Thank you.
Thank you, Dr. Vaishali. Next
Okay,
is
sir.
the presentation.
Okay, sir.
नंतर काहीतरी चुका 4 वेळेस चुका काढल्या नंतर मग
Topic is PCOD and PCOS. What is PCOS and PCOD? Some women can get pregnant the very first time they try. For others, it can be more difficult. Ovarian disorders like PCOS and PCOD are one of the most common reason for women to be unable to have children. The the good news is that yoga for PCOS and PCOD can help manage these conditions and improve infertility. Yoga poses. Nakasan. This asana strengthens at the abdominal muscles, regulate blood sugar level, and eases stress. Lie on your back with arms your side and feet together. Stretch your finger and towards two toes. In exhale while lifting your chest and feet on off ground. Malasan. Malasan helps deals with irregular periods and digestions. Squat with your feet together and heel on the floor. Separate the things as wide as possible and lean forward while exhaling. Press the elbows towards the inner side of the knees and bring the palms together in a stimulation mudras. Pavan Muktasan. Pavan Muktasan is a good for the digestion system and help release gas trapped in the digestive system. Start this asana by lying flat on the ground. Raise your legs vertically while inhaling slowly. Bend both knees and lower your legs so that the things rest against in the abdomen. In circular the things uh, the knees with both arms and bend your wine Brahmari. This pregnancy yoga asana is reduce the blood pressure, calms to mind, and offers a relief from the headache and helps to deal with hypertension. Sit straight with your eyes closed and ear blocked by your index finger. Take a deep breath and press the cartilage on your ear while breathing out and making humming sound. Ketubanas. This asana is in menstrual difficulties and stimulate the abdominal organs while also reducing stress, anxiety, depression. Lie flat on back and bending your knees with both feet on ground and close to your buttocks possible. Yoni Mudra. Yoni Mudra. The Yoni Mudra is one of the most popular form of the perinatal yoga. It calms the mind and stress the nervous system and relieve the mental anxiety. To practice this asana, sit comfortably and press the tips of your thumb and index finger together while pointing downwards. Interlace the other finger while focusing on your breath. Take a deep breath and stay this position for at least 5 minutes or more. Dhanurasana. This asana is to stimulate the ovaries and strengthens the abdominal muscle. It also relieves the stress and menstrual discomfort. Start by laying on your stomach with arms by the side of your body and feet wide apart. Bend your knees and grab your ankle while looking straight ahead. Stay relaxed while breathing deep. Butterfly pose. This asana is a stretch the inner things and knees, eases fatigue and offers relief from the menstrual and menopausal symptoms. Sit straight with your legs separate out of in front of you. Bend your knees and bring your feet together forward. Your pelvis width and soles touch each other. Hold your feet and pull them closer. Breathe in and out while flapping your legs and up down if possible. Thank you.
Thank you, Dr. Vaishali Jain. Thank you for the incredible paper and poster presentation. Thank you so much.
Thank you, sir.
Next, I would like to invite Dr. Samadha Ramdas Samaskar for the paper presentation. Dr. Samadha, are you there?
Yes, yes.
Good evening, doctor.
Good evening. Let me share my PPT.
Sure, doctor.
Share. Slideshow.
Your screen is visible, doctor. Please start the session.
Yes.
Good evening, everyone. Myself, Dr. Samta. I'm presenting here a case study of effect of Kanchana Gugur on Vatasthila with special reference to benign prostatic hyperplasia. So this is a normal prostate gland, and this is the enlarged prostate gland in which you can see the urethra is compressed due to the enlarged prostatic lobes. So aim is to study the effect of Kanchana Gugur in the management of Vatasthila, that is benign prostatic hyperplasia. Objectives. The primary objective is to study the role of Kanchana Gugur in the remission of symptoms, that is obstructive and irritative, in BPH with special reference to IPSS scoring system. And the secondary objective is to study the effect on outflow obstruction by means of uroflowmetry before and after the treatment. So introduction, as you all know, benign prostatic hyperplasia. In this disease, there is enlargement of prostate gland due to the obstruction, and due to that obstruction or due to the enlargement, there is obstruction of urethra, and which causes symptoms that is obstructive and irritative symptoms. So the obstructive symptoms and irritative symptom both includes dribbling micturition, hesitancy, weak urine stream, urgency, frequency, incomplete voiding, and nocturia. All this. So the disease BPH can be managed conservatively or surgical. Management is also there. So in the medical management, we can use alpha blockers and all. But when there is severe BPH, so for that severe BPH, you can go for surgery like transurethral resection of prostate and prostatectomy and all. But as you all know, the benign prostatic hyperplasia, it is a senile disease. It is found only in old aged persons. Always, many times you can see the patients are not fit for surgery due to various reasons. Someone having uncontrolled diabetes, hypertensive, or any other issues like bronchial asthma and all. So the surgery is not fit. Patient is not fit for surgery always. So there may be complications always. So considering these all complications and recurrences and TURP and any surgery, that is not cost effective at all. So regarding the cost of surgery and other complications, it is the need of surgery to evaluate an alternative option for this senile disease. So in Sushruta Samhita, Uttar Tantra, there is the reference of Vatasthila. So the urinary symptoms and urinary disease, these are characterized into two diseases, that is Mutraghat and Mutrakrutsha. So Shakrun Margasya Bastisya Vayur Antaram Ashrita Ashtilavat Ghanam Granthi. So the reference Sushrut Uttar Tantra, he has given that Ashtilavat Ghanam Granthi Karoti Achalam Unnatam. So this is the Vatasthila. So in benign prostatic hyperplasia, it is considered it is called as Vatasthila in Ayurveda. So it ultimately results into chronic retention of urine and distension of abdomen. So these symptoms of Vatasthila are likely to the lower urinary tract symptoms that is caused by benign prostatic hyperplasia. So the assessment criteria for my study is subjective criteria is IPSS scoring system, International Prostate Scoring System. So in this criteria, we can assess the there is questionnaire. 7 questions are there, which assess emptying, frequency, intermittency, urgency, weak stream, and straining with gradation of 0 to 35. You can see 7 is the up to 7 there is mild score, up to 19 there is moderate score, and after 20 there is severe score. And the objective criteria is to assess the urine flow rate, which is measured by uroflowmetry. So this is the case report. In this case report, a male patient of 67 age who is having complaint of intermittency of micturition, frequency, urgency, weak stream of urine, nocturia since 6 months, and the patient is not having any comorbidity, not having any hypertension disease or diabetic mellitus or COX and any all, not also having any surgical history. So personal history, bowel habit was regular, but he was having dribbling micturition due to the prostatic gland hyperplasia, and he was also having weak stream of urine, and he was having disturbed sleep due to nocturia. Other conditions or systemic conditions are normal. So in the investigation, you can see the blood report is here. You can see it is almost okay. but USG prostate is was done. You can see there is mild prostatomegaly with median lobe indentation into the bladder base, and serum PSA was also found to be 1.18, and uroflowmetry was the voided volume was 81. You can see here, and treatment was planned as Kanchanargu good, 500 mg twice a day, before and after meal with Koshnachal for 30 days. So assessment criteria, you can see the IPSS scoring system. Before treatment, it was 9, and the score on the 15th day was 6, and after the treatment, that is on the 30 days, score was 13. You can see the score has reduced to from 9 to 3. And this is the objective criteria which was assessed by uroflowmetry. You can see before treatment, the voided volume was 81 ml, and after treatment, after 1 month, that is the voided volume was reduced and it is 58 ml. So my conclusion is, as I have told you, that Mutraghat is a group of obstructive uropathy disease. So Vatasthila, we can consider this. So in this study, conclusion are drawn on the basis of analysis of observations. That is, the result shows that Kanchana Gugul is more effective in reducing symptoms like incomplete evacuation, frequency, urgency, weak stream straining, and nocturia. So it improves the flow of urine, and by considering all the above elements, we can say that quality of life of patient can be improved with the help of Kanchana Gugul. Thank you.
Thank you, doctor. Thank you for providing such an interesting
Thank you, sir.
and
Thank you.
well-explained
Thank you.
presentation.
Thank you, sir.
Next, I would like to invite Dr. Piyush Pardekar for the presentation. Dr. Piyush Pardekar, are you there?
Can I share my PPT from the same link from
Sure,
Dr.
doctor. Sure.
Samta Semaskar?
Sure, doctor. Sure, doctor.
Okay, thank you, sir. And now where is the PPT? Okay, my PPT is shared, sir?
No, doctor, not visible.
Not visible.
Now it's visible, doctor.
Okay, thank you, sir. So, title of my study is the HT Madhu Snehan Putpak in the management of the Shushkakshipak, which is correlated with the evaporative dry eye disease due to the meibomian gland dysfunction, a case report. The aim of the study is to study the effect of HT Madhu Snehan Putpak in the management of Shushkakshipak, evaporative dry eye disease due to the meibomian gland dysfunction. The objective of the study, aim and objective of the study is to study the effect of HT Madhu Snehan Putpak in the management of Shushkakshipak, that is the evaporative dry eye disease due to the MGD, that is the meibomian gland dysfunction. And secondary objective to prepare the HT Madhu Snehan Putpak. So, Shushkakshipak, as mentioned by the Shushrut in a Sarvagat Netra Rog, which is correlated with the dry eye disease, here Shushkakshipak can be correlated with the evaporative dry eye disease due to the meibomian gland dysfunction. And as you know, the dry eye disease is a multifactorial disease which is characterized by the loss of the homeostasis of the tear film and accompanied by the ocular symptoms in which the tear film instability and hyperosmolarity, ocular surface inflammation, and damage and the neurosensory abnormalities plays an etiological role. And we classify the dry eye disease into the three. First one is the aqueous deficient dry eye. Second one is the evaporative dry eye. And third one is the mixed dry eye. Now we consider here Shushkakshipak as a evaporative dry eye disease and specifically to the meibomian gland dysfunction. So the use of lipid supplement in the clinical study has been demonstrated to improve some signs and symptoms of the meibomian gland disease, perhaps by improving tear film stability. Acharya Shushruta indicates Snehan Putpak in the Shushkakshipak. Snehan Putpak is used to treat the Shushkakshipak regularly by the Ayurvedic practitioner, but the little data has been published. This case report aimed to prove the evidence regarding the therapeutic benefit and potential utility of St. Madhu Snehan Putpak in treating the evaporative dry eye caused by the meibomian gland dysfunction. So the Putpak is used as a tarpan. As we use the tarpan, likewise we have to use the Putpak. So material and method, here material which is prepared in Yashti Madhu Snehan Putpak, which is prepared in Rashastra and Bhaishajya Kalpana department of MGSC and RC Salad Wardha. It is a case study. So the assessment criteria we used here are the tear film breakup time. The gradations are mentioned here. Rose Bengal staining as per the Oxford scheme of scoring. Fluorescence staining, gradations are mentioned here. Meibomian gland expression, total central 8 glands are being considered here. Meibomian gland dropout, which is being examined by the meibography done by the autorefractometer, and the gradation being mentioned here. The case report, a female patient of age 37-year working as a government officer was complaining of burning sensation in the both eyes in the 2 year, transient blurring of vision 6 months, dryness and grittiness of both eyes in the 6 months. She having the history of computer used. So we used here the Yashti Madhu Snehan Putpak, where the Ajamajja, Ajavasa, Ajamans, and Yashti Madhu is being used. And the Putpak is prepared from all these drugs. The assessment criteria being evaluated before and after treatment. So the conclusion is conventional treatment like the artificial tear substitute contain benzalkonium chloride as a preservative. Long-term use of this preservative causes the ocular surface toxicity and is associated with the changes in the MGD. St. Madhu Snehan Putpak doesn't contain any preservative and hence can be used for the long duration. The total effect of the St. Madhu Snehan Putpak has provided considerably significant relief on the subjective as well as the objective parameter. The subjective complaints were relieved and highly significant in the range. Considering all about the element, we can say that patient quality of life can improve with the help of St. Madhu Snehan Putpak. Thank you. Thank you, sir.
Thank you, Dr. Piyush Pardekar. Thank you for the wonderful session. Thank you so much, Doctor.
Thank you, sir.
Next, I would like to invite Dr. Meghana Nambiur for the paper presentation on the topic cerebrovascular accidents.
Hello, my name is Dr. Meghana Nambiur. I'm a second-year PG scholar for Sri Jayendra Sastry Ayurveda College and Hospital. Today, I'll be doing my presentation on cerebrovascular accidents. So what is a cerebrovascular accident? A CVA, or a cerebrovascular accident, is an emergency medical condition characterized by an acute compromise of cerebral perfusion or vasculature, most commonly known as a stroke, and its second leading cause of death in the world and a major contributor to disability worldwide. It is most prevalent in developing countries. So there are symptoms of CVA, which is summarized in an acronym of DFAST. So B is for a lack of balance, E is for eyes which are blurred, doubled, or loss of vision in one or both eyes, F for facial droop, A for arms, which may have an arm drift, arm weakness, S for speech, where speech becomes slurred or unclear, and T means time to call emergency services. So CVA can be classified into ischemic and hemorrhagic. Ischemic stroke can be subclassified into transient ischemic attacks and ischemic stroke. Hemorrhagic strokes make up about 50% of all CVA, and they're intracerebral or subarachnoid. So a TIA, a transient ischemic attack, is a temporary episode of neurological dysfunction due to focal brain, spinal, or retinal ischemia without acute infarction or tissue injury. So it's indicative of an underlying pathological mechanism which can lead to future more serious infarctions in the future. It typically lasts under an hour and it most commonly occurs for mere minutes. but the risk of an actual infarction is highest in the 48 hours after a TIA. Whereas for a normal or your typical ischemic ischemic strokes occur when there's an obstruction in blood vessels leading to limited blood supply to the brain. There are over 100 implicated pathologies that can cause an ischemic stroke, but the three primary causes are large vessel disease, lacunar strokes, or cardioembolisms. Hemorrhagic strokes. Intracerebral hemorrhage is caused by the rupture of small arteries and is the second most prevalent type of CVA. It can be caused by hypertensive vasculopathy, CAA, coagulopathies, and other vasculopathies. It has two types, lobar and non-lobar. Non-lobar ICH happens in regions such as the basal ganglia, thalamus, cerebellum, and brainstem, whereas lobar ICH is more commonly associated with CAA. SAH, which means subarachnoid hemorrhage, are where there is a blood vessel rupture and blood fills the subarachnoid space, which drains into CSF and increases the intracranial pressure. Approximately 5% of all CVAs are subarachnoid hemorrhages. 85% of those are due to a ruptured aneurysm. Other causes are drug use, coagulopathies, a ruptured arteriovenous valve formation, and vessel rupture due to dural venous sinus thrombosis. So the pathophysiology of a ischemic stroke, we have causative factors, which cause insufficient blood flow to brain tissue. The central core tissues progress to irreversible damage, which is known as the area of infarction. There's imbalance in the production of ATP, diminished energy stores, which leads to ionic imbalances, electrical disturbances, and ischemia-related changes. Brain cell lysis and death occurs through necrosis or apoptosis, which leads to an ischemic stroke. In an intracerebral hemorrhage, you got the causative mechanisms, which lead to a formation of a hematoma and perihematomal edema. That increases the intracranial pressure, and the inflammation mechanisms begin. So the blood-brain barrier becomes disrupted, and leading to significant brain cell death, a lot of crush injury, which that makes up the intracerebral hemorrhage. Now, for a subarachnoid hemorrhage, it starts with a cerebral aneurysm rupturing, and the arterial blood is released in the subarachnoid space. The blood enters CSF, the intracranial pressure increases, and there's mass brain cell death due to lack of oxygenation and secondary injury. So what is the Ayurvedic understanding of this? So we start with Vata Vyadhi and the Vati Vyadhi Hetu. So Vata Vyadhi Hetu leads to Vata filling the channels of Rakta Srotas, leading to Rakta Dushti. And this leads to Srotavarodha or Dhatukshaya. So because of this, Vata Vyadhi therefore has two major runs, which is Dhatukshaya Janya and Avarana Janya. Dhatukshaya Janya can be correlated with vessel weakness because there is a Kshaya, Rakta Dhatu, the whole Sira and Dhamani are weakened, leading to intracerebral hemorrhages and subarachnoid hemorrhages. Whereas in Avana Janya Vyadhi, something is obstructing the movement of Vyanavayu. So that can be considered as a vessel obstruction, such as thrombus and embolus, which leads to an ischemic stroke. In Ayurveda, we see Dehe Srotapti Raktani Purayatva Anila Bali Karoti Vividhan Vyadin Sarva Anga Eka Anga Samshayan. So Prakopit Vayu fills a Rakta Srotas, and because of this, Vayu affects the whole body. This shows effect all over the body or even just one part of it. Hence, a stroke can be comparable with the genesis of a Vata Vyadhi that results in the manifestation of different outcomes, such as Pakshagat. Pakshagat is the primary consequence when it comes to CVAs and Vata Vyadhi, and it is a major Vata Vyadhi. So from an allopathic perspective, it's considered hemiparesis and hemiplegia. In Ayurveda, it's Hatvekam Martam Pakshan Dakshinam Balameva, Goya Cheshan Nivriti, Hirujam Vaksama Evacha, Palasankochiti Ekam, Hastatora Shulakrit, Grahitvaram Sharirasya, Sirasnaya Vishoshacha, Ekangarogam Tam Vidya, Kusarvangam Sarvadehaja. So Pakshagata is characterized by half the body, either right or left side, being affected by Vata, and it's associated with a derangement in consciousness, difficulty in speech, locking of half the body, wasting away of connective tissue, blood vessels, nerves, and muscle. One side of the body's hand and legs have great difficulty in moving, associated with pain and pricking sensations. So that can be comparable with hemiparesis and hemiplegia, which is there's a unilateral weakness or a unilateral loss of strength or paralysis on one side, whereas Ekangaroga is when one limb is affected, so that would be considered monoplegia, and Sarvangaroga is when all limbs of the body are affected, which would be comparable with quadriplegia. So the general analysis of Vata Vyadhi Samprapti is the stroke itself, whereas Pakshaghata could be compared to hemiparesis and hemiplegia, Ekangaroga is monoplegia, and Sarvangaroga is quadriplegia. In an allopathic line of treatment, first things first is generally controlling of BP since hypertension is a primary contributor to strokes. Airway breathing oxygenation, BP, temperature, glucose ranges have to be applied. In an ischemic stroke, you start fibrinolytics, antiplatelet, things like IV antiplace. Whereas in hemorrhages, you want to stop all anticoagulation therapies. And for subarachnoid hemorrhage, you want to do an immediate aneurysm clipping and stop the bleeding. Whereas in Ayurvedic line of treatment, we talk about snehapana, patya food, which is yusha, krishara, gramya mamsa, udaka, anupamamsa, sneha added to it, swadamna, lavana, ahara. And we talk about procedures such as basti, namanasya, tarpana karma, sweda such as nadi sweda, prasad sweda, shankara sweda, all done after abhyanga. And in Pakshaghata specifically, we say Swedanam Sneha Samyuktam Pakshaghati Virechanam. So Swedana, Sneha, and Virechana are all undertaken. Ayurvedic drugs which are generally given, internal medicines include Chittakadikrita, Siddhavasa, Nirgunditela, Nulakatela, and Swadamshraditela for internal intake, whereas external application we have Balatela, Dashamulavaja, Mahasneha, Nirgunditela, Mulakatela, Panchamuladitela, Yavakolatela, Sahacharaditela, Baladitela, Prasanitela. Nagya can be done on Bala Bilvagrita, Dashamulavaja, Siddhavasa, Prasanitelam, and Basti is generally done with Dashamulavaja, Sahacharaditela, or Balatela. So in conclusion, CVA or strokes are a medical emergency that leads to millions of deaths and is a major contributor to disability worldwide. There are many types of CVA with various consequences depending on the area of effect. Ayurveda describes the causative factors and mechanism of action that a stroke undertakes, as well as consequences such as Pakshaghata, Ekaroga, and Sarvangaroga, and there are a great many treatments elucidated in the Samhitas. These are my references. Thank you.
Thank you, Dr. Meghana Nambu. Thank you for the wonderful presentation. This is also a paper presentation. I would like to invite Dr. Vaishnavi G. Kulkarni for the paper presentation on the topic Abragabasma and its Rasayana effect.
Good evening, everyone. Myself, Dr. Vaishnavi G. Kulkarni, first year PG scholar from the Department of Rasan Evam Vajikarana from KLH BM Kankanwadi Ayurved Mahavidyalaya, Belgavi. Here to represent Abrakavasma and its Rasan effects under the guidance of Dr. Kashava VH, Professor, Department of Kaya Chikitsa, KLH BM Kankanwadi Ayurved Mahavidyalaya. Introduction. Abraka has got prime importance among the minerals and places it first in Maharasa Varga. It is considered as a main drug in many samskara of Parada. It is called as mica in English, and these belongs to sheet of silicate minerals. The word mica is derived from the micare, which means to glitter. Mica is a generic term applied to a group of complex aluminosilicate minerals having sheet or plate-like structures with different composition and properties. The references are Rasatarangini in the 10th chapter, Rasaratna Samuchaya 2nd chapter, Ayurveda Prakasha 2nd chapter, Rasendra Sara Sangha in the 1st chapter, and Rasa Prakasha Sudhakara in the 5th chapter. Historical origin. Devi Rajo Bhavet Gandho Dhatuhu Shukram Tata Abrakam. As origin of Gandhaka is considered as menstrual fluid of Devi Parvati, and likewise her Shukra is considered to be Abraka. Properties are Gauri Teja Paramamrutam Vatapikta Kafagnam Pragnabodhi Prashamati Ruja Vrushyam Ayusham Agram Balyam Snigdam Ruchi Akafam Deepanam Shitaviram Tatodhago Sakalaha Gadarudha Vyoma Sutendra Bandihi. The Graha Lakshanas are Snigdam Prutodaram Varna Sayuktam Bharato Adikam Sukha Nirmocha Patram Cha Tadadram Shastam Mitim. According to Rasatarangini, Nilanjana and Mahajwalam. The Vedas are Pinaka Nagamanduka Vajram Nitya Abrakam Matam Shvetadi Varna Bhedena Pratekam Tat Chaturvidam. Samskara of abrakas are as Shodhana, Dhana abraka, Marana, Sattva-patana, Lohitikarana, and Amrutikarana. Coming to the Shodhana, Prataptam Saptavarani, Nikshiptam Kanchika Abrakam, Nirdosham Jayate Nunam, Prakshiptam Vapi Gojale, Tripalakwatite Chapi Gavam Dugde Visheshitam. The thin sheets of Krishna Abrakar are held carefully by Samdamsha Yantra and the heated red hot over glowing charcoal and dipped in any of the following liquids like Kanji, Gomutra, Tripalakwata, Godugda. The process of heating and dipping is repeated for 7 times to obtain Shuddha Abraka. Dhana Abraka Nirmana. So it is the one of the different type of samskara where Shuddha Abraka 1 part and Shali of 1/4 part is taken with husks which are intact and are taken. Both these are firmly tied and made up totally in a jute cloth and soaked in kanji for 3 nights. And later it is rubbed vigorously. By doing so, because of the friction between the pointed ends of Shali and Abraka breaks into small uniform pieces. The Marana is Dhana Abraka is taken in Kalba Yantra and triturated with Kasamada Swarasya. Later, chakrikas are prepared and dried in sun. Dried chakrikas are enclosed in Sharava Samputa and then subjected for 1 Gajaputa. And it is repeated for 10 times to obtain proper brick red colored Abraka Basma. Shutaputi and Sahasraputi Abraka Basma. To obtain Abraka Basma, which is effective enough in curing all the ailments in which it is indicated, the Shuddha Abraka has to be subjected to minimum of 10 to 100 putas. But however, to obtain Abraka Basma fit for Rasayana purpose, it should be subjected to minimum of 100 to 1000 putas. The Divya Abra Rasayana, which is said according to Rasaratna Samuchaya, where Sattva Golaka are heated till red hot, then immersed in kanji with grains and they are hammered with base of iron. These 4 pieces are again heated and immersed in kanji. Powder is stir-fried with grita and again roasted in juice of amalaki. Powder is mixed with juice of punarava and vasaka and kanji and added with equal quantity of gandhaka and given gajaputa. The indications are as follows. According to different texts like Rasaratna Samuchaya indicated in Kshaya, Prameha, Pandu, Kushta, Jwara, Grahani, Shula, Shwasa, Kasa with Anupana as Vidanga, Vyosha, Grita. And according to Rasa Chikitsa indicated in Prameha, Raja, Ikshma, Rakta, Pitta, Mutra, Krutra, Vitradi and Dushtavrana. Anupana with Haridra, Swarna, Basma, Haritaki, Guda, Sugar, Ela, Bokshura, Grita and Durvasa. According to Rasatarangini, Ruchikara, Keshya, Rasayana, Klaibya and Ayurvruddhikara and Anupana with honey. Ayurveda Sarasangraha explains indicated in Prameha, Kshaya, Virya Vruddhikara and Anupana with Haridra, Pippali, Swarna Basma and Raupya Basma. The Gunakarmukatar, it is having Gauri Teja Paramamrutam. Main Gunakarmukata is Vatapitta Kafagnam. It is Pragnabodhi, Prashamati Ruja and it is Vrishya, Ayushya, Agram. So it is considered to be Ayushya Agram and Balya Snigdha Ruchi Akafa, Deepanam Shita Viram Tatodhago, Sakala Gada Rudha Vyoma, Sutendra Bandihi. The rasa is having Madhura, Guna is Snigdha, Virya is Shita, Karma is Netra, Balya, Medhya, Rasayana, Ayushya. Dose is 1 to 2 Rati, which Anupana of Grita, Madhu and Dugdha. Amayaka Prayogas of Abraka Basma are in Jwara along with equal rasa Sindura with honey, Netra with Papali Churna and honey, Grahani with Trikatu Churna and Grita, in Raktapitta, Haritaki, Guda, Ela, Pandu or Kamala, Abraka Basma to be given with Trifala, Trikatu and honey, Prameha in Haridra with Haridra Churna, Pippali Churna, in Mutra Krutra with Bhumi Amla, Gokshula, Ela along with Grita. In Arsha, Pandu or Akshaya, Halimaka, administered with Trikatu, Trifala, Chaturjata with honey. As a Vrushya, we can give Abraka Basma along with Swarna Basma. In Mutragata, Ashmari or Mudra Krutra along with Astakshara to heal the wounds. In Balya, for the Balya purpose, with Kshira Kakoli Churna followed by milk. And as a Rasayana, along with Lavanga Churna can be given. Shukra Stambhana Shakti to improve the premature ejaculation. Jati Phala Churna followed by Bhang Swarasa can be added. Vataja Rogas as a whole, Vataja Rogas with Shunti, Pushkaramula, Bharangi, Vamshalochana can be given. In Pittaja Rogas, Chaturjata and Khanda Shakara can be given. And Kafaja Rogas, Abraka with Bippali Churna, Kajjali, triturated 7 times with Arjuna Kwata can be given. And coming to Rasayana effects are the Sattva of Abraka, Abrasatvam Sushishiram, Madhuram Ruchiram Param, Susnigdam Kesham Ayusham, Tridoshagdam Rasayanam. Instead of using Rasadravya in incinerated form, it is always better to use in incinerated Sattva. The properties are it possesses Shita Virya Madhura Rasa and it is appetizer Snigdha Keshya Ayurvardaka Tridoshnagdam and Rasayanam. Coming to Vajikarana effects, it is judicious use makes the person so virile that person becomes capable enough to satisfy sexually strong partner and can initiate healthy conception. This sattva can bring in radiance to face and makes to lead 100 years of life. There is no other safer and better medicine than this for which does pushti, humsattva janana, vayasthapana. The apatya during this are Karira, Karavellaka, Karakati, Amlabadara, Tailakshara, Bruntaka. Semen-related disorders we can give with Abrakabhasma in equal quantity with Swarnabhasma or with equal quantity of Rajatabhasma and Swarnabhasma can be administered. The mode of action, the role of Putta in Abrakabhasma as Shata and Sahasra Putta. Putta done repeatedly lead to increase in the fineness of Bhasma, bring about the changes in the structure, composition, arrangement of molecule and thus formation of newer compounds. Increase the number of Putta, increase the bioavailability of the drug by reducing the particle size. In case of Abrakabhasma, specific number of Putta has specific therapeutic action, that is with increasing number of Putta, the Yoga Vahi guna of Abraka increases and acts as Rasayana. The formulations containing Abrakabhasma are Arogyavadini Vati for skin disorders, Gagana Parpati for Pandukshaya Kasta Shwasagrahani, Panchamrita Parpati with Grahani Aruchi Arsha Chardi, and Prabhakaravati in the Rudrauga, Yogendra Rasa Vatavadi, Chandramrita Rasa Kasa, Saubhagi Shunti Paka with Prasata Rogadikara, Vasada Kusmakarasa Madumeha, Brihatpata Chintamani Vatavadi, and Shwasaka Chintamanasa, Hika Shwasa Rogas. The research updates are so understanding the effect of Abrakabhasma on genotoxicity and its DNA repair potential in mouse model. So it says that the present study aims to understand the effect of Abrakabhasma on genotoxicity, DNA repair and other mechanisms in mice test model. And this data obtained indicated that Abrakabhasma is not a genotoxic and reproductive toxic. The antioxidant potential of the DNA repair of hemantic properties of Abrakabhasma may be attributed to synergistic actions of bioactive compounds and hence it acts as a rasayana. Thank you.
Thank you, Dr. Vaishnavi Kulkarni. Thank you for the wonderful session. Next, I would like to invite Dr. Shubham Gajanan Yadav for the paper presentation on the topic Patya. Dr. Shubham, are you there? Dr. Shubham Yadav, are you there? Please unmute, doctor.
Yes, sir.
Good evening, doctor. Please start the session.
Good evening, sir. Good evening, everyone. Myself, Dr. Shubham Yadav from the Kaya Chikitsa Department of Dr. D.Y. Patil Ayurveda College, Pimpri, Pune. The topic of my presentation is Patya. As we all know, the provision of Ayurveda is for Swasthya Swastha Rakshanam and Aturasya Vikar Parimuksham. In order to keep every individual healthy, the three doshas, Sapta Dhatu, Trimala should be in their equilibrium state. If any person loses their equilibrium, person may get diseased. So therefore, Ayurveda has stated some patyas for this, and they are patya. Patya is the ahar vihar that calms the mind and beneficial body and provides nutrients, and apatya is exactly opposite to it. But the patya word is derived from patha, which means channels or the way. The synonyms for patya are Satmya, Swastha Hitkara, Upashaya, Swastha Paripalaka, Hit Ahara, Swastha Urjaskara, Shram Kara, Dhatu Avirodhi, Sukha Parinam Karaka, Dhatu Samanya Kara. Synonyms for apatya are Asatmya, Swastha Hitkara, Ahitkara, Anupshaya, Asukh Parinam Karaka, Ashram Kara, Dhatu Asamya Kara. General Patya. Acharya Charak has stated some diet which should be always consumed by the healthy person. Food article which includes shali, mudka, sendav, amalki, rainwater, ghee, and honey. Similarly, Acharya Charak has also mentioned some food articles which should be avoided by the healthy individual. These articles consist of dried vegetables, lotus, rhizome, and stalk, and one should never consume meat of deceased animal. The Charak Samhita has described some of the important patya for various diseases. They are as follows. Patya ahara in Jirna Jwara. Yavagu, Odan, Laja are used in a patient suffering from Jwara. Raktashali along with Shastik type of rice should be used only after they are become Purana. Patya ahara in Raktapitta. Shali, Shastik, Nivara, Shamaka, and Priyangu, etc. Patya ahara in Gulma. Old corns, cereals, meat of animal soups, mudga, kulatha, vegetable dishes, prepared of pipali, nagar, bilva, chitrak, prepared by adding bijapurak, amla vetas, shara, dadima, buttermilk, oil, and ghee. Patya ahara in pramaya. Barley should be consist Barley should be constituted of principal ingredient of food of the patient suffering from pramaya. Old shali rice cooked and mixed with soup of mudga, etc. Patya for madhumeha. This consists of various vargas, shukadhanya, जीर्णशाली, षष्टिक, कोद्रवा, यव, गोधूम, उड्डालका, शामका, शिब्बी धान्य, चनका, आडकी, कुलत्थ, मुदक, शाक वर्गा. The leafy vegetables with the predominance of तिक्त कषाय रसा, पटोल, कारवेलक. फलवर्ग, जंबू, आमलकी, कपित्थ, तालफला, खर्जुरा. तैल वर्ग, सरशप तैल. पथ्य आहारा फॉर स्थौल्य. अन्न वर्ग, पुराणशाली, रक्तशाली, षष्टिकशाली, यव, चनका, कुलत्थ. जल वर्ग, शीतल जल, पंचकोल सिद्ध जल, शुंठी सिद्ध जल, मधु. मध्य वर्ग, पुराण सिद्ध. मूत्र वर्ग, गोमूत्र. क्षीर वर्ग, तक्र. शाक वर्ग, पटोल, कारवेल्लक, वर्तक, निंबपत्र. पथ्य पथ्य अकॉर्डिंग टू ऋतुचर्या. पथ्य पथ्य अकॉर्डिंग टू different ritus. Regimen of winter season. Pathya. Take annectus, sour, and salty juices of meat, of aquatic and marshy, which are fatty. Drink Madira Sidhu and honey. The meat of burrow dwelling animals, and prepared of animal of Rasaha. Take preparation of cow milk, cane juice, fat, oil, new rice, and hot water. Wear heavy and warm clothes. Massage application oil on the head. Fermentation of Jentak process. Apatya. One should not expose himself to cold. Avoid food and drink which are light and they are liable to vitiate vata. Underfeeding and intake of gruel are also to be avoided in this season. Regimen for Shishir. Similar to the winter season. The cloudy, windy, and rainy conditions should be prevented. Avoid taking possess of pungent, bitter, and astringent taste. Drink a light diet, and cold should not be taken. Regimen for spring season. Patya. With lukewarm water, the excretory orifices should be cleaned frequently. At the advent of spring, one should habitually resort to exercise, anakshan, smoking, gargling, and collyrium. Take food consisting of barley and wheat, meat of sarshaba, shasha, lavanda, kapinjal. Lap his body with chandan and agru. Apatya. Avoid heavy anactus, sour, and sweet diets. Avoid sleep during daytime, that is divaswap. Regimen of summer season. During the night, after having a basement, the body with chandan paste, one should sleep or one should sleep in the house, open, airy roof, which cooled by moonlight. During daytime, one should sleep in an air-cooled place. One decorated with pearls should be comfortably seated on the chair, enjoying thanks and touch of tender hands. Apatya. One should either drink alcohol in little quantity or should not drink at all. And even if one drinks, he should drink along with plenty of water. Avoid exercise. Avoid taking diet which are excessively sour, pungent, and hot. Regimen for rainy season. Patya. One should generally use honey in preparing diets, drink and other. Take such of diet as are conspicuously sour, salty, and anactus. Drink the madhvika and arista type of liquor. It is advisable to rub the body, apply anakshan, take bath, and wear fragrant garlands during the seasons. Apatya. Avoid the taking of mantha diluted in excess. Day sleep, frost, moving in the sun, water from river should be avoided. Excessive exercise should be avoided. Regimen for autumn season. In this season, sweet, light, cold, and bitter food and drinks which have potentialities to to elevate pitta. The meat of lavanda, kampinjal, ena, uraba, sharba, shasha, barley, and wheat. Intake of ghee prepared with the bitter medicines, purgation, and bloodletting should be done. Use Use Hanshodak, Apatya. Avoid taking sun bath, vasa, tail, meat of aquatic and marshy land animal. Alkaline salt preparation, curd. Avoid the sleep during daytime. Importance of Patya in Ayurveda. It nourishes body. It provides vitality, complexion, and happiness. Promote longevity, enhances voice, promote growth of tissue, make your body workable and healthy. Provide nourishment and strength, enhances intelligence. Thank you.
Thank you, Dr. Shubham Yadav. Thank you for the wonderful presentation. Next is a paper presentation. I would like to invite Dr. Aishi Umay Soni for the paper presentation on the topic Approach to Ayurvedic Management of Sciatica, a case report.
Good morning, everyone. Myself, Dr. Ayush Soni, first year previous scholar from Department of Ayurveda, Adhishtita from Ayurveda Mahavidyalaya, Belgavi, Karnataka. This topic for paper presentation is Approach to Ayurvedic Management of Sciatica, a case report. Introduction. Hydrosis, commonly known as sciatica, typically manifests as low back pain radiating down to the thighs, calf region, and eventually to the foot. It presents with pain that travels along the path of sciatic nerve, associated with sensation of tingling, numbness, stiffness, and pricking feeling. This condition predominantly affects individuals in the middle to elderly age groups. The condition is specifically marked by pain resulting from pathology affecting the sciatic nerve or its originating nerve roots. Typically stemming from L4 through S2 nerve roots, which converge to form sciatic nerve as it extends the pelvis. This is divided into two types depending upon the involvement of dosha, vatas, and vatkafas. The signs and symptoms of febrile vatas are pain, pricking sensation, twitching, and buttock, low back pain, and stiffness. The vatkafas is associated with symptoms of heaviness, anorexia, and drowsiness. Ayurveda categorizes Rudrasi as a vata disorder for which it advocates both Shodhan, Karma, and Shamana Chikitsa as therapeutic approach. Shamana Chikitsa involves internal medication, while Shodhan and Karma involves purification methods such as Basti Chikitsa. This case report underscores the significant contribution of Ayurveda in effectively managing sciatica through its holistic treatment modalities. Case report. A woman is 62 years approached the outpatient department of the hospital complaining of pain on low back region radiating to bilateral lower limbs since last 2 months. Chief complaints: low back pain radiating to bilateral lower limbs, stiffness in calf region and thigh muscles, heaviness in bilateral lower limbs, and difficulty in walking. All these complaints are since 2 years, which is identified since 2 months. History of present illness. According to the patients, it was asymptomatic 2 years back. Gradually, due to her occupation of sewing for long hours, she started developing low back pain radiating to lower limb, with pain and stiffness in calf and thigh region, left more than right, along with difficulty in walking. Associated with heaviness in lower limb on inquiry, she told that pain is identified since 2 months, which is not relieved, hence visited our hospital for same. History of past illness. History of fall while walking 4 years back. Known case of hypertension since 6 years on medication tablet amlodipine 2.5 mg body. Personal history, Vayaktik Vrittanta, appetite mildly reduced, thirst normal, bowel unsatisfactory, urination normal, sleep disturbed due to pain, diet vegetarian, dominance of Dravya in diet, Shaka, Dadi, Evam Laguahar, dominance of Rasa in diet, Kashayaras, Vasana addiction, tea, Matra 1 cup, Kala rice tea. We had a Jveniyam doing saving since 40 years, Nidana, 6 to 7 hours per hour. General examination build was moderate, nourishment is moderate, temperature of febrile, pallor absent, cyanosis absent, lymphadenopathy absent, edema absent, pulse rate 78 per minute, blood pressure 130/80 per mm Hg, respiratory rate 18 per minute, weight 64 kg, height 155 cm, and BMI of 26.6. Ashtashan Pariksha, Nadi Pariksha, Prakriti Bhatkafach, Gati Sarpa, pulse rate 68 per minute, Malak, Asantushta, frequency 2 to 3 times per day, Mutra Samyak, frequency 4 to 5 times per day, Jiva Lipta, Shabda Prakrit, Sparsha Shamashikoshna, Druka Samanya, Akriti Madhya. Dashvik Pariksha, Sharira Kafa Pradhan Vatash, Mansika Sattva, Vikruti Vatkafach, Sara Madhyam, Sahanan Madhyam, Satna Sarva Rasatna, Sattva Madhyam, Ahar Shakti Avara, Vyayam Shakti Avara, Pramad Madhyam, Vaya, Vidhavastha, Agni Pariksha Mandya. Systemic examination, central nervous system, conscious and well-oriented to time, place, and person. Cardiovascular system, flexibility felt that fifth intercostal space, S1 and S2 heard, no added sounds or movements heard. Respiratory system, shape of chest, bilaterally symmetrical resonance sounds heard, except the cardiac dullness. Auscultation normal, vesicular blood sounds heard. Perineum, soft and tender, per rectal, hemorrhoids between 8 and 11 o'clock. Musculoskeletal examination, gait, limping with support, doorbell test was positive at L4 and L5. MRI findings, sacralization of L5 vertebral body, L4, L5 disc reduced to disc height, diffuse central and bilateral paracentral posterior disc bulge noted, compromising neural foramina, indenting thecal sac with compression of bilateral existing L4 nerve. Lower limb examination, special test, SLR, positive on bilaterally left 30 degree, right 35 degree, Bregal's test positive bilaterally, femoral nerve stretch test positive bilaterally, Faber's test positive bilaterally, point test possible with pain, heel walk not possible, toe walk possible with pain. संप्राप्ति घटक due to long hours of sitting since 40 years, दोष वात का फजल, दोष धारण, रसा अस्थि मांस मज्जा, स्रोता and स्रोतदृष्टि type संघ and विमान लिगामेंट, अग्नि जठराग्नि मांद्य, उद्गासन प्रकाशन, अधिष्ठान कटी, speak, उरु, संचारस्थान कटी, speak, व्यक्तिस्थान, स्नायु शिला, क्रियाकाल व्यक्तावस्थान, रोग मार्ग अभ्यंतर व्याधि स्वरूप चिरकाली. Materials and methods, constitutional with Gandhara study and 60 ml along with 60 ml vision. Total Vegas observed for 7. Sarvanga Rashmi Parikshit followed by Nadisit for 7 days. Kati Basti with Mahavish Garvatel for 7 days. Shodhana, Anvasan Basti with Dhanvantar Tel for 5 days. And Niru Basti with Dashamal Niru with Kalka, Shatapushpa Govichi and Yashmi for 3 days. Shamana, Rasa Sapta Kashaya 15 ml BD. Tablet rule 2 tablets twice. Tablet Shalaki MR 1 tablet twice. Capsule Dhanvantara 101 1 tablet twice. Results followed. Following the completion of comprehensive 7-day Ayurvedic treatment protocol, the patient experienced significant improvement in lumbar pain, reduction in heaviness, and increased range of motion in the spine. Additionally, there was noticeable enhancement in the gait. Patient reported complete relief from symptoms. Evaluation of patient's progress was conducted using specific subjective and objective criteria, with no post-therapy radiological investigations performed. Subjective, patient's complaint of pain in low back region radiating to lower limb has significantly reduced. Heaviness and stiffness in bilateral lower limb reduced. Patient is able to walk without support. Tenderness over L4 and L5 was reduced. Objective gait is improved. Lower back test negative. Special test done after treatment was SLR test negative bilaterally. Bregal's test negative bilaterally. Femoral nerve stretch negative bilaterally. Faber's test negative bilaterally. Point test, heel walk, and toe walk was possible. Discussion. The treatment protocol was formulated on the basis of principles of Acharya Charak and also mentioned as embryo Saita for treatment of literacy. Treatment plan was adopted by Lakshana and Dosh predominance. On the first week, Koshtashodan, that is Mruda Virection with Gandhava Sari was adopted for Vatanulumi. For getting rid of Ama Avastha and Kapha predominance, Shuntri Siddha Jal was given along with it. Svedana as it act as Stambhanga government was usually in nature it performs Stotoshuddhi and Ampachan which relieves Stambha. It results in dissolution of Kapha, that is Stotoshuddhi, softens the channels along Vata to throat legally. Tashmalpa Parishik mainly used for Vatana and Kapha properties, which also has impact on Rasa, Mounts, and Astadhatu, along with analgesic and antispasmodic effects. Local synthesis rhythms for Katibasti is hot fermentation, which reduces muscle spasm and induces vasodilation, promoting blood flow, which helps the duct to reach the target organ. And thus, the absorption of oil, its penetration, neural stimulation aids in anti-inflammatory and analgesic action of Katibasti. Whereas Mahavishwarbatel reduces pain and stiffness in joints and does Vatashavana. Basti Karma is mentioned as important chikitsa from literacy. Also, the medicine given through the rectal route have proved to be more effectively absorbed in larger quantities than the oral route. As Pakvasha is Mulistan of Patadosha, Basti Act on Pakvasha and elevates the Vatadosha, which is the main causative factor of literacy. Dashman Niru was selected as it is Vatashamana, Vedas, Tapali, and Shutana properties. And Vasabasti with Dhanvantar acts as a Vata Roga. Thank you for your patience listening.
Thank you, Dr. Ayushi. Thank you for the wonderful session. Today's presentation seems to be over. There is a final call of some participants. Dr. Deni Sevak, are you there? Dr. Deni Sevak, are you there? Dr. Vaibhav Subhash, are you there? Dr. Vaibhav Subhash, are you there? Dr. Rajani Angadi, are you there? Dr. Rajani Angadi, are you there? Dr. Jodi Lakhlan, are you there? Dr. Jodi Lakhlan, are you there? Dr. Sumit Bausahib Galande, are you there? Dr. Sumit Bausahib Galande, are you there? As we come up to the end of Adhishtitha National Seminar presentation, I want to extend my sincere gratitude to all who have been a part of this enriching event. First and foremost, a special thanks to all the participants whose active involvement and support have been the driving force behind the success of this program. Your engagement and dedication have truly made a difference. I also want to express my heartfelt appreciation to the esteemed panel members for their invaluable contributions and guidance throughout the seminar. Your expertise and commitment have played a vital role in shaping the discussions and ensuring the quality of the presentations. On behalf of the organization, I extend a warm thank you to all the members of Ayurapta who have worked diligently behind the scenes of ensure the smoothly execution of this program. Your hard work and dedication have not gone unnoticed, and we are deeply grateful for your efforts. Throughout the seminar, we have explored a diverse range of topics, each holding significant relevance to our daily lives. From healthcare to technology, from the sustainability to education, the breadth of the discussions have been both enlightening and thought-provoking. As we conclude, let us carry forward the knowledge and insights gained from the seminar and apply them in our personal and professional lives. Let us commit ourselves to action and avoid the trap of procrastination as we strive for continuous growth and improvement. Once again, a big thank you to everyone involved in making this seminar a great success. Your contributions have been invaluable, and I look forward to future collaborations and endeavor